Let's go. Welcome, welcome, welcome. Bagel's here. Addie's here. What is up, everyone? What is up? Hey, how's it going? Hey. Uh-oh. I hear a little voice, guys. Hello. Hello, 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 hello. Sorry about that. All right. Yo, 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 yo. Welcome, welcome, welcome. What's MB Commies here? Ducray, Bagel, Nico, Jen. Oh, man. The whole crew's here. What's up? Sorry about that. I had a little human that needed me. Hi. Oh, what's up, Frank? How's it going, dude? Guys, one of my favorite things, is what? We got a vaccine already? Are we gonna do the vaccine party already? Hi. What's up, Melanie? Okay, guys. Well, we have to wake up the vaccine board, right? So we got to do Mava or V's, however you want to do it. Here we go. We got to go. Let's count it down. 3, 2, 1. Whoa. Whoops. That was the wrong one. Oh, that was so silly. This soundboard's so silly sometimes. Sorry, guys. Technical difficulties. Yes. Make America vaccine. Our vaccines, guys. We renamed it, okay? It's just not vaccines. Okay? It's not vaccines. It's our vaccines, right? It's not me, it's us. Our vaccines. Guess what? How many lives do vaccines save every year? 5 million lives a year. Vaccines save. Incredible. Isn't that incredible? I love that stat. I love that stat. And we already have. Are we going to do a vaccine party? We should. We should. What's up, SK Anna? What's up? It definitely is RD. It definitely is, bro. I mean, if you guys want, we could just do the vaccine party right now. We can add some. Who's got vaccinated? What's up? How are the vaccinated people and homies doing? Do we got it happening already? Who got vaccinated? Pagel, you said you did? Ado said Pagel did? Oh, okay, awesome. Pagel, what'd you get, dude? What'd you get? Oh, okay, nice, dude. Nice. Big cheer for Pagel. Yeah, good job, man. Good job, man. Good job. All right. So that means that we got one more. We're going up to 56 in 3, 2, 1. Oh, likes it. Woo! I love it. Pagel, we love you. We love people that vaccinate in this community because we love people that look out for one another. We appreciate you and we love you. So thank you for taking public health seriously. Thank you for trusting science and looking out for one another. You gotta love it. You just gotta love it. Love to see it. I do love to see it, man. I do love to see it because that means that you love yourself, you love your community, you love the people around you, you respect them enough not to hurt them. That's a big thing. A big thing. How's this last sub thing looking for? Can you see this, guys? Can you see this right here? Is that good? I'm looking for making sure that it's in the right spot. Subbing's the best way that you can appreciate and help out the channel. So I want to highlight those people. Oh, what's up, Gloomy Moss? Guys, if you like microbiology, or even if you don't, and you want to wonder what microbiology is, Gloomy Moss is in the chat. Shout out to Gloomy Moss, one of the coolest microbiology streams on the internet, I think. So fun. It is, really is. It really is. Hey, yeah, there she is. Guys, follow Gloomy Moss. All right, let's hit her with some follows, guys. She is awesome. All right, guys. Well, I think we can chill with the lights now. Let's chill. There we go. Perfect. I love it. All right, guys. Well, it's the same thing as last night. So we're gonna have this. If you want to just do audio only, you want to audio only this. So the full video and the stream, we're going to be reacting to the rest of the hearing. And we're going to be talking about and reacting to what he says. Which, guys, let's be honest, it's a lot of nonsense. He has no idea what he's talking about a lot of times. It's actually wild. That's a good question, Jay Shellman. I mean, you can honestly probably on YouTube, it has chat. You have chat. You got the YouTube chat and everything all together. I would probably watch it like on YouTube if I were you, but like this is more interactive and stuff. But like you can, I have the camera up. You're watching the camera, the same thing. But you can like maybe put it on a TV, like second screen it. Oh, dang. Messy Mempat. Wow. Thank you. Wow. Thank you so much. Thank you. That's really nice of you. Thank you for the galaxy. That's really nice. I do, Jay Shellman, but that's, it's yeah. Thank you. Thanks for asking. I don't get any views on my YouTube. I guess since we're talking about it, I am kind of revamping my YouTube. So before it was just an archive of all my lives, but now I'm doing a specific YouTube stream. And on top of that, I actually have on my YouTube, I have highlight videos of the entire conversation. So we have some really gnarly and amazing 1 hour conversations. Good morning. Hey, what's up? And that's all on the YouTube now. So if you guys, the best conversations that I've had, the best highlights, we're talking like, hour-long videos that are way better, uncut, way better than the 1 minute stuff that I can do on TikTok. So, oh, cool. Thanks, Messy Empath. Thank you. And so yeah, so I'm basically revamping my YouTube, trying to put like full show highlights there. Not just an archive of the 4 hour thing. This is actually like the best conversation. So 15, 30, 45 minute, 1 hour videos. Yeah. Cool, guys. All right. Well, we're going to start since we have an hour and a half left to go. So we need to go. We're going to watch it on 1.2x just so that like we can get through it. I'm going to pause it, but yeah, the audio is going to come through and you guys can kind of see. So we'll test it out right now. 3, 2, 1.
Senator Cortez Masto.
Secretary Kennedy, thank you for being here. In May, you said, and I quote, "I stand with President Trump to say, no more middlemen, no more foreign freeloaders, no more skyrocketing drug prices. We're putting American patients first and taking on big pharma to make America healthy again."
Nice. How are you guys feeling? Good. Nice. Sick. This is a senator. I don't know what her name is yet. Make America healthy again by apparently getting them diseased. Oh, wow. Oh my gosh, another one. Dude, wow. Thank you. Thank you so much, Messi. Thank you. That's really, really kind of you. Kathleen, what's up? How are you? Thank you guys. Oh man, thank you guys. You're being so kind. I appreciate you. I appreciate you guys so much. So we're reacting to, it is Senator Castro. Okay. Oh, sorry, Siggy. I know. Yeah, I agree. We're gonna. I think something happened halfway through her testimony, her minute. I think my internet cut out or something happened last night. Weird happened last night. So it's not gonna happen again this night. We're dialed in. We're focused. We're locked in. We're locked in, guys. Internet's not gonna cut out. Okay. I think the signal got disconnected. Something like that. Sorry. I fell asleep, guys. That's what happened. I need to understand what you stands. Oh, what I stand. Well, I'm a scientist, so I really love science and data and all that kind of stuff. That's what we normally like talk about here. We talk about that kind of stuff. Does that really save lives? Yeah, it does. Vaccines save 5 million lives a year. It's pretty incredible. So what you don't read is the data on the vaccine injured. My thoughts and prayers are with them, social work. And I honestly think a lot of the vaccine injuries, it's psychosomatic. I really do. I think it's a mental health issue. So I don't think that a lot of those are actually vaccine injuries. It's a bunch of people getting pumped full of fear and doubt and anxiety from people saying that they wrongly got poisoned in them, and it's actually the people that are anti-vax that are causing it. Yeah. Thank you. Well, I'm happy that you're here, social work. Thank you for being here. Thank you for watching. It is psychosomatic. It really is. It's a mental health issue. Yeah. Thoughts and prayers, bro. Thoughts and prayers.
In July, Republicans handed Big Pharma a massive win. Their big, beautiful bill that they just passed shields billion-dollar drugs like Keytruda, the world's top-selling cancer drug, from Medicare negotiation. Keytruda has been on the market since 2014. It pulled in nearly $18 billion last year in the United States alone.
Jeez.
It costs patients up to $175,000 a year.
$175,000 a year. Wow. Oh, nice, dude. Siggy Cam. Welcome, dude. Welcome. These are your people. Lab mom. We got a lab mom in here. Dude, I love it. What's up, guys? All right. All right, guys. Dude, I love
draining
it.
Medicare of billions and forcing families into crushing debt or to forego life-saving care. And yet you support the big, beautiful bill. So despite the high
I don't know, social work. Can you imagine telling a mom that just got their kid buried because of a school shooter that they died because of mental health and not of a gun? I don't know. You guys do it all the time. So makes more sense than what you're spewing. So deal with it, bro.
with executive orders and Washington Republicans only drug pricing law days relief for Medicare patients relying on high-cost cancer drugs. Meanwhile,
yeah. Deal with it, bro. Facts don't care about your feelings, bro. I don't care.
Democrats finally have allowed Medicare to negotiate drug prices.
We got a cry bully in chat. Guys. Cry bully.
I will say that Keytruda, along with Opdivo and Darzalex, the three top-selling cancer drugs, were widely expected to be selected for Part B negotiation in 2026 for 2028 implementation. They are now, because of the actions of this administration, exempt from negotiation for at least several additional years,
Great.
if not permanently. So my question to you,
Great
Mr.
job.
Secretary, is how do you justify claiming to take on Big Pharma while supporting a bill that shields drugs
Owned.
like Keytruda and other cancer
Owned.
drugs from Medicare negotiation?
Brutal. What are they going to say? What? We got another one? Oh, what? Oh, Carrie, let's go. Carrie, that's awesome. Good job. Everyone, let's all cheer for Carrie. Good job, guys. Carrie. Good job, Carrie. All right, let's go. Ready? 3, 2, 1. Oh, shoot. Sorry. Let's go. No, dude, I really do think a lot of the mental health, the people that think their vaccine injuries are psychosomatic. I really do. Because like, have you guys ever been to like a party or something and you feel fine, and then you have a friend that says like, "Oh man, did you eat that cobbler? That I feel so weird afterwards," and then immediately like your stomach feels like weird and queasy afterwards. I know it requires you to go to a party and have friends, which a lot of the anti-vax people don't have, but it's actually where like other people go, and then you like share like meals, and you have friends. So it's a weird thing. You'll figure it out. I don't want to ruin the surprise and like it's what happens, but anyway, it is real. So yeah, sorry guys. Not tonight, Garrett.
Costing
Not tonight.
seniors and taxpayers billions, and risking the lives of cancer patients who cannot afford the
True.
necessary medication.
Yeah, Senator, I appreciate the question.
Yeah, friends are real. Viruses are real. Yeah, vaccines do save lives. Those people are real. These people are real. 30 years in nursing, people don't think the brain is capable of creating realities based upon beliefs. I don't know if you're being real or not. Which first this year? You're just doing both at the same time, Sweet Pea. You're just doing both at the same time.
The Medicare drug negotiations in the IRA were very well intentioned, but they were poorly structured. What we found is that the negotiations that have occurred actually have ended up raising the costs for Medicare. We are right now in
The
negotiations.
CBO has not agreed to that. The CBO
No,
doesn't say that.
that's-
It's just the
that's
opposite.
CMS
So you're saying the
data.
CBO and independent agencies that validate the costs are wrong?
That is CMS data.
Okay,
That's
so let's
actually
just focus
raising-
on the cancer drugs. Why aren't we?
So he's saying that the CB, yeah, sure, Garrett. Thank you. All right.
Negotiating those, bringing those down for families. Why does the bill exempt those?
Yeah, dude, Siggy, it is sad. It is sad. Oh, sick. Oh, nice. Carrie, did you get 2 vaccines? We got 2 vaccines? Nice. We count family members here too. A family that gets vaccinated together lives together, guys. Let's count it down. We count that. Ready? 3, 2, 1. Let's go. Let's go. Let's go. All right, guys. I love it. I love it. Let's see here. Stream. All right. Mava. Make America vaccine. Yeah. Well, it's 58 of our followers, of their family members, and that's just this week. That's just this week, guys. Like we are like just it's incredible. It is awesome. Oh yeah, social work chronicles. I've been getting vaccinated my entire life. What are you talking about, bro? I've gotten every booster, every shot. Remember every single time how the conspiracy people got wrong on every single issue? Isn't that amazing? Hydroxychloroquine, ivermectin, that everyone was going to die within 6 months of the vaccine. Everyone's going to die within a year, 2 years, 3 years, 4 years, 5 years. The nonsense that dribbles out of your guys' mouth is just unregulated and ungurgitated bile that has no space in reality or society, man. Just myocarditis. You know, you realize that myocarditis rates are 5.8 times, 580 times more relevant with COVID-19 than the vaccine. You realize that, right? If you care about myocarditis, you get vaccinated every single time. You get vaccinated every single time. They didn't die, Elizabeth Williams. They did not die. That is not true. So again, guys, you're just speaking absolute dribble. Siggy, I would get vaccinated. I would get vaccinated as soon as you can. Okay, Zen. Yeah, that's fine. You can believe that, bro. Dude, you're just speaking nonsense, social worker. I don't know what you're talking about. Again. Myocarditis is not an adverse side effect. It's a temporary thing that goes away without even being hospitalized. So it's just, you're speaking nonsense. And again, the myocarditis rates from the Myocarditis Foundation says it's 580% worse with COVID-19 than it is with the vaccine. So again, you're just absolutely speaking nonsense. Okay, Shay, they did not die from the vaccine. They did not die from the vaccine. You're just speaking, again, nonsense, guys. People need to stop being coddled. You're being coddled to and lied to, and then you come in here and you speak this nonsense and you think that they how would you know, Zenon? So Zenon, you watched another random chatters like talking of like their parents die and from there is no virus. Exactly, Morgan. See, this is what you guys do. Isn't this wild? It's like, why would we need a vaccine if there's no virus? Because viruses don't exist. So what is this nonsense that you guys are spewing is absolutely incredible. You're just absolutely... Hey, what's up, Omar? Omar, what's up, brother? Nice to see you, man. Dude, love you guys. Love to see you guys in chat. Thank you guys so much.
It's part of the MFN.
Okay. Yeah, Pagel, as long as you get both of them, it's fine, man. Like genuinely, like whatever. I think it's yeah, Gian. Gian, I don't know if you know this, but every single person that's ever died from a disease had an immune system. I don't know if this is a breakthrough moment for you, maybe, that every single person has an immune system. So, the idea. Oh, thank you, Zenon. I love it. I liked how you guys were blaming me for ad hominem attacks, and now you're just saying whatever nonsense comes to your mouth. I love it. Thank you, guys. It's so, I don't know what, having RFK in the title brings in all these anti-vax people in the chat, and I absolutely love it. You guys spam the chat, and you guys watch more than anyone else. And I look at your stats, and I look where you guys are, and you guys are watching hours and hours and hours of the stream, every single stream, and I love it. I appreciate you guys. You guys push this stream into the 99.9% of TikTok streams. That's why our numbers are off the charts. Thank you guys. We are the highest, biggest TikTok stream constantly because of you guys, and I appreciate you guys. Thanks for being here. And honestly, guys, anti-vax people, I would like that you're watching genuinely, because maybe there's some way, something, some legitimate question that you might have, just like and maybe you guys could pick it up, and you could come here and actually ask that question, and I can be your science friend. I can actually be that person that answers that question. That would be amazing. I would really appreciate that. But okay, I'm a fraud and don't know it yet. Oh, that's nice. That's nice. I wish I was. That'd be really nice. Yeah, social work. That's true. That's true. All right, here we go.
Negotiations. I'm not sure of that provision in the bill, of the one beautiful bill by the.
You're not sure of the provision, the negotiation provision, and how exempted
For Keytruda.
Your agency is responsible for that negotiation, and you don't know about it?
Dude.
I know that we're negotiating in the MFN
Let me ask you this, Mr.
negotiations.
Secretary.
Dude, getting
Let me ask you another
obliterated here.
How
just like you
much
guys.
are Medicare Part D enrollees expected to pay for prescription drug coverage next year?
I think that is in debate right now.
Let me tell you.
Are you talking
Wow,
about
how does he not know
They are going to pay
these?
$15 more than last year, up to $50 a month.
How does he not
Let me
know?
have a question for you on Part B. How much are Medicare Part B premiums expected to increase next year?
I don't know.
Dude,
So
he just didn't
that
know
is
the
about
basic
it.
questions. He's like, all these are going to go up because of stuff that he is doing, and yet he has no idea what's happening. He has no idea what his own stuff is, and just absolute nonsense, man. These guys are not serious. He is very ill prepared. Exactly. It is absolutely wild. It is wild, man. Absolutely wild. Let's see here. There we go. All right. I know, exactly, dude. He's so ideologically captured. It's just absolutely insane. He's so uneducated about anything. He has all of the education, all the scientists that he could ever want to actually study this stuff, and he just doesn't do it. It's absolutely wild.
Increased at 11.6% or 21.
I know, Sweet Pea. The Republicans were absolutely ruthless to him. Last night they were talking like, wait, he should get a Nobel Peace Prize, but also all these people more people have died from the vaccine than the virus. How does that even make any sense? Republicans were honestly one of the best parts of last night. I was really surprised.
$1.50 more each month. And again, last time you were before me, you couldn't answer the questions of the very agency and the authority that you have to address these issues. Next year, seniors and families are facing higher healthcare costs across the board.
I know,
23 million
exactly.
people on Medicare with a standalone Part D drug plan could see their
Thank
premiums
you, guys.
rise
Thank
to
you for the
$50
gifts.
a month,
I appreciate
up from
you
$35
guys.
because of Trump.
I appreciate you guys so much. Thank you, man. Thank you, Lips Nurse, Hot Lips Nurse. We love public health here. We're a huge fan of you and what you guys do. My mom's a nurse. My family members are nurses, and the work that you guys do is appreciated and actually recognized here. And thank you. I genuinely thank you.
Trump administration is cutting the federal subsidy that has been keeping costs down. Part B premiums will jump 11.6% to $206 a month in 2026, one of the largest single-year increases in decades. And so for an administration that claims it is lowering costs, my question to you is, what are you going to do to keep costs down for seniors?
Exactly.
I mean, I'm already doing I'm already keeping costs down.
How? By decreasing the amount of vaccines so that they get preventable diseases? How is it $47,000 for a measles treatment versus $100 for a vaccine? Like, where do they think that cost is going to go, guys? That all that cost is going to go into your healthcare premiums. It's going to hurt you. It's going to hurt you. Oh my gosh, it's
You doing
by unaliving them. Yeah, exactly. You're going to save so much money. Then you're not going to have to pay rent anymore. It's incredible. Exactly.
Seniors, knowing that these costs are going to be increasing.
I mean, the program integrity bill, that is the first action that I did when I got in. It's one of the earliest actions in history of a complex regulation by an HHS secretary. A Congressional Budget Office has said that that's brought premiums down by 5%. That's the Congressional Budget Office, which does not like to acknowledge anything that we do.
And does that impact seniors?
Excuse me?
Does that impact seniors? And I know my time is running out. Does that impact seniors? What you just talked about, you're lowering costs. I'm asking you specifically.
We're lowering
for helping
costs.
seniors. Does it impact seniors?
What is he talking
Does
about?
it impact?
Come on. Let me just stop you.
He literally goes, come on. Like, what is wrong with you? Thank you, guys. Melanie, what's up? Thank you. We got so many healthcare workers in the chat. I love it, man. I love it. It's so cool to see everyone coming together for public health in this time right now.
Time is running out, so I appreciate the chairman's indulgence here. My concern is you can't answer the questions. The very agency has oversight over these issues and controls the levers to lower costs for seniors. And you can't answer that simple question.
Kathleen, help me help you. Kathleen, thank you for what you do. Oh man, Gene, I wish I knew. I don't know. It really matters on the on how much is, what's going to happen to hospitals. Yeah, well, I have a tiny platform. I have a tiny platform, the tiniest platform, guys. I have the tiniest platform. I know Southern
We'll just proceed. And Senator Tillis
Thank you.
Has yielded his position to Senator Blackburn. So.
Microwave Mel Gibson. Neurology. Patients are already suffering from insurance denial for treatment. Oh my gosh. That's awful. Oh, thank you guys. Jay Shellerman, thank you. Thank you guys. You guys are being so kind tonight. Thank you. What's up, Ruben? Welcome in, brother. Dude, that is so good. I gotta remember that. Microwave Mel Gibson. I called him a raw bag of meat that was left outside for a week. So, hey, Jennifer, nice to see you.
And thank you, Mr. Chairman, and Mr. Secretary, thank you for joining us today. I appreciate the comments you've made about the Rural Health Transformation Program. That is something many of us worked on, and we were pleased to push that out of this committee. And I know Dr. Oz is moving forward with it.
Oh, that's so nice. Thank you. Thank you.
Implementing that. I appreciate your comments to Senator Warner on the area wage index. He and I have worked.
Hey. FTPG. Oh, thank you for being here. Thank you for being here, FTPG. Appreciate you. Yeah, Oz is Dr. Oz is an MD. He went to, I think, Penn State, which is just so sad, dude. These guys are just grifters, man. They just say this nonsense for a buck, and that's what's so gross is that they go back on the Hippocratic oath. They deny the exact science and institutions that they used in order to get where they are, and they're selling people out. It's absolutely a joke.
Worked on fixing that, and we appreciate your attention. I am delighted to know that you're going to end the revolving door in the conflicts of interest. I have found it so unseemly that people who work with a pharmaceutical or with a big food company then go back over into CDC or NIH or...
What am I grifting about, Amy J? Thanks for being here again, Amy J. Mack. Amy J. Mack is in the house, guys. Amy J. Mack watched over 2 hours yesterday. I appreciate you, Amy J. Mack, just constantly in the chat. Everyone, let's all give it up for Amy J. Mack. Thank you again. Thank you. Just constantly hitting those comments, putting in her hours. Thank you so much.
FDA, and then they're signing off on regulation for their former employer and many times their future employer. So we appreciate that. Senator Langford went to...
All right, Jennifer, there we go.
To you on the PBM.
I am a real doctor,
And as
Lulu.
you
I'm
are
a
aware,
scientist
my
doctor.
PBM Act that Senator Wyden worked with me on, that made it out of this committee last cycle. And making certain that we keep these rural pharmacies open, making certain that PBMs do not profit above what is their standard service fee, and that they have to disclose all their pricing. That is going to be an imperative. So
oh man, Melanie. Oh, you're so nice, Melanie. You didn't have to on your oh man. Guys, Melanie's has some awesome videos coming out. Really cool.
Will you work with us to get that PBM legislation across the finish line and to the president's desk?
Yes, Senator, absolutely.
Thank you. Interoperability is something that you have announced, a new interoperability framework to
Okay,
better
cool, Melanie. Nice. I like it. Social work. Bro, all my, like, you're like, it's so funny that you're like, he's sitting here on TikTok getting paid for pushing propaganda. Who am I getting paid by, bro? Like, isn't this, these guys that, it's like their whole world and the conspiracy, like things that they revolve around, like nothing in their world exists without some type of conspiratorial aspect, right? I can't just be like some guy that's just like has a TikTok stream, right? It has to be like some nefarious thing, like you're getting paid by Big Pharma to be here. There's nowhere. Yeah, who's getting what's up? What ring are you in? You know, it's just like it's just so wild to me. Like I'm literally just some dude that just started streaming like a freaking three weeks ago. Like, what are you talking about, Raven? I mean, what? Are you being serious? Do you really want me to do my bio? I guess. Why are you talking about other people? Huh? Are you okay? Raven, are you all right? Who are you, Raven? Why? I'm really confused. Okay, cool. I'm happy for
on
you.
data sharing principles. And
Is this
this
your
is
job?
important to digital health.
I'm a scientist. I'm a molecular biology. I've done molecular biology in the lab for 16 years. I've done genetics. I've done, and then I also did some nanotechnology work. I did chemical engineering. I've done host strain development. I've genetically modified plants and algae and yeast and bacteria. I've published over 8 times in peer-reviewed journals. I have a PhD in microbiology. So I mean, like, what do you? I grew up in San Clemente. I have you know, like what do you want? I grew up, like, I live in San Diego. Who are all nanotechnology and genetic? Yeah, because social work chronicles. Yeah, of course, because genetically modified organisms are awesome and they help feed people. Yeah, exactly. Yeah, genetic engineering is amazing. Of course. Yeah. NB Kami, thank you guys. It's actually true, Omar. It actually is kind of true. Where in San Diego? Like, who are you, McBride? What are you trying to? That's a little creepy. Dr. T's in the house, friend of the stream. Getting a little creepy. You know, McBride, you gotta, like, if you want to coom, it's all good. You gotta subscribe or at least gift before you get my deets. You know, I'm a eugenicist. No, actually, the people that are anti-vaccine actually are pushing eugenics. Because you know why? Because you are actually pushing the people that were born without an immune system or had any type of malfunctioning immune system. You are pushing them to die. That is literally what anti-vax people are doing. So yeah, it's disgusting that you people are actually, nobody's born without an immune system. Okay, wow. Do you realize that is what people, yes, that does happen. That literally does happen because people are born with a malfunctioning immune system. They're immunocompromised. That's what that means. That's unbelievable. Give me a list of who's not vaccinated. I don't know. Survival is a fittest. I believe that's just nature, right? No, but yeah, Amy J. Mack. So the idea is that we've evolved our society not to just be survival of the fittest. That's the whole idea, is that we can actually look out after one another and we can actually make improvements based off of, science and technology so that all these people don't have to die at young ages. So the idea that you should somehow just be culled from the population if you were born with some genetic abnormality is something that used to happen, but we've gone past that. I mean, no, Carrie, but yeah, thank you. Yeah, D, exactly. Hey, D, I see genuinely, I see you, and these people are absolutely insane for what they do. And we have people that come in here that are immune compromised themselves, that are some of our biggest fans, immune compromised themselves, that have to get IV bags every 3 months because they don't have a functioning immune system, so they need antibodies so that they can survive in the world. We have moms that come in that have kids with genetic disorders that would actually get triggered if they got COVID. So they're actually talking about the importance of kids getting vaccinated so that they don't get SARS-CoV-2 infected themselves. Yeah, that's entirely wrong, Social Work Chronicles. You don't even believe in viruses, bro. So like, why would I ever believe in what you said? So that you're talking insanity. All right, let's get back to this guy. So because guys, y'all are crazy in chat, but you're my crazies. Okay, I love you and I coddle you like the little tryhards that you are, you know. But this crazy, what we're talking about, this crazy though, this RFK crazy is actually the head of the HHS, CDC, all that kind of stuff, and he actually hurts people. And by the way, these anti-vaxxers in chat, you actually are the head of these FDA, the HHS, the CDC. You're the head of these things now. So it's up to you now to somehow create a better vaccine that nobody knows about, or the guys that don't know, that don't think that viruses are real, are somehow going to protect people from diseases. Really excited to see how that works out. Oh, of course, Social Work Chronicles. Say that you say that you agree with vaccine, that the viruses are real. Say it in chat. If I know, I guarantee you that you don't. I guarantee you that you believe in some crazy conspiracy.
When we passed 21st Century
Cures thanks, Albring. Thank you.
In 2018, the Software Act and that health IT definition is something that I worked.
How about your scientists figure out a way to protect the immune compromised without endangering everyone? That's what a vaccine is. That is what a vaccine is. I know, Social Work. Isn't that crazy that I literally read you so nakedly? Isn't that wild? Exactly. That's wild. I just want to read that again. How about your scientists figure out a way to protect the immune system of the immune compromised without endangering everyone? Yeah, the endangering everyone is the preventable diseases of the 5 million that die every year. So they would have died, the 5 million here. We put it up here so that you can see. Fact, vaccines save 5 million lives every year. But so that's what a vaccine does, because they would die if they didn't have a vaccine. So they would have died, but they're not. And the vaccine saved them from dying. So that's how you protect them, because there is a disease that exists, and the disease is real, and viruses are real, and they would have died. So that's how it actually works. That's how it is. You mentioned that I don't. Okay, all right. Social Work. Say that you believe in viruses. Then just say that you believe in viruses.
Tirelessly on to get implemented. So what I want
yeah, exactly. Just say that you believe in viruses. Just say that you do.
Hear from you is
like, how hard is it?
CMS plan to align this new framework with the
exactly. See, this is exactly. They won't say it. They're you can't. No. Damn, Social Work. You just got me. You're so good, dude. You've got me. You got me. You're so good. You're so good. Exactly. I know, right? FTVG. Exactly. Anyone doubting science is welcome to sign up for a class. Exactly, Siggy. Exactly.
Existing federal framework.
Dude, the breathing gets me every time.
Are we going to be able to move forward with one national policy on interoperability?
Well, I don't know if we, what we have right now is concrete commitments from the 60 top tech companies who we were able to convene to do data sharing, to do patient accessibility, and to do interoperability.
Brandy's in chat, friend of the stream. What's up? So we're listening to the RFK Senate Finance Committee. thing. If you guys want to watch the video, it's on YouTube. But if you want to just join along here, that's also chill, and you guys can watch here too. Whatever. We're just gonna audio on TikTok.
Operability, but I can't tell you how that's going to mesh.
Then if you will have someone submit
Yeah.
to me
Yeah, of course, social work. Yeah, that's what we're. Don't forget your boosters. We're social work. Nothing gets by you. We're literally celebrating people getting their boosters every day. It's like, yeah, I've gotten a booster every year on my flu shot. Yeah, that's the whole point. And then I've gotten a booster every year for COVID. Wow. Yeah, that's what we do. That is what we do. What do you mean, Siggy? You tried twice to get vaccinated and you can't?
in writing what that pathway is. This is something that is essential if we're going to be able to benefit from that data. So having some specificity on the pathway will be helpful.
Brian F. Dude, Brian F. Dude. Thank you guys. Thank you guys so much, man. Appreciate you guys. Dude, that's so cool. Oh, dude. Tiff, thank you guys. Dude, you guys are so nice. Wow. Thank you guys. Dude, 2 more and we're gonna unlock gift subscriptions too. So that's gonna be so sick. So once we get 2 more subscribers, people can gift each other subscriptions too. So that'd be awesome. Oh, thank you guys. Thank you. Dude, thank you guys. For real. I appreciate you so much. Dude, this is awesome.
I did want to talk with you. Last time you were here, I talked about the concerns on overprescribing
Yeah, it is, guys. I'm
prescription
loving it.
stimulant drugs for children. And there are ways that HHS can
Welcome
work
in, guys.
collaboratively with state agencies on this and to actually promote more community-based intervention to combat overprescribing. And we all have seen the harmful side effects. And there's a lot of
What are the
reporting
harmful
out
side
there
effects?
on this and tremendous concern.
Exactly, Chelsea. Exactly. And all that stuff. Yeah, that is Marsha Blackburn. That is exactly right, Chelsea. And because they aren't explicitly saying that it's recommendation, so that means that insurance companies are going to pull it. So that's it. Omar, it's a lot better. It's the community, man. The community here is like unbelievable, and like the amazing moments are 10 times the haters. So it's absolutely incredible. Oh, thanks, Omar. Yeah, dude, I feel like it is, man. I'm Omar, genuinely, man. I'm proud to be here with you guys. You know what I mean? Like legit. What's up, Skog? Like I feel like I'm the lucky one because I get to hang out with you guys. So I feel lucky. So it's awesome.
For grandmamas like me who see
Amy J Mack, that you know what? I've actually funded COVID vaccines since the pandemic started, by the way. I don't have a GoFundMe. I just send people money. So that's what I do. I send people money for vaccines and masks during the pandemic. Yeah. Yeah. And it's awesome. And they do that. People that couldn't afford it, that didn't have insurance. Yeah, exactly, Ruben. Yeah. Carrie with the subscription. Dude, let's go. Oh my gosh. Siggy Cam. Thank you, man. Thank you. No, because guys, I've been here as a science communicator doing this since 2021. So I was doing it on Twitch, I was doing it on YouTube, and I was in another community on Twitch, and there was some people that had financial hardships and they couldn't afford the vaccine, so I paid for them. I think I've paid for like 5, 6, 7 different vaccines, and then for masks too. So they would just send me an Amazon, their closest Amazon locker, and I'd send them 100 KF94 masks. Yeah. Ruben, not necessarily, not everywhere. Yeah. Yeah, man. No, it's yeah, dude. It's all good, man. I was in a financial scenario where I could afford it, so I wanted to give back.
children and friends of our grandchildren who suffer with this. So I know your team is working on solutions. So you're going to have your Make Our Children Healthy Again
Guys,
strategy.
one more sub until we
that
unlock
you're
subscribe subs. That'd be so sick.
going to release, but talk for a moment. We've got 30 seconds left. Talk for a
No, I'm an atheist.
moment on how you can better arm parents with information on the harmful side effects of
You know, you can look up how much your doctor makes from drug companies. Oh no. Oh, you don't. Don't look me up. Oh, don't look me up. Don't look me up. Okay. So look at just don't look me up. I don't know if you don't look me up how much I'm making from drug companies. Don't. Oh, please don't out me like that. Oh my gosh, I'm so scared. I'm hyperventilating. There's so much. Okay.
prescribing these stimulant drugs.
I'm
I mean,
sweating,
one of the
guys. I'm
problems,
sweating.
Senator, is that, we now have 1 out of every 5 kids on these drugs and the antidepressants, even more. And we know very little about the long-term impacts because NIH and CDC have been asleep at the wheel. Right now, we are doing those studies. We're doing extensive studies so that we can warn parents and so that we can force the companies to put labels on their products. And, we'll do whatever we can to show that, just to get data out to the public. That's
Jay Shellman, it's actually, you got to go between Soros, the payoff, the Bill and Melinda Gates payoff, the payoff from the drug companies, and then it's you can't get paid by Moderna and Pfizer in the same month, so you got to go through the round robin. It's a lot. That's a lot, dude. Yeah.
really what our function is. And to show what the long-term impact of some of these drugs is. Are we actually preventing suicide or are we creating more suicide?
Dude, as if we don't know that. I just the idea that the guy has no idea of he doesn't know how many people, just to review, guys, he doesn't know how many people died from COVID. He doesn't know how many people the vaccines prevented from dying, but he does know that vaccines killed more people than the disease itself. Okay, he also doesn't know, apparently, compared to this, he doesn't know how many people the any type of pharmaceutical companies is killing or saving or anything like that. Like the amount that he just doesn't know, but he knows exactly how many numbers the vaccine has killed, but he doesn't know the exact number, but he knows that it's more than the disease. It's just insane.
That's something that we don't know the answer to, which is, how did these drugs become so common in our society without us even knowing the answer to those questions? That
Insane.
is malpractice of these
completely wrong.
agencies, and that is the malpractice that I am going to fix.
Thank you.
Thank you. Senator Warren.
Thank you, Mr. Chairman.
Siggy, he's a lawyer. He's a trained historian that's a lawyer. And yeah, he has no idea what he's talking about.
So last November,
Yeah, Maiden. He thinks that he deserves a Nobel Prize for developing a vaccine that killed more people than the disease. What kind of nonsense is that? This is Senator Warren. Here we go.
while you were under consideration to become Secretary of Health and Human Services, Mr. Kennedy, you said, quote, if vaccines are working for somebody, I'm not going to take them away. No exceptions, no ifs, ands, or buts.
Bernie, too.
You would not take away vaccines from anyone who wanted them. Then last week, you announced that the COVID-19 vaccine is no longer approved for healthy people under the age of 65.
True.
In announcing the change, you said the vaccine will be available for anyone who wants it. Now, obviously,
Dude, 2 a.m. EJ, bro, what are you doing? I'm gonna mute you for the entire live for that, dude. Okay, Ben, you can't just
both things cannot be true at the same moment. So let's clear this up right now, Secretary Kennedy. Will you tell America that all adults and all children over
Ben,
6 months
chill,
of age
dude.
are eligible to get a COVID booster at their local
No, it's chill.
pharmacy today?
Anybody can get the booster.
I'm sorry?
No.
Anybody can get it, Senator.
Anybody. So you're
Anybody.
saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
Not
It's
true.
not recommended for healthy people.
No. If you don't recommend,
Yeah.
then the consequence of that in
Exactly.
many states is that you can't walk into a pharmacy and get one. It means insurance companies don't have to cover the $200 or so cost. As Senator Dr. Cassidy said, you are effectively denying.
Lena, you have to gift if you're going to be like that in chat, or else Ducray gets really mad. And Mrs. Dr. G, actually, she's in the chat too, so she gets really mad. So
People vaccines.
We're not going to recommend a product for which there's no clinical data for that indication.
Oh my
is that what I
gosh.
should be doing?
What you should be doing is honoring your promise that you made when you
Yes.
were looking to get confirmed in this job.
You're going like
and that
this.
is, you promised that you would not take away vaccines from
all
anyone
good,
who
Lena.
wanted them.
I'm kidding.
You
You're
just
good.
changed the classification
joking.
of the COVID vaccine.
I'm not taking
and
them
the
away from people,
consequence-
Senator.
Yes,
It
Addie,
takes it
exactly.
away if you can't get it from your pharmacist.
Well, most
It
Americans are
takes
going to be able to
away
get it
if
from
you
their
have to
pharmacy
pay
for free.
$200.
Most Americans will be able to get it from their
No,
pharmacy
the
for
question
most
is,
of
everyone-
Americans. Which is most Americans? That is so wild. During a pandemic, guys. During the pandemic, SARS-CoV-2 is still a pandemic. Whether or not you agree with it or not, that is what it is. The idea that you can, during a pandemic, you could have a vaccine taken away for that actual virus, like it blows my mind. That is, I can't believe that.
One who wants it. That was your promise.
I know
Mr.
I didn't.
Kennedy,
I
not
never
mine.
promised that I was going to
You didn't
recommend
promise-
products with
Oh,
which there is no
sorry.
indication.
When you
Oh my
said
gosh.
And I know you've
vaccines
taken
are working for
$855,000
someone, I'm
from
not
pharmaceutical
going to take them
companies,
away.
Senator.
Did you hold up a big sign saying that you were lying when you said that? Because you are the one who said you would not take them away. Now, Senator Kennedy,
I'm not taking them away from anybody.
Secretary,
You want me to indicate a product for which there is no clinical data?
Senator,
Is that what you
That's
want?
not true.
Secretary Kennedy, you
There's
said
no clinical data for vaccines during COVID. Like what is this nonsense?
you wouldn't, and now you did.
I'm not
So
taking them away.
obviously-
Everybody can get access to them.
No, they
Exactly,
can't walk
Maiden.
into a pharmacy the way they could last month and get access.
It
to a
depends
COVID
on the
vaccine.
it depends on the
It
states.
depends. A year ago,
But they can
it
still
did
get
not
it.
depend.
Everybody
A
can get
month
it.
ago, it did
Everybody
not
can get
depend.
it, Senator.
So look, let's move on. You clearly are taking away vaccines.
Yeah, Ram, we're listening to the RFK thing.
I've seen the list for what's coming up next, and that is the agenda for the next CDC vaccine panel. And first up is ratifying your COVID actions. Second is hepatitis B is on the agenda. So should Americans expect you to take away hepatitis vaccine access as well? even
Exactly,
though you
redheaded
thought-
one. Exactly. The mRNA, the vaccine development started in 1987. They were using it for targeted gene cancer therapies in 2015. So the idea that, yeah, Don, they're just completely wrong. So it went through all the trials. It has all the data. You haven't read it. So, oh, no way. Hot listeners, are you serious? You were in the personal mRNA cancer studies? Yeah. It's not a classic vaccine. Guys, it's you don't, okay. All right. So then take the regular one. You realize that there are the COVID vaccines, not mRNA, right? So then take that one. Have you guys taken that one next? Oh, you haven't. Wow. No way, Hot Nurse. That's incredible.
Promise not to?
As I said, I'm not taking vaccines away from anybody.
Okay, same answer, right? You're just going to deny that when people can't get
Exactly.
access, that you're not taking it away. Then let
Ruben, there's other vaccines for COVID that are on the vector one. You realize that, right?
me ask you, is that the same game you're going to play with me?
You want me to, so you
Oh,
want me to
dang, wow,
recommend
thank you
every
guys.
product in the
Oh,
world?
wow, what a gift. Thank you so much.
Without any clinical trial data.
Through on your promises.
Lena, thank you
my
so
promise
much.
was to give
That's very nice of you. Okay, now you can say whatever you want, Lena. Now you can say whatever. Now you can say whatever you want. Thank you. Thank you so much. I appreciate you.
A month ago, we could get COVID vaccines by just walking
You can
into a
still get
pharmacy.
COVID vaccines,
You are
Senator.
taking that away.
No, you are
So
still.
let me
You can
ask
still
you
get the
one more
COVID
question,
vaccines, and
Secretary
Medicare will still
Kennedy.
pay for them, and
Did
Medicaid
you
will
tell
still
the
pay for them.
head of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign?
No, I told her.
Why is there such a huge divide on this subject? I don't know. HG, that's a really good question. You know, I think that it's a lot of Russian disinformation being pushed by into these algorithms and in these apps, and it's really easy to have people that are susceptible to conspiracies fall into one like this, and it's just nonsense, you know. And unfortunately, a conspiracy is an easy way to explain a complex thing, and when you get pushed it constantly into an app, you actually think that you see it a ton, so you think that it's more legit than it is. And yeah, wait, Dems are trying to keep this pandemic alive. Miss Carpe, like HIV is still a pandemic. Do you understand that? Like the data and the epidemiology and the microbiology, that is what is actually what is happening. It's not Democrats. It's not politics. It's what data is. Okay, we're gonna go back.
On your channel,
And Medicaid will
tell
still
the
pay.
head of the CDC.
Bro, TikTok is Chinese, not Russian. Yeah, bro, Ruben, bro. Yeah, but they have bots that they create. That Russia has botnets that push these things, that push things into Twitter. They're pushing botnets, and that is something that they're pushing, Brandy. They're pushing it into like Twitter in order to basically steer these content creators and think that there's more people out there than there are.
CDC, that if she refused to sign off on your channel,
And Medicaid will
tell
still
the
pay.
head of the CDC that if she refused to sign off on your
tell her?
changes to the childhood vaccine schedule, that she had to resign.
No, I told her that she had to resign because I asked her, are you a trustworthy person? And she said no.
Oh my
So
gosh.
if you had an employee
Insane.
who told you they weren't trustworthy, would you ask them to resign?
Are you trustworthy?
So I'm sorry, but this is not what she has said publicly.
Yeah.
She has
Well,
said
I'm
she
not
was
surprised about
reapprove.
that.
So you're saying she's lying?
Yes. Every conversation I had with
Adam.
her,
And let me get this
How's it
straight.
going,
This
man?
is the same person that less than a month earlier, you stood next to her and described her
Yeah.
as unimpeachable. And you had full confidence in her. And
This is
that you had
incredible.
full confidence in her scientific
Carrie, this
credentials.
is hilarious.
And in a month, she became a liar? Is
yeah,
that what
you
you're
should
saying?
ask her what changed. And by the way, a
Oh
month
my
ago, you
gosh.
were voting against her. Oh, because you thought she was either incompetent, ineligible, or unsuited to the task.
I voted
Now
against her
agree
because
with you.
I was afraid she was going to bend the knee to you and Donald Trump. And it looks like
Yeah.
she didn't bend the knee, so you fired her. Look, you're
Yeah, that's
putting
exactly what
America's
happened.
babies' health at risk, America's seniors' health at risk,
Yep.
all Americans' health at risk, and you should resign.
Senator
Absolutely.
Sanders.
Oh, damn, back to back,
Just want
Sanders.
to pick up on Senator Warren's point. Are you telling us that the former head of CDC went to you, you asked her, are you a trustworthy person? And she said,
Peaches
no.
is here? Peaches? Where's Peaches? Hi, Peaches. Bernie, I know, dude. What an incredible politician like Bernie is. Like seriously, he is like at the independent and going his own way when everyone else wants to go. He's basically what the anti-vaxxers wish they were, you know, like they wish that they had the temerity and the stones that Bernie has, like just taking like solo by himself votes, take like him against the world, standing his ground, just absolute amazing person. I just love Bernie Sanders so much, man. Yeah, of course you think that, Luru. You think that I'm being paid by pharma, so you think that everyone is being paid by pharma. Like it's just, bro, it's just give me a break, man.
No, I am not a trustworthy person.
She didn't say, no, I'm not a trustworthy person. She said, no. I'm
Wow.
giving a quote. And I asked her
no,
twice.
1 second. But
Well, I have
you're
to-
also repeating now that she is a
That
liar.
girl, I have to like
But you wrote in the
respond.
Wall
You know
Street
what I mean? I
She
mean, that's what
wrote
people are here for.
That I fired her because she refused to sign on in advance for the ASIP committee. No, that's not accurate.
All right, so you're calling her a liar, and I look forward
Yeah.
to her coming before the Help Committee, maybe this committee as well.
Okay. VAERS. So VAERS is basically a repository of data. So it's like a catch-all. Like so imagine like, you know, you're trawling and you get a bunch of stuff that are, you know, it's like casting a wide net, right? You're not going to catch all fish that you want to eat. You have to push it out. No, it's not Google for scientists. No. Basically, you get a lot of stuff that's being inputted that is not verified, that is not correct. So you have to use the VAERS data and corroborate it with something. So you can actually scholar.google.com. You can check and look in VAERS COVID-19 and see what pops up. And basically, you can see in their methods section, you can see what they have to do in order to cull and prune the VAERS data, right? They have to cross-check it. They have to verify it. It has to be a complete data set, all that kind of stuff. So you can't just use everything that's in the VAERS database. And what happens is the anti-vaxxers go and they check and see, oh, this is what VAERS said, so all these deaths are up and all that kind of stuff. And they say, wow, look at all the death rate of, of this versus this. And it's not going to be a catch of statistically significant data. And it's not going to be all correct. So that's the thing.
All right, Mr. Secretary, I've got a bunch of questions. Appreciate brevity in answering it. So-called big, beautiful bill threw 15 million Americans off of health care, substantially raised premiums,
Yep.
and
True.
it's going to have a terrible impact on nursing homes, community
True.
health centers,
True.
rural hospitals all over America.
True.
Very briefly, is that really making America healthy again?
It's going to be the biggest infusion of federal dollars into rural health care in American history.
Yeah, you know why? Because you're
Wrong.
cutting $150 billion for rural hospitals. You're putting $50 billion back. That's
Yeah.
not an infusion. That's
Exactly.
a loss of $100 billion.
Exactly.
All right.
Guys, Medicaid, okay? Medicaid is health care for poor people, and poor people go to hospitals, okay? Because they need healthcare services, right? And they have money that's now given to them by the federal government that they go and spend at a hospital. That is why, a lot of these rural hospitals, their patients are like 60, 70% from Medicaid. A lot of the money, Medicare is for the elderly. So when you take that money away, guys, where's that money going to come? You could pay them, money directly, but you're still taking away 70% of their money. That's what Bernie's talking about. Medicaid versus Medicare. Medicare is healthcare for people over 65. Medicaid is for poor people.
Next question. President Trump, who I don't usually agree with, called COVID vaccines, quote, one of the greatest miracles in the history of modern day medicine that saved tens of millions of lives worldwide. Scientific community agrees with Trump. Lancet study found that it prevented almost 20 million deaths during their first year of use.
Yep.
Secretary Kennedy, are President Trump and the medical community right, or do you still believe that the COVID vaccine was, quote, the deadliest vaccine ever made?
First of all, I didn't say that. I said that in terms of affairs reports a while ago. I've said today, I think that President Trump should get the Nobel Prize.
So who's right? Is Trump in the medical community right, or are you right?
President Trump did an extraordinary piece of leadership.
Is he right or wrong? Did COVID save millions of lives?
As I said, he got Americans back to work. At that time, that particular vaccine was perfectly matched to the virus that was circulating then. And I have no idea how many lives it saved, but it saved quite a few.
But eventually, it killed more people than the virus itself. This unbelievable. He has no data. He has no nothing to corroborate, nothing to add there. He has nothing.
What I find a little bit weird in this discussion, I'm hearing it over and over again this morning, Mr. Chairman, is we've got the entire...
Yeah, exactly, Chelsea. He doesn't want to, exactly. He has to kiss the ring.
Medical community on one side. You got the AMA representing hundreds of thousands of doctors, the American Academy of Pediatrics, the American Public Health Association.
Exactly, Brandy.
All of these organizations are telling us that COVID vaccine and vaccines in general are safe and effective. You are casting doubt on that. Who are your who are the organizations that are agreeing with you?
True.
And casting aspersions on vaccines?
The primary advisors are Marty McCary.
Single advisors. Guys. So he's basically found the 1 in 10 dentists that don't agree that brushing is good for you. You know what I mean? It's like the 99 dentists out of 100 all agree that this is a good toothpaste, and they found that 1 in 100 like dentists that's gonna say some nonsense, and now he's like, oh, see, everyone agrees with me. And guys, it was actually this thing that got me so mad. This is what got me into science communication in 2021, because I had all these people that with PhDs, with MDs, that were spewing absolute nonsense during the pandemic. And I felt like I had to do something in order to fight back and fight this disinformation, because it is hard for people to see someone with a PhD or an MD after their name, and it's hard for people not to trust them, right? That is, they instinctively do think that their opinion matters more, right? And sometimes it does, and sometimes it doesn't, guys. That's just the truth. Sometimes just someone's opinion can just be wrong, and it matters where the data is coming from, what they're using as a source. And that's why I say up here, this is what I say, like, I do not believe me, don't believe what I say, believe the studies and the scientific method and the sources that I am sourcing. So don't listen to me, listen to the sources. And that's how you kind of build and you better understand and look for things in the future. That better arms you with the tools necessary to figure things out going forward.
Dr. Oz,
So you got a few doctors who agree with you, but I'm giving you
Timothy. Are viruses real, Timothy? Do you think viruses are real?
doctors. What you're talking about.
Thank you, Elfax.
There's a big difference.
But my point is, like, don't just believe what I say. I would love if you looked it up and read the Lancet papers, and you read the Picard and the Warraby and the Chris Christoph papers of population genetics and all that kind of stuff. Like, I would love for if you had read that and then looked at me and had your own opinion, and that would be amazing. Like, I would totally think that would be a great way to spend your time. But everyone can't be an expert on everything, guys. That's the big thing, is that you can't be an expert on everything. So at some point you do have to trust the scientific method, experts, all that kind of stuff. Like, you're not going to micromanage your brain surgeon during a surgery, right? You're not going to be able to come in, and say, oh, I think that this is what you need to do. At some point you have to trust the method, and you have to trust that people have dedicated their lives in order to bettering the world and their communities and their patients' lives. And that's what I did through science. That's what medical doctors do through their medicine. And the idea that we are somehow nefarious and that we're actually in it for the grifting and the money is just insane, guys. It's not true, and it's sad that people think, just assume that. And it just shows that when people are like that, it basically shows that they themselves have never felt that way about something. They've never really devoted themselves to something to make something better than a project that's bigger than themselves. And that's what's sad, is that they don't believe that is real.
Senator, between established science and the scientific establishment, which has been co-opted by the pharmaceutical industry.
Again, it's just a nonsense. It's just nonsense. Every single person, what he's talking about is saying a worldwide conspiracy right now. RFK is saying that there's a worldwide conspiracy of all the doctors, everyone coming together and conspiring, millions of doctors across the entire world and globe, all conspiring. You think the pharmaceutical company is paying all of them? Like, really? You think that this wouldn't have blown up and been shown to be a fake? Like, come on, guys.
You're telling the American people that the American Medical Association, representing hundreds of thousands of people, have been co-opted, and that they should not trust their doctors. And the American Academy of Pediatrics.
Exactly.
And by the way, just for the record, every single Republican, I don't mean to be political here, Mr. Chairman, has received PAC money from the pharmaceutical industry. Are they all corrupt as well?
And I'm telling you, the American Heart Association has been co-opted by the food
Everybody
industry.
but you, Senator. But you know what? When you ran for president,
Everyone but the food and the food, everything. It's all the same. This grand conspiracy. It's just nonsense, guys. Like, come on.
we have a corrupt campaign finance system. Maybe you will agree with me on that. Okay, you were already president, you had $1.5 billion behind it. You received $300,000 from people, not from the industry, people in it, as I did, from individuals. You corrupt. President Trump got $3 million. Every Republican got corporate PAC money for the pharmaceutical industry. Democrats as well. Everybody is corrupt. But you? Is that what we're looking at?
Yes.
I don't think so. And I think the issue
I don't even know what you're talking about.
Well,
what a superpower. Again, let me guys from last night. Everyone from last night, the Republican superpower, everyone. I don't know what you mean. Amazing. I don't know. I don't know what you mean. You're lying. Oh, that's so nice. That feels so good, guys. That feels so like why do you have to be tethered to facts and studies and logic and reason? You could just be a Republican and just I don't care. I don't care what you say. Exact Elfax, we are the largest Republican stream. We converted last night actually. This is a Republican space now. And we are all Republicans and we get all that money. So thank you for being here. Doesn't matter. It's incredible, guys.
You can do what I'm talking about.
I don't know what you're talking about.
I don't know what you're talking about. Again. I don't know what you're talking about. Just presented with all the facts, everything that you need to show, all the studies, all this time. I don't know. I don't know what you mean. God, it's so nice. It feels so good. Exactly. They never know anything except when they know that they're anti-science in the entire medical field. They suddenly are really firm about that. But then what's the study that gives you that? I don't know. Oh, it's incredible.
Every time anyone
Are you saying the pharmaceutical industry was supporting my presidential campaign?
I'm not saying that. I'm saying the pharmaceutical industry is a greedy institution which is charging us the highest prices.
Wow, Mrs. Dr. G just in the chat killing all the gifts and just all the subs. Damn, girl. What are you doing? What are you doing over here? Killing us. You're killing us, dude.
In the world, they are pervasive. But to suggest that every institution, the AMA, the pediatrics people,
I know.
is
Bernie's
corrupt
so good.
because they disagree with you is an insult to the
It's not,
American people.
listen, people disagree with me all the time. I have arguments in my agency, heated arguments every day with Jay Bhattacharya, with Marty McCary, with Dr.
All these individuals, again, he doesn't care. Again, guys, again. He's arguing with all these people that are just anti-establishment. Okay, if you are contrarian, guys, if you're a contrarian and you're a reactionary, okay, your ideology is just this thing, I'm not for it. This thing, I'm not for it. You're not actually building knowledge. It's really important for people to understand this. That RFK is a contrarian, guys. He has an ideology that's against something else. So what happens is that exactly, Siggy, and this is what I'm talking about, they're not building a solution. So they're not ever building to a better vaccine. They don't believe viruses are real. He doesn't have a better solution. He just thinks that everything is wrong. So see what I'm talking about, guys? Like the science creates a bedrock of knowledge that builds on itself. Okay. If he had any knowledge, any study, any solutions, all he would do with the entire power of the HHS, CDC, FDA, he would just do that study. He would fund that study and that would be it. But guess what? He doesn't do that because he knows there is no scientific method that disproves GMOs being safe. He has no scientific study to show that processed foods are poisoned. It has no scientific study to show that vaccines are dangerous. He has none of that information, and he knows that. RFK knows that he is lying to you. He knows that he is lying to you. So that's what he has to do. He has to just sit here and say, I don't know, when confronted with any way to push his logic forward. And that's the danger. That's why he's so dangerous.
You have given the names of a few people. I have given you the names of organizations representing hundreds of thousands of doctors and scientists. I yield, Mr. President.
Exactly.
Senator Tillis.
Thank you, Mr. Chair. Secretary Kennedy, thank you for being here.
Why did he gift? Thank you. Oh man. Lips, thank you. Hot Lips Nurse, thank you so much. Thank you for the gifts. I appreciate you guys so much. One more gift, one more sub, and we unlock gift subs for the entire stream, guys. We're just waiting for one more gift sub to make one more. Oh, Lips Nurse, thank you. We've unlocked it. Yes, unlocked gift subbing. Thank you so much, Hot Lips Nurse. Thank you. Thank you so much. Let's go, everyone. Thank you so much. You got gift subs now. Thank you, guys. That is so awesome. That makes me so happy, guys. Thank you so much. I appreciate you. Hot Lips Nurse. I'm glad that my wife is in chat when she saw your name, because if I'm talking about Hot Lips Nurse in chat, she might get a little. Thank you, Ado. Thank you. Thank you guys so much. I appreciate you. Thank you.
A couple of times you asked people if they were making a statement or a question. What I think I may do, just to give you a breather, is to make a statement with a lot of questions. And just for the record, I'd like for you to have the opportunity to have your staff respond. I can't conclude from the discussion today where you are on warp speed.
Forever. No, forever. Basically, since now that we have gift subs done, we can like unlock that now. So that's just like other people can gift each other subs. So that's a thing. Dude, thank you. Oh, thank you for your service. See, Olives, thank you. I appreciate you so much. I did. So my PhD was funded for the by the Army Research Office and the DoD. I was a NDSEG, a National Defense Science and Engineering Graduate Fellowship award winner. So I have been. Carrie, I do. So normally, yeah, I do. So I have like a one-on-one interviews and panels. Carrie, you should probably check out my YouTube. Has all my my best discussions and my best talks. That's where I have all my stuff. And then I normally just do one-on-one. I'm not an MD. No, I'm a scientist doctor. So normally I do one-on-one discussions with people, and I'm talking about, this is my first stream ever I've done React content, actually, so it feels a little bit weird to me, but I normally do that. And we're just dozens of people DM me, hey Adele, how's it going, trying to get me to react to this RFK thing. So that's why that's why I'm doing this. But normally, yeah, it's one-on-one conversations. And my YouTube has all the highlights, so check it out. It's in my link tree, or in my link is in my bio of my link tree.
So I would like the definitive statement on exactly where you are. Was it good? Was it bad? Were there things that worked? Were there things that didn't work? I can't discern that from what you said here. I, for one, think that it was a signature accomplishment of President Trump, and the mRNA platform is something.
I agree with that.
I look forward to you giving us a detailed statement on exactly where you are with warp speed. I'm not a doctor. I'm not a trial lawyer. I'm a boring
What are you
management
talking
consultant.
about? Are you out of your mind? Fill us in on where you are with Operation Warp Speed. Did that actually come out of his mouth? Does he have any idea? They literally gutted the entire thing, the entire platform that Operation Warp Speed used in order to actually fund, in order to establish the whole platform of mRNA vaccines. They literally, yeah, exactly, Omar. What? Like, what is that? They chopped it all up. Yeah, we're doing it at 1.25 speed.
Another question that we'll submit in the record, I'll give you directionally where we're going. I don't see how you go over 4 weeks from a public health expert with unimpeachable scientific credentials, a longtime champion of MAHA values, caring and compassionate and brilliant microbiologist, and 4 weeks later, fire her because at least the public reports say because
shit. Oh, whoa. That was a flip up. That was a flip. Whoa. He was like, how did you, dude, what? Guys, is this Republican on Republican violence? Is this Republican on Republican? Exactly, Omar. And he's like, excuse me.
refused to fire people that work for her. So as somebody who advised executives on hiring strategies, number one, I would suggest in the interview, you ask them if they're truthful rather than 4 weeks after we took the time of the U.S. Senate to confirm the person, just for the future nominee that we're going to have to consider. But I do also believe that some of your statements seem to contradict what you said in the prior hearing. You said you're going to empower the scientists at HHS to do their job. I'd just like to see evidence where you've done that. And I'm sure that you will have some.
Exactly.
You will do nothing that makes it difficult or discourages people from taking vaccines.
Guys, like this is just knowledge. It's just insane.
There seem to be several reports that would seem to refute that.
It's true, so you can. It's true. Guys, you outed me. You're too. Yes, it is. It is Tom. It is Tom Tillis. Yeah, you're exactly right. Siggy's on to me.
respond to it. I'm not going to come here and impose my belief over any of yours. That, again, seems to be contradictory to the firing of a CDC director, the canceling of mRNA research contracts, firing advisory board members, attempting to stall NIH funding, eliminating funding for the I think $500 million for further mRNA research, and just want an answer for it. On HR 1, I believe. You know my concerns about HR 1. I've had several meetings with,
guys.
and HR 1 is the big, beautiful bill, OB3, whatever the brand is. But I'm still, I've got an office with 60 staff, including half of them in the state office.
You guys are so kind
I've
tonight.
had
Thank you guys so
three
much.
different estimates of the economic impact on the state of North Carolina. Can I get your commitment? And I have been looking for somebody that's far more resourced than an office of 30 people up in here in D.C. to disprove my estimates with respect to the impact on North Carolina, period. And I've yet to have anybody. I would love to be embarrassed and be wrong, but I would like to get your commitment for people to tease through the numbers that I provided before the vote on HR 1 that says that if you normalize 3 independent estimates across a broad spectrum, $25 billion over 10 years. I don't need your response now. I want somebody to destroy my estimates, because to this point, the most resourced health agency in the world has only given me word salad responses, and I need that so that we can prepare for the response. $25 billion over 10 years. Is half of the rural relief fund over 5 years.
I don't understand what he's saying. But real quick, guys, we got to do this. I forgot to do this last night, and Ducraig gets so mad at me when I don't do these sections. This is your time, guys. Thank you, guys. Hot Lips Nurse, thank you, guys. You're being so generous with the gifts and the latest sub. Everyone, thank you so much. Thank you, Jay Shellaman, Kathleen. Thank you, Melanie, Sarah Ann, Ado, Jen, Ducraig. Thank you guys so much. Thank you for 1,000 likes, 10,000 likes, 7,000 likes, like MB Kami. Thank you so much. Jen, Carrie, Lefty, Left, Brandy, Omar, Atif, Krista, Mrs. Dr. G. She's on there. Let's go. Thank you guys so much, so much. I really, really appreciate you. Thank you for the subscriptions, guys. It really is the best way to help the channel grow. I appreciate you so much. Thank you for the follow and the shares. Sharing is a really big way to help us grow, because you guys are all nerds, right? And we all love each other, and you guys know your friends that would like to watch. Come on, you know what I mean? Also, the link tree, guys, I'm revamping my YouTube entirely. Before it was just an archive, but now I'm doing the best highlights videos. So we're talking about those 15, 30, 45-minute, hour-long conversations that really just are why we are here and why people really like watching this show. And those are the best of the best. So if you're washing dishes, doing some chores, when it on in the background, it's fun, it's good, it's stuff. Also, the Linktree has my publications. If you want to see what kind of scientist I am, that's where it all is. No paywall. You can just view it. And that's it, guys. Also, link in the Linktree is the Discord, guys. Discord. All the subscribers. We're doing a subscriber only voice chat later. So we all just hang out in the Discord. The subs and I, we do kind of like a group voice chat there. You know what I mean? Since I only do one-on-ones, and but yeah. Check it out, guys. Check out the Discord. Join it up, okay? All right, back to the show. Thank you guys so much. And guys, if anyone's been vaccinated this week, let me know, okay? We need to get this number up. I want to see this number. We need to get this number to 100. All right? Get your booster, get your flu shot, and come back here. Let us know, and we will celebrate you, because we celebrate people that love public health. We love people who get vaccinated because they love themselves and they love the people around them. And that's what we kind of community that we are. All right. Oh, I don't know, Renee. I don't know. I thought it would be. You guys tell me. Wouldn't it be in the bottom left? I'm getting vaxxed on Monday. Let's go, Melanie. Let's go. All right. Good. Hey, Corey. What's up, man? Yeah, Renee, I think it's in the bottom left. I think that's where the subscribe button is, but I'm not 100% sure. If you go to my page, if you go to my profile page, it should be on that little thing below my little description. There should be a subscription button there that you can hit, and then you can join up.
And so we just need to have that fact.
Yeah, go to my profile page and then
so that we
Go to my profile page, and then there should be like a subscription, lives, all that kind of stuff, all right there, and that should be there. Yeah.
can go in North Carolina and absorb it. And I know every state's different, and I'm assuming every one of my colleagues here have done the math for their states, not focused on that. But I want you to destroy my estimates if they're in fact wrong, and I want you to acknowledge them if in fact they're right. That will come into question as well.
No, we have no Amos. It is very interesting. I saw a video, and I don't know who shared it, but it was really interesting. How in Florida, guys, your dog is required to get vaccinated if they're going to be boarded. So vaccines are mandatory for dogs, but because they're safe and effective. But for some reason, somehow, they're not mandatory for humans because they're not safe and effective. In what way are dogs' health and dogs like rabies vaccines more important for public health than humans? Like, what is going on, dude? That is actually quackery, dude. That is insane.
Mr. Kennedy, you've
Oh, no way. Lisa, let's go. So I got your flu shot, second shingles, and pneumonia vaccine today. Let's go, Lisa. Let's go. Guys, that's 3. That's 61. Check it out. 3, 2, 1. Let's go. Good job, Lisa. Mava, make America vaccinated again. Make America vaccinated. The V's, the Mavas, we all spam those V's. Put the V's in chat, guys. I love it. I love it so much. Thank you so much. I got COVID and flu today. What? Make democracy great. I love it. Oh, thank you so much. All right, we got 3. It's going up in 2 more. 1, 2, 3. Let's go. Let's go. Renee, let's go. I love it. Thank you so much for the subscriptions for 12 months too. Thank you so much. That means so much to me. Thank you. Thank you. Thank you. All right, guys. Wow. Thank you so much. Jay Shella, I don't understand. I don't know. That's a good question, man. Maybe because we're new to that, maybe you should like close the app and redo it again. That's the only thing I can think of. I don't know, man. Thank you.
Stated multiple times in response to other members' questions that scientists were lying. We'll go back to the record in cases where you've said that. I'd just like to see the scientific evidence to substantiate that. I'm going to stipulate that you were honest and you had research behind it. We'll go back and figure out what scientific studies you believe are founded on lies and not scientifically viable.
Illa, come get your vaccine and come back and we'll celebrate you and add you to the board.
And then finally, I just want to give you an opportunity. Apparently in the exchange with Senator Bennett, you said you agreed with Dr. Levy's statements, who said that the mRNA vaccine causes serious harm, including death, particularly in young people.
Yeah.
They said you agreed with that comment. Did you agree with that comment or not?
I think that's true, yes.
Okay.
Oh my God, he doubled down. What? Oh man. That is just, what an idiot, dude. He is so, it's crazy, dude. It's crazy. All right.
Thank you. Thank you, Mr. Chair.
So embarrassing, dude.
Thank you, Mr. Tillis. We now have Senator Smith. You're recognized.
Thank you, Mr. Chair. So, Mr. Kennedy, I have sat here for the last many minutes and listened carefully to your testimony.
Dude, I'll give it to the Republicans, man. They're really, even the Republicans that are pro, like Tillis right there, he was very uncomfortably talking about this, guys. He's very uncomfortable, like talking about. He didn't let him say anything. You know what I mean? He just monologued the entire time, giving like his what he thought. And he's literally just kind of like, I can't believe that you're saying this. I don't know why you would say this. This isn't weird. I want you to be more like this. This isn't okay. And I'm honestly very surprised these type of like Maha people aren't really. They're not showing themselves in this. This is definitely scary. Hey, Sora, how's it going? This is definitely out of their wheelhouse. They're not okay with it. Oh, okay. That's okay, Heather. Yeah, I mean, so science and politics are completely intertwined. And as you can see right now, our entire science industry is being completely eviscerated. So, you know, we do talk about science and politics and everything in between, and that's what we do here. So it's okay. You know, if you wanted to you know, watch, it's okay. But if you don't, I totally understand too.
And I think actually Senator Tillis laid out so many of the ways that what you have said has contradicted yourself and others. It's, I mean, I don't even know where to start. So I'm going to start here. Over the last 8 months, you have claimed to make America healthy again. But in actual fact, you have led the charge in the Trump administration to destroy what is best in our healthcare system. And your denials and your evasion and your lies here do not change that. You are the Secretary of the Health and Human Services, yet you're trafficking in these fringe idea and discredited theories that are completely out of step with the scientific consensus. And you seem to be willing to say anything in the moment. Even if it's untrue. So last time you were before Congress, Secretary.
God, I don't know what the Fox thing. I don't know who this
Kennedy,
is.
you claimed, and I quote, "I have never been anti-vax. I have never told the public to avoid a vaccination." But in a podcast, you said the opposite. You said there's no vaccine that is safe and effective. So that sure sounds anti-vax to me, Secretary Kennedy. So let me ask you, when were you lying, sir? When you told this committee that you were not anti-vax, or when you told Americans that there's no safe and effective vaccine?
Both things are true.
Oh.
Republican superpower. Just incredible. Wow. Just why would you ever be held accountable for anything? What are we doing here, guys? Why would we ever, God, why would we ever want to be held accountable when we don't need to be? Incredible. It's just Republican superpower. Oh my God.
So you told Americans that there's no safe and effective vaccine.
Both things are true.
Oh, or when you told America, Kennedy. So let me ask you, when were you lying, sir? When you told this committee that you were not anti-vax, or when you told Americans that there's no safe and effective vaccine?
Both things are true.
Oh, so.
Okay, so he's saying that there's no safe and effective vaccine yet, and that he's going to develop it? Is that the idea? That it's up to him. He's the one. And he has said this idea of like, oh yeah, I'm going to do a whole virus vaccine. Like that's his thing. Like he's gonna do as if we haven't thought of that, as if we haven't tried that, or like even, you know, like, oh duh, of course, dude. Like, oh my gosh, yeah. Oh, like he wants to do a whole every virus vaccine, guys. That was his whole idea. His idea is like we just vaccinate for everything, for every virus with one shot. Like, oh. So immunologists and virologists everywhere are just going, duh. Well, why do 50 shots when we can do one shot? Like, oh, duh. Thank you. Oh, why didn't we think of that? Duh.
More denial, more back and forth. I mean, here's what I know. Here's what I know.
Want me to explain why, Senator?
Yeah.
You just
Actually, I want you to listen to me.
Okay, go ahead.
I want you to listen to me.
It's true. Dude, why would you he's obviously going to just spout nonsense. Like, it's just insane.
I've been listening to you. You said that ACIP is an independent panel after you stocked it with your picks. You said that you want evidence-based science, but it seems that what you mean is evidence that supports your view, not the scientific consensus. I mean, you dared to sit there and call my colleague from New Hampshire a liar when she presented you with facts that don't support your view of the world.
Exactly. That's all they do. That's all they do. Just say that lying, it was a lie. Study after study after study show that you're wrong. Oh, nope. Like, oh, no, of course.
It's incredible. But let me move on.
Dude, I'd be so frustrated.
Just last week, in the days after the tragic shooting at Annunciation Catholic School in my home state of Minnesota, you went on Fox News blaming school shootings on antidepressants. You have no evidence of that because you have no evidence of a connection. And you want to talk about...
You're just saying something. You're just making stuff up.
You know, this is what you say,
Dude,
right?
It's insane.
When someone presents you with information that does not fit
you're right,
I did not blame that shooting. I have no idea and I never said that. You're making it up.
No, he did say that.
You are being dishonest, right?
Exactly,
If you want to
Omar.
talk about mental health and gun violence in this country, if you want to talk about mental health and gun violence in this country, we should be talking about that because that's what the parents of Annunciation School
You don't want to talk. You want to harangue and you want to have partisan politics. I want to actually solve these problems.
Secretary Kennedy.
Nope.
What the Trump administration is doing right now is
Oh my
making
gosh,
it harder.
Mary, I'm so sorry to hear that. Because Oz, the underlying thing is one, grift and lie however much he can in order to stay in power, because that's what is, that's what he's gotten to that point, right? He needs to do whatever he can to stay in power, but it's also to another thing, something that he pointed out, that he makes money by suing these pharmaceutical companies, so that he's going to leverage that in order for like some personal gain. And then 3, it's kind of like an authoritarian power grab where he doesn't want anyone to listen to the scientific method other than him. He wants to be the person that everyone goes to. Like imagine the CDC director now. Like the CDC director is going to have to go to RFK, but when every scientific thing is published, they got to get it okayed by RFK or else they're fired. So he wants fealty. He wants people to bend the knee to his idea, to where he has. Exactly, Carrie. It's all about control. It is. It really is. And it's disgusting. It's absolutely disgusting.
For people in this country to get access to mental health care. So don't talk to me about solving the mental health care crisis when you are making it harder. You cut Medicaid, which is the #1 payer for mental health care services in this country. You decimated the agency at Health and Human Services that focuses on mental health and substance abuse. That's what states count on. They're cutting their services to schools as a result of that. Several years ago, in a bipartisan way, Congress came together and passed the Safer Communities Act, which made important investments in mental health care and did some important, though small things, to reduce access to guns. What do? You propose cutting that funding. This is what we're talking about in your leadership in the Department of Health and Human Services.
I can't see it. The freaking Fox has their thing up again. I can't see the nameplate.
If you want radical transparency, as you talk about, I mean, take a look at what you are doing. And, I've heard a lot about MAHA today while we've been here. There's a lot of Americans, Secretary Kennedy, who trust you, who believe what you say, especially when you
I do want to do, and we did this before on the Twitch community the science communication community that I did. We did viewers came out with us, and they did PowerPoints. So they actually presented the research that they were doing. So it was like a viewer research conference. It was so cool. People were like, that were in the community, I had no idea that were grad students or undergrads. They presented what they were working on, and we all talked about it. And it was so cool. So I really want to do that. And then my other idea is expert panels. So like I normally do one-on-one conversations. I don't really like the panels that much, but if we were a bunch of experts on there, then I think that would be actually really, really cool. So expert panel on specific issues, specific things, then we can all kind of talk together and debate or and discuss and that kind of stuff. So yeah, it'd be really cool. Why doesn't the research and meet with actual scientists to see what he's trying to defund? I don't know, Ruben. Yeah, they're ideologically going after this stuff, and he hasn't really met with Ruben. I mean, they're literally with your sister, bro. Like, I mean, not to make it personal, man, but like they're going after the gene therapies for cancer treatments. You know that, right? I mean, they're literally going after the treatments that like my family members going through that needs mRNA gene therapy treatments right now that are being developed right now. And they're cutting that. They're cutting those programs. They're cutting everything. And it's like, it's crazy. That's what she's talking about. Like, you can't like make people healthier by removing the gene therapy techniques that they actually use. And that's exactly what they're doing.
Say you're standing up to corruption. And I think that they need to know, you apparently have a lot of influence with President Trump.
Well, yeah, Ruben, because the open-minded stuff with natural waste hasn't been proven, bro. It hasn't. I mean, every single moment that you're trying some green tea thing, it doesn't work, man. It doesn't work. Gene therapy and actual, doctors and medical science is what she needs, man. She doesn't need some naturopathic nonsense.
Did you ask him not to roll back these regulations that are stopping the big corporations from dumping heavy metals and
Yeah, you can find, Gaynor, you definitely find it in a syringe if it's giving you a vaccine that's going to prevent you from dying from a preventable disease. Yeah.
Endocrine disruptors into our soil and water. I mean, there's
Ruben, it does. You have a finite amount of time and money, brother. Like that's the thing, is that you have a finite amount of time and money. You can spend your time more aptly by actually helping her get into like a gene therapy clinical trial or something like that.
There's no evidence that you have been even opposing that. Did you do anything to stop the Trump administration from rolling back this handout to Big Pharma that makes it easier for the big drug companies to charge more for cancer drugs? No, you presided over that.
Exactly.
I mean, it's stunning, really, what's happened over the last 8 months.
Yeah, Dr. Keisha and I we're mutuals and stuff, and like we are, yeah, I've talked to her a couple times, and she's awesome. She's a great science communicator. Dr. Keisha Davis, guys, she's a great follow. She's a pathologist, MD on TikTok, and has great content. I don't know if she's in chat. I don't know if she's here, but you guys are talking about her. Yeah.
It's stunning to me. And I just hope that in this moment, our colleagues, there's hardly anybody left in this room, are going to think about what it is that you've done, what your legacy is going to be at the Health and Human Services Agency, and pay attention to the damage that is being done here.
Yeah. Cancer
Senator
is
Marshall.
parasitic. Oh, interesting. I didn't know that. Jay Shellerman. Oh, guys. Oh my gosh. You guys are being so kind. Thank you. Thank you so much. I appreciate you. Thank you. Thank you for the gifts, guys. Thank you. For real. You guys are really nice. You're too materialistic. You're definitely not seeking truth. You're stuck in your own biased tunnel vision. Light is life. You think that the earth is flat. Like what are you talking about? I'm being too stuck in my ways, bro. You think that the earth is flat. Like, what are you talking about? Come on, man. What? Stop. Stop.
All right. Thank you, Chairman, and welcome, Mr. Secretary.
Sarah, let's
One of your themes
go.
for the CDC is transparency. And I think when I hear you talk about transparency, I think part of that is sharing what you know, what the CDC knows with parents so that they can.
No, Ruben. No, dude. That's not how it works. Like, okay, so you try. Okay, so what you're talking about, trying every option and then see if it works. That happens, bro. That does happen. It's called the FDA trials, and that's what happens. And that's how something goes from an untested, unproven theory to actual medicine, right? That is the process. So you're right in the fact that, like, you know, how do these things work? How do they actually benefit? What's the point? You know, what's the efficacy of these questions? They're valid questions, man, but they're already answered, and that's what medicine is. So that's what the idea is that when you are at the point where you need something in order to live and cure a disease, you're not figuring out those questions yourself on the actual, you know, bedrock. You're actually using a proven, tested medicine to actually help prove, because the thing is, Ruben, your time when you have a disease of cancer, every single minute that you do not address that is actually, thank you, is every single minute that you're not treating that disease, it's getting worse. So you don't have time or money to try everything. You need to get something targeted to actually help you.
Make decisions. Behind me, yeah, I know it's going to be hard to see from there. I can barely read it.
What
This is the
the-
current CDC recommendations for vaccines for children.
Oh my
On day
gosh,
number
the
one,
CDC,
they get their
here we
first
go.
jab, hepatitis vaccine. By the time they're 18 months, they've had 18 jabs. By the time they get to be able to vote, they have 76 jabs.
76. Oh, 76 over 18 years. That's nothing, dude. That is nothing. Like, what are you talking about? Carrie, I would check with your pharmacist, but I'm pretty sure. I think someone got their shingles, COVID, and flu shot today. So I think it's totally okay. It's basically, are you more or less likely to get it and go back? If you actually will go back, maybe it'd be okay. But like, you have to just push it. You just have to get it done. That's what I think. Oh, thank you, Jay Shellerman. I really appreciate that, man. Yeah, I think it is. Science as an institution is under attack. Absolutely. So for sure. 76 jabs. Like, okay, so then what's Okay, Light, what is the right amount of jabs? What's the right amount? Nano World, what's the right amount? You guys don't even believe that viruses are real. So you think that 0 is the right amount. So you saying that's too many, that doesn't make any sense what you're saying. You're just speaking nonsense.
Now,
exactly.
When I listen, what I hear
you guys
say
don't
is
think that viruses are real. So if you don't think that viruses are real, why would anyone ever get a vaccine? That is the insane. What's up, GTs? GT fans, GT nerds. Thank you for coming in. What's up, guys? We're watching right now the RFK Senate, the panel, where he's getting absolutely raked over the coals by Republicans too, and Dems, which is awesome. And then we're also, if you guys want to watch the full one with the video, I'm actually streaming it on YouTube, so you can watch the thing, and I have TikTok chat up, so you don't have to miss anything. But yeah, or you can stay here and we can just watch the audio. Watch me and listen to the audio. I think that Maui Wise, I think that's true too. I think like you have to have like pinches, 76 pinches. Like how we have 40 minutes left. What's up, guys? Welcome in.
Look, vaccines are drugs. We need a measured
exactly,
response.
Omar. Just 76 pinches. Yeah.
And a measured, when do we use this? It's interesting that the United States has put age 65 and older for COVID vaccine.
Medicine. 76 medicine pinches.
UK has chosen 75
exactly,
and France
Leslie,
80. Obviously,
exactly. Guys, there's 76 shots, okay? That's over the entire so they're including all the different flu of every year. Okay, we have that many vaccines. Why? We have that many vaccines because that's how many diseases used to kill you back before we had vaccines. There's a lot of diseases that used to kill people before there were vaccines for them. And now we have vaccines so you don't die from them. That's the whole point. I'm not... Light, you don't even think that viruses are real. Like, what are you talking about? You can't even, I'm afraid you can't even, come on, man. Exactly. Omar, exactly. When you have no explaining, then going to politics or about flat earth. I don't know what that means. Nice. I don't understand that.
Sciences disagree exactly when that should or shouldn't be. Hepatitis B vaccine, it makes no sense to me. I've only delivered.
Yeah, no, those viruses are real. They exist, and they used to kill that many people. There were dozens of ways that you could die from the preventable diseases, but you don't anymore because of vaccines. That's the whole point. You don't see anyone with measles anymore because there was people it was almost eradicated because of vaccines. That's the whole point. Vaccines are a victim of their own success in a way. You know, they're so effective that you don't see anyone dying of polio anymore. So people say, why do I need to get a polio vaccine? And it's like, well, that's because you're vaccinated for them. And that's why we keep getting vaccinated for it, because we don't want it to come back. Oh, thank you, Nova. Well, I fell asleep on the stream last night, so
5,000 babies, but we do a hepatitis test on every mom. By the time she delivers that baby, I know her pretty well. And if she doesn't have any risk factors, if she's not an IV drug abuser, if she's in a stable monogamous relationship, nobody at home has hepatitis.
This is this whole idea of the HPV thing not being necessary, which is just absolutely nonsense, guys. It's incredible. Guys, you can get HPV in a lot of different ways other than just being, getting it. Exactly. Oh my God, witch please. Yes, dude. Exactly. They don't believe that viruses are real. They don't even think that the immune system is real. That was a new one to me, that they don't think that the immune system is real. They just think that there's a lymphatic system. They don't even, it's wild to me. It's crazy.
I don't know. I don't see the benefit myself in that hepatitis vaccine. Everyone's eligible
this
for it. Everyone can get
doesn't believe.
And my
I don't see the
pediatricians always agree with me. And no, I'm not saying if you don't know the hepatitis status of that patient, they shouldn't get it. I'm not saying if this.
Louisa, because you can get it from a lot of different areas. You can get the HPV from a lot of and related viruses from a lot of different stuff. You can get it from needle pricks if you're a healthcare worker. You can get it from a lot of different stuff.
This is persons that had no prenatal care. That puts them at risk for hepatitis. Can you just speak a little bit, when you talk about transparency and trying to empower and make vaccines available, these should be treated just like a medication.
Yeah, Wade, exactly. A public toilet. Exactly. There's a lot of different ways that you can get it.
I mean, I say I'm not anti-vaccine. Saying I'm anti-vaccine is like saying I'm anti-medicine. Well, I'm pro-medicine, but I understand some medicines harm people. Some of them have risks. Some of them have benefits that outweigh those risks for certain populations. And
What? Okay, the problem with this stance that he constantly says, I'm not anti-vaccines, I'm pro-good vaccines. Okay, then which ones are those? Which ones are you talking about? He always says that, but then he doesn't clarify which one is he actually talking about. Like you say that stuff. Like, I don't understand. It doesn't make any sense, Light. What you're saying, it doesn't make any sense.
Same is true with vaccines.
I don't know. Are you talking about round Earth and flat Earth, or are you talking about vaccines being real? I don't understand your comment. You gotta make sure you're talking about it.
And we don't understand the risk profile because
Luisa, he's talking about other vaccines too. He's talking about HPV here too. So I'm not lost, Light. I can't. Or oh yeah, that's right. You don't believe gravity is real, Light. You think that you've scientifically disproven gravity being real. Oh my gosh.
vaccines are the only medical intervention, medical device, or pharmaceutical drug that are exempt from pre-licensing safety studies.
It's insane.
And so there are two hepatitis vaccines, and one of them had a safety study that lasted for 4 days on 143 kids for a product.
Ask him who? Eric, what are you talking about? I would love to have RFK on. That would be hilarious.
It's going to be given to 76 million kids. Yeah. The risk profile prior to the introduction of the vaccine, the risk of a baby dying from hepatitis B.
Gaynor, I don't know, you haven't said a single thing. Oh, and I'm sure he'll invite. Yeah, he'll come on my stream for sure. Gaynor, I don't think you've said a single correct thing in chat I've ever seen. I don't think you've ever been right a single time yet.
Was 1 in 7 million. That means you need to give 7 million hepatitis B vaccines to prevent one death. If you're going to give 7.
Oh my gosh, Gaynor, you're anti-vaccine for pets too? So you want people to you don't want kid you don't want. Wait, Gaynor, do you think that like viruses are real?
7 million.
So, Mr. Sticker, and I guess before the press labels me wrong, I'm not anti-vax either. I think MMR's been a great vaccine. DPT's been a great vaccine. Polio's been a great vaccine. Smallpox. So there are great, but it's the measured approach that we're after, the transparency. You're trying to empower parents.
What are you talking about?
But I feel the difference is sometimes my friends across the aisle feel like there's a one-size-fits-all, that they should be telling parents what to do. And what you and I are fighting for is we want to empower parents to make these decisions. I want to talk about morbidity.
Exactly, Gaynor. See, you guys, it's always you just it. Yeah. Oh my gosh, dude, that is so insane. Like, you realize that the rabies is 100% death rate, 100% death rate if you get it. And you realize that, right? Your kid, your dog, you, and it's actually on the rise right now. I saw the thing, rabies is on the rise right now because of anti-vaxxers for their pets. So it's wild, dude.
And mortality.
Exactly. You don't even think that rabies is real.
COVID for just a second. It is so true that two things can be true, and I don't understand why, just the rabbit hole some of my colleagues are going down. There's a big difference. When I was out there practicing, doing volunteer work, I was so confused myself on the numbers. People dying with COVID versus from COVID. And we still don't have that message. And I think that's what I hear you saying as well. How many people died from COVID versus with COVID is a different answer. The situation today is so different.
Guys, we know the expected deaths, okay? We have the amount of expected deaths that people have that die. And then magically during the pandemic, there's a huge hump, right? If you stack all the people that died, all of a sudden there's a bunch of people that died all in the pandemic, way above the expected amounts. Like the expected amounts right here. And all these people died. So how are all these people dying?
different when this monster virus was made at a laboratory in Wuhan, China, and none of us had ever seen this virus and we had no immunity to it. But today, every American's had Wuhan, China, and for an answer. The situation today is so different when this monster virus was made at a laboratory in Wuhan, China.
Oh my God. Lab leak. Lab leak alert. Got a lab leak alert. This monster virus that was made in a lab in China. Guys, this is why it's so infuriating. The actual science, by the way, you guys want to know the actual molecular biology of science on SARS-CoV-2, by the way? So basically, SARS-CoV-2 was a novel virus because we didn't have any antibodies for its furin cleavage site. So we didn't have anything for it. Coronaviruses existed in nature and they exist all around us, right? They already are there. But why is SARS-CoV-2 different? One, it was unique. It was novel. That's what novel means. We didn't have any antibodies for it, okay? 2, that furin cleavage site, that was the unique part of it that we didn't have any antibodies to. What made it so different, right? Why is this different than other things? Well, it's because it has a 10% better binding affinity to ACE2. 10%. That's it. That's all it was. A plus 10% binding affinity. It wasn't like some crazy, like, oh man, this thing has like a plus 1000% binding, it wasn't like this crazy thing. It was just plus 10% binding affinity. So the actual science, guys, is that it actually is, we got lucky. That is the actual thing. We got super, super lucky because we are, it was easy to treat. Coronaviruses are easy to treat. They're easy to deal with. And the mutation in SARS-CoV-2, it was only a plus 10% binding affinity. It wasn't like a 50%, 75%. It was very easy to deal with. And we got lucky. And the problem is all these anti-intellectualisms people and these anti-science people, they're impugning our ability to deal with a really bad virus if it does come to fruition in the future. That's the problem. That genuinely is. Heather, exactly. Long COVID is real and it's happening everywhere. And there's people that come into chat here, Heather, that talk about their kids having chronic vertigo now because of long COVID. They have a loss of hearing because of long COVID. It's actually happening. No, Ruben, it isn't. It isn't a constant tug of war, man. It's people's lives exist, man, and you have to protect their lives. That's the fact that you would think that it would be okay to lose those 1.2 million Americans and you wouldn't do anything in order to save their lives is disgusting. It's unpatriotic. It's anti-American, and it's against everything that we should both stand together. And it's actually gross that you'd even say this is the nonsense that the Republicans were talking about at the very beginning, where it's like, oh, the grandma's going to have to die for the economy. And it's so gross. It's just absolutely gross. Yeah. Good, Heather. Yeah. Especially if you have an immune compromised family member, guys, or someone that you see regularly, or you're immune compromised yourself. Like COVID is going around and it is absolutely going up an amount. So masking in dense crowds right now, and I would definitely think about it. Genuinely think about it to protect you and the people around you.
And none of us had ever seen this virus, and we had no immunity to it.
Exactly.
But today, every American's had COVID a dozen times probably, and we built up immunity. I think that's
not true. It's not true. About 20% of the United States has never had COVID. So the idea that everyone's had it, and it's just like, think about that. Like that doesn't make any sense.
That both things are true. It was a miracle. Warp speed was a miracle. What President Trump and his team did, and it saved millions of lives, most likely. But it's also true that it probably killed some people. Like most vaccines do, there is a death rate associated. So both things.
Guys, no, it's not. It's not. It's not. There's basically has been about 100 people that died over the COVID vaccines, over 6 billion dosages. Hey, Jamie, how's it going? So, and what happened is that basically there were elderly people that had an immune response to their that first dosage and had basically an allergic reaction to it. It's insanely rare. So we're talking about 100 people out of the 6 billion. So it's absolutely insane. Where's your proof that people died from the vaccines? Zero proof, zero fucks. Where's your proof that anyone died from the vaccines? The what it is that you guys have polluted these people's brains so much that psychosomatic effects have been given to these people where they were perfectly fine, perfectly healthy, got the vaccine, and they thought that they were fine. And then now, because of people that are sowing disinformation and pushing, poor mental health, guess what? Now they actually think that they're having some ill effects of the vaccine, when in reality it's psychosomatic, and they're having a mini panic attack. And guess what? Now they think that they're having heart palpitations and they have myocarditis, which they never had. Is just they're having a mini panic attack. And it's you guys. It's genuinely a lot of the disinformation and the anti-vaccine people. It's a mental health issue that we are having. We absolutely have a mental health crisis in this country, and we have these people that are being triggered through conspiracies. It's a way for them just to be deluded into this alternate reality that just doesn't exist, and it's absolutely insane.
Or true, anything else you want to clear up on morbidity, mortality?
It's K-Bug. It's a death cult. These anti-vaccine people are belonging to a death cult, and they are trying to get us all into it. Yes, it is. Yes, it is, Gaynor. It absolutely is.
Of COVID and COVID vaccines.
Well, I think you just cleared it up. The COVID vaccine was critical. President Trump's leadership got it to us when our society was locked down. It allowed us to open up. It was, as I said, perfectly matched to a virus that was new in the experience of humanity. And so
it's just RFK's, like, how he gets from here to more people died from the vaccine from the virus. That's what I don't understand.
And so it was a miracle. Right now, we're dealing with completely different circumstances where the virus has mutated, where it's much less dangerous, where there's a lot of natural immunity and herd immunity. And so the calculus is different, and it's complicated. And, if you just want to turn everything into a soundbite, it makes it, you can't have a grown-up conversation.
No, they didn't.
But, there were more reports to theirs, which is the only...
Yeah, you should... I'm sorry, there's a mental health crisis going on in the United States, and you're part of it, Gaynor. I'm sorry.
Only surveillance system that we have of injuries and deaths.
I'm just doing it for the likes.
All vaccines put together in history.
Nano world.
So we have to acknowledge that there was a cause. We acknowledge that there was a benefit. We can't quantify either one because of the data chaos at CDC. And that's all I'm saying. And they think I'm being evasive because I won't make a kind of a statement that's almost religious in nature. Did it save 1 million lives? Well, there's no data to support that.
Of course there is.
There's no study that there's modeling studies.
Yes, there are. There are studies now. Like there were modeling studies in 2022, right? Because we were going through it right then. But we have absolutely studies, retrospective studies that look at this stuff, guys. This is exactly what the entire field of epidemiology is about. This is all what it's about.
Faulty data. I'm not going to sign on to something if I can't do it to a scientific certainty. It doesn't mean that I'm
scientific certainty, guys. Does scientific certainty ever exist? I mean, no, right? We're never going to know everything 100%, right? It's only not going to be 99%. But that's the problem, is that people take that 1% that we're not 100% sure ever, which science never is, and they impugn the entire scientific method because of that. It's absolutely insane.
It just means I'm pro-science.
No, it doesn't. He's insane.
Thank you, Senator Lujan.
He's absolutely insane.
Thank you, Mr. Chairman. Secretary Kennedy,
You can't be pro-science and disagree with every single mainstream scientific opinion. You just can't. I'm sorry. That's just nonsense. The same people, guys, the same people that say they're pro-science think that viruses aren't real, don't believe in germ theory, don't think that there's an immune system, think that we have a flat earth, that the earth is 6,000 years old, they're anti-evolution, don't think that dinosaurs are real, think that humans aren't contributing to climate change. They don't think that vaccines are safe. They think that we're living in a simulation, and they think that gravity is fake. But they're pro-science, they say. We're pro-science. Nonsense, guys. It's absolute nonsense.
Daskalakis, who recently resigned as director of the National Center for Immunization and Respiratory Diseases, his resignation letter stated he and his team were never allowed to brief you. I'm curious who you're listening to, since it's clear you're not listening to qualified experts like Dr. Daskalakis. Can you give the committee the name of the person?
I don't consider Dr. Daskalakis.
Mr. Secretary, the question that I have for you is, can you give the committee a name of who you're getting briefed by?
I'm getting briefed by all the time by CDC.
Just a name.
No, he's not.
Well, Dr. William Thompson's one name.
Thank you very much, sir. Now,
but I can
William Thompson. Let's look at this guy. William Thompson. CDC. Oh God. I'm trying to find him. William Thompson, U.S. Centers for Disease Control. Oh God. He's a psychologist. Oh my God. Dude, he's one of the vaccines cause autism guys that's been completely discredited. Unbelievable, guys. Insane. He's in that film Vaxxed. So Thompson claims to have evidence that the CDC altered. Here you go. You can look at this real quick. So Mr. Thompson claims to have evidence that the CDC altered the rules of data collection for a study in order to omit data which would show African American boys had a greater incidence of autism after MMR vaccination. Hooker used the raw data provided Dr. Thompson to write and publish his own analysis. Dr. Thompson, however, has not spoken about the position in public, releasing only a statement through his lawyers that he has not addressed the claims that were made by the Hooker and team. Independent analysis of the claims have shown that there is no evidence of an increase in autism cases after vaccination in American boys or any other subset of the population. Dr. Thompson is a psychologist employed by the CDC. He was a co-author of a number of vaccine safety studies published by the CDC, including the study that he claims omitted a correlation between autism and vaccines. What? It's the 2004 pediatrics paper. So he's saying there's a medical malpractice that he himself was on that paper that omitted it. And he's saying he's a whistleblower for that. So it's unclear why he says this. Nobody knows. He's just making things up, dude. He's one of these guys that just will lie and say anything, and this is why they continue to go to him. He's a psychologist, and he has no idea what he's talking about. Yeah, Gaynor, they all vaccinate their kids. What are you talking about? Well, that's nice to know. So again, guys, so he's getting his they're all about who. Everyone says that I'm not a doctor, that I am not qualified in order to sit here and refute RFK. Well, RFK is getting his information, guys, from a psychologist that has less qualifications. His PhD is in psychology. I have my PhD in microbiology. I'm literally more qualified than the person that is teaching RFK about this stuff. So there you go, guys. All these people coming from my qualifications. RFK seems to think that it's pretty legit. Unbelievable, dude. Unbelievable.
I can get you a whole list of others. It's on my schedule.
Mr. Secretary, that's not a hard question. You know a lot of answers.
I'm not being evasive.
Okay, then you answered it. Let's go on. Now, you said that you're soon going to release a study claiming to reveal the cause of autism, timed unsurprisingly with the upcoming ACIP meeting to justify taking vaccines from Americans. Now, as you know, autism affects millions of children.
Oh, thanks, Zero Fox. I appreciate you. Thanks for that. Yeah, I am a scientist doctor. It's true.
Yes, you'd have the nation's top medical experts working on this. Mr. Kennedy, you hired a man named David Geyer to conduct the
I mean, we're going to try to get through this. We're going to try to get through this, Renee. We have 35 more minutes.
No.
We have 35 more minutes.
Is Mr. David Geyer working for HHS?
He's a contractor, but he's not conducting a study.
He's a contractor?
He's a
Do
contractor.
you know who works for you, Mr. Kennedy?
Yeah.
Do you know that Mr. Geyer is listed as a HHS on the employee directory as a senior data analyst, not a contractor?
He's a contractor. He's not an SGE.
So is your website wrong?
He's not an SGE. I don't know what
I'm going to pull up the website for you.
He's a contractor.
If the website says he is a senior data analyst, will you at least admit to the committee?
Well, I don't
that you
know
were
if
wrong?
a contractor can be classified as a senior data analyst
sir.
or not.
Oh
Is
my gosh.
Mr. Geyer a doctor?
No.
Did you know he never went to medical school?
He's not practicing medicine.
Did you know that he got caught in Maryland and was charged for practicing medicine without a medical license?
Oh
He
my
was charged by the
God.
medical board, he sued the medical board, and the medical board was found to have acted in actual malice and was fined $2.6 million by a judge in Maryland for doing that.
See, so you choose to know a lot when you want to know a lot.
Oh, damn. That was exactly. So he sits there and says lies behind obfuscation, and then but now all of a sudden, like, now he knows exactly what it is. Unbelievable. He got so mad about that. He got so mad. Exactly, Omar. Selective amnesia.
It's incredible, Mr. Kennedy.
Senator,
It's
you're
incredible.
ridiculous.
So here's the question I have. You brought him in to do this study. I think there's no question
I
about it.
told you he's not doing a study.
Is he participating in the study?
No. What
Is he
he's
doing any analysis in regards to this study?
No, what he's doing is getting access to the Vaccine Safety Data Link, which is the biggest repository for vaccine information that your friend would not give us for 7 months. For
Mr.
7 months,
Secretary, let me ask you this question, just because you know the answer. What is Mr. Geyer doing?
he is the only one, because Congress ordered CDC to open up the VSD to him in 2002. He's the only outsider who's ever seen it. So because CDC will not give us, they have
Mr. Secretary, is he participating in this then?
No, he
But
is.
you just said he's the only dude that knows what's going on here.
Do you want me to explain it to you, Senator, or do you
No, because
just
you're
want to
confusing
show?
me.
You just want to showboat?
I'll submit
You
this.
just want to showboat for your ads, or you want to hear a real answer to your question?
Mr.
Oh my
Secretary.
God. We're waiting, RFK. We're all waiting.
You choose to know answers to questions with some colleagues.
I'm willing to give you the answer. I'm willing to give you the
Mr.
answer.
Secretary, someone should have asked you, maybe President Trump should have asked you, are you a trustworthy person? And we should have waited for an answer then. Let's move
I
on.
don't even know what you're talking about. You're talking gibberish.
Mr. Secretary, let me speak slowly and clearly so that you can understand me through my New Mexico accent.
And then give me a chance to
Does
answer.
this help? Can you understand me?
He is so mad,
Appreciate that.
Kerry.
Mr.
He is so
Secretary,
mad.
yes or no, did you hire Mr. Geyer to do this study?
No.
Mr. Chairman, well, let me ask, maybe we'll just get a good answer here. Mr. Secretary, will you commit to sharing the protocols used for the autism study with Congress and to the public?
They're public.
Will you commit to giving it to this
Which
committee
one?
by the end
What are
of
you
the
talking about? They're public. How they haven't even been released. What is he talking about?
No, not because
you commit to give
that's
it-
not the way it works.
Will you
don't
commit-
even know what you're talking
Mr.
about.
Secretary, will you commit to sharing the protocols for the study by the end of the month?
We already have
You
put
just said
out.
it's public.
We put out the notice of funding opportunities,
Oh
and then
my
the
God.
scientists.
Oh my God, we got flagged for misinformation. Oh my gosh, that's so funny. Funny. Yeah. Let's see. It didn't show up. Like, it didn't show. I don't think. I mean, it. It didn't say that it's just saying it's a warning. It hasn't been flagged and removed No, I think like if it usually tells me like if it's if we're being removed off of the thing and people are still joining, so I think it's fine. I know, yeah, no, Amos, exactly. They're looking at the thing that I know. Damn it. I mean the big parts. How insane is it that I can't even the original Senate Senate hearings, you can't even look. It's so crazy. Yeah, exactly, Shella. I know. Exactly. Exactly, Mary. You can't even have your own it's insane. Yeah, maybe George. Yeah. Maybe George, maybe. Oh. All right, well, I don't know what to do. I think I mean we just gotta we gotta change it up. So we'll just do normally what I do in general. I mean, we watched 3 hours of it, so I think I'm I think I'm fine. I think I'm fine. We've done it. All right, well, back to our regular scheduled program, guys. We'll go back to our regular show, okay? Let's switch it up. Let's switch it back up. Let's go back to what I normally do. I actually got a cool science segment. They're genetically modifying horses now, which is kind of cool. I don't want to get another flag, so we're just going to go back to what we normally do, to our real. Oh, ACE2 is the cell flag that the SARS-CoV-2 binds to in order to get taken into the cell. So yeah, it's the receptor that's on the outside of the cell that particular virus binds to. Yeah, it's pretty cool. Hey. Good night, Addie. Have a good one. All right, real quick. I know exactly always around. Exactly. It's crazy. Okay, real quick, guys. Real quick. Thank you, guys. Thank you. Thank you to our latest subscriber, Renee. Thank you so much. Jay Shellerman, thank you so much for being so generous tonight. I appreciate you. Kathleen, Melanie, NB Kami, Ducray, Jen, Omar, Maiden, Carrie, thank you guys so much. Thank you for 1 like, 1,000 likes, or 8,000 likes like Jen. Thank you so much. NB Kami, Frank, Narfor, Brandy, Carrie, Omar, Uncle Hippo, Lefty Left, Atif. Thank you guys so much. I appreciate you so much. Thank you for all the subscriptions, guys. Subscribing is the #1 way that you can help the stream, so I appreciate you so much. Thank you for the follows and the shares. The shares makes a really big way that you can actually have a you can actually help the stream grow. And also the link tree, guys. The link tree is has my my YouTube. I'm completely revamping my YouTube, guys. That has my best of the best. So if you want to see my best conversations that I've had, that's all on my YouTube now. So they're all like cut out, perfectly edited, so you can watch just those. The best part of the show. Also, that's where my publications are. You can and join the Discord. So the Discord is going to have a subscriber only voice chat hangout after the show, where we kind of just hang out and talk all that kind of stuff. And then also, yeah, my publications. Also, guys, has anyone gotten a vaccine this week? Has anyone gotten vaccinated this week? Because if you have, we can add you to this number right here. These are our vaccines. We are trying to get people to get vaccinated to save their lives and the lives around people around them. Because we love vaccinated people here. We love public health. We love people that help and contribute to their family. Mary, you got one? Pneumonia vaccine? Your baby niece? Yeah, let's do it. I think we're gonna add it. We're gonna add it. We count family members. Getting mine in 2 weeks. COVID and flu, 5 in my family. Nice, Rachel. Dude, come back and get those for sure. That's going to be cool. We got 2. So we Mary, thank you, Mary, and what was the other one? The pneumonia. We got 2. Mary, thank you so much, Mary. Yes, that is awesome. We have 2. 3, 2, 1. Oh, let's go. Mia, come get vaccinated and then come hang out. That's awesome. Get the V's. We spam V's in the chat for vaccinated people, and it's our goal to make America vaccinated again. MAVA. That's what people are talking about. MAVA's in chat. Big. We're making it big. We're making that known, guys. That's our thing. Make America vaccinated again. Vaccines are cool. Vaccines are very cool. You got it last month. Nice. Well, we're trying for a week in the last week. So I appreciate you, Heatherish. I appreciate you, but we're not going to count you on the vaccine board just yet. Just yet. All right, guys. All right. Yeah, exactly. Yes, Maiden. Exactly. Thank you for pointing that out. Okay, cool. Yeah, get the booster, get your COVID shot, get your flu shot, and we will celebrate you. Also, the Q is yes. Bless mom. Thank you. Yes, get all the vaccines, guys. The best way to as a parent that you can love your kid. No, Carrie, we're just going to keep this going. We've just started it this week, and we're going to keep it going. So we're just going to keep it up. Yeah. Ruben, that's not true. I would not. Don't say that. You don't know, bro. You don't even believe in vaccines, and you're going to give medical advice to people. What are you talking about? 38. Ruben doesn't even think that vaccines. Okay, that's okay. That's okay. I don't understand what he's. Vaccines are safe and effective, guys. Get vaccinated. Get vaccinated. It's good. All right, guys. Yeah, definitely, Skyline. Yeah, they are. All right, guys. Well, while we wait for someone to join, I got a. Let's see here. Can you get GBS from the vaccine? Yeah? First CRISPR horses. Well, you already know what it is. Why would I tell you? Glacier. Why are they against? They better not be, Robin. There's no reason to be against vitamin K shots. The only reason that you have the vitamin K shot is just to prevent brain bleeding. So it's just insane to not be for vitamin K shots. Hey, Glacier, how's it going, man?
Good. Yeah, how's your night going?
Good, dude. I mean, I think we got that misinformation flag from just.
Oh no!
I know. Yeah, it's crazy. We can't even watch a congressional hearing anymore. But I think, hopefully, I'm not seeing anything on my live that says that we're flagged anymore. So maybe it was just a warning and we're good now. I don't know. We'll have to see.
Yeah, I'll see that. Yeah. I was wondering. Did you see the video? You're familiar with John Kennedy, right? I'm sure.
Johnny Kennedy? No.
John Kennedy.
Okay. Yeah.
Did you see the on the news recently? It was, I believe, it was in the same business as what was going on with RFK, and it was after his testimony. John Kennedy, he held up a picture of the chest burster alien from Aliens.
Oh yeah. Oh my gosh!
They said we were all going to turn into aliens for eating the shrimp.
Yeah, it's insane, dude. It's insane.
Yeah, I don't know if he was being serious or if he was just being facetious.
Yeah.
But that was a lot. Yeah.
Yeah, JSAVs, that's not a study, dude. That wasn't a study. That was an opinion article. There's no peer-reviewed data to point to that. It's just nonsense. Again,
So
just
do you think
nonsense, dude.
do you think that most of the damage that could have been done already in this country, specifically from the lack of vaccinations, and just simply the lack of management with the pandemic, do you think that with all these variables, that most of the damage that could have been done has already been done?
No, I don't think so, man. I think that there's a lot of people that is that they basically do get vaccinated because of the schools and because of the school requirements. So it is a big thing. So especially because a lot of people don't like, yeah, guys, if you're watching this, you're already like probably in the top percentile of like knowledge or like wanting to be involved in society or knowing what's going on. You're already kind of in the elite already, but there's a ton of people that don't watch anything like this, that don't read the news, politics, all that kind of stuff. And basically those are the people that get vaccinated when they have to because their kids, need to go to school. So they just get it done, and that's just what it is. And the problem is that they hear this controversy brewing, and they don't understand why or what it's about. And just the fact that there is a controversy means that they doubt that it's legit. So and we've had multiple people coming in here that say that exact thing. They say, yeah, I'm not legitimately, I'm not anti-vaccine, but I just heard there's a bunch of problems with this one, so why would I get it? And now that's just nonsense. So,
right. So what would be like if one person in a group decided not to get vaccinated, right? Of course, they would be putting at risk the people who have sorry, I'm drawing a blank here. The other people who already have complications, such as like, let's just say autoimmune issues, they would be putting them at risk, of course, if they didn't get vaccinated. But if the people, let's just say like the young kids going to school these days, if they're young and healthy, like what kind of complications could we see down the road with the students, not getting vaccinated? Like, is there any like more significant complications that we could see with kids, or that we are seeing as a pattern now?
Yeah, I mean, we have the spread of stuff that we've never seen before, like measles in our generation. Our generation doesn't know like measles outbreaks. I mean, measles is such a bad one, guys. Like, genuinely, it's unbelievable. Measles actually wipes out all your immune system's data bank. So basically, it doesn't have any antibodies anymore that it can actually make against anything. So you have everything becomes a novel virus, and it's just absolutely insane.
Yeah, the vaccination in particular, the COVID for SARS. Sorry, and that one, like that's related to the measles, or you were just saying vaccinations in general?
Well, that's the thing, is that the common. I don't know, George, if there was any, then it could, if there was, but I don't know. The problem is that these people have said for the longest time, and I knew that they were lying, but unfortunately they proved that I was right, and that they said, oh no, I'm not anti-vaccine, I'm anti this vaccine, where they had all these lies about, oh, it's it came out too quickly, that's why I don't trust this one. And then, well, guess what? Now they're all coming for all vaccines. They're taking their hesitancy, like we always knew, wasn't just about COVID, it's about all vaccines. And now these people, now the window has opened so wide that now you have these people in it that are saying, oh yeah, why would we get any vaccines? Because viruses aren't real. Why would we get any, the immune system is fake. All this anti-science nonsense. And what's happened is because the anti-science, the wedge of that anti-science spear has been thrust forward because of the pandemic, it's opened up in people's brains about, well, yeah, wait a second. If science lied about the COVID vaccine, why are they maybe they're lying about all these other vaccines too. And that's the thing, is once you believe one conspiracy, an anti-science conspiracy, this one chink in the armor, now it's like, well, why wouldn't this be? Why wouldn't this be? Why wouldn't this be?
Yeah, I see now. So this is more about, I see, because I've listening to the topic here, like on many nights and occasions. It's mostly, we've been talking about like SARS, but I understand now that like the chart up there, or what you're keeping track of when it says vaccines, like it's actually vaccines in general, not just the pertaining to COVID.
Oh, these are all vaccines. We're any
Interesting.
type
Okay,
of
I understand
vaccine.
now.
Yeah, these are just community vaccines that we've all gotten, like Tdap,
Okay.
MMR boosters,
Oh yeah,
all that kind of stuff. Yeah.
And that's okay now. Yeah, it's making more sense now, because I thought this was more like pertaining to SARS, but and it's making more sense now. Like listening to all the
Shingles. Yeah.
I'm not here for like the whole time. I just come in here for a short amount of time, but it's making sense now. Like you're speaking about like this common denominator that we're seeing from misinformation, that people are not wanting to get any vaccines.
Yeah, exactly.
Okay, I understand.
The step into the door was, this RNA technology is new and dangerous, and I don't trust it. And then now it's let in all this misinformation that people don't trust all of science now, and they don't think that it's legitimate at any of it is legitimate. And one of the reasons why I don't ban people in chat, guys, is that you can see these people, you can see what they actually believe, and you can ask them. They don't believe that viruses are real. I mean, one of the reasons why I go through and I ask the litany of conspiracy questions. I mean, the same people, they believe all of these, guys. They don't think that viruses are real. They don't believe that there's even an immune system, a lot of them. They think that there's just like a limbic system without an immune system. I have no idea what that even means. They believe in flat Earth. They believe in the 6,000-year-old Earth. They're anti-evolution. They don't think that evolution's real. They think that dinosaurs were fake. They think that climate change isn't real. That all vaccines are dangerous, that more dangerous than the disease. They think that gravity is fake. I mean, like, it's just, once you believe one, it's just boom. It just takes off. That's the reason why I ask all these questions, and they get so embarrassed because they say, they're shown, and it's like, why are you changing the subject? And I'm like, well, and some of these link together, right? Because it's like, well, if they believe in a 6,000-year-old Earth, then they believe that Noah and Moses lived into the 800s or 900s. So then what was different back then that made them all live to 900 years old? Well, it must be the microplastics and the vaccines. So, wow. So if you get rid of the microplastics and the vaccines, then wow, I could live until I'm 900 years old. So yeah, it's really bad. It's really, really bad.
Yeah, I didn't think that it would. I was always aware that there were some individuals, like even when I went to school, I know there was I didn't go to a very big school, but I was always aware that in every school there was always a parent that had spoken of not wanting to vaccinate their children. But those were very, like, one out of hundreds of people that were like that.
Exactly.
But I didn't think that it would be like, and it's always been like that, even since like the hippie days. But even today, I didn't think that it would be in the numbers that we're seeing today. Like it's almost like we're talking like counties of people that just don't want to get any of it. I didn't think it'd be like that. I thought it'd just be like, one out of hundreds. But now I'm understanding, I'm seeing what you're talking about now. Yeah, that's very scary.
It is, man. It is. And we're talking like, vaccination rates where it drops like 15%, and now you don't have herd immunity, where now it's like the vaccines are less and less effective. So they still have some effect, but they're not going to be like super effective, because how viruses work is the more viruses are out there, the more viral genomes that are out there, that means that they're able to recombine with one another, and which means that they can evade the vaccine immunity. So that means that you want to keep the amount of viral genomes low. Just the amount of genomes that are existing out there, or so that's why it's so crucial. That's what herd immunity is that when there's such a small amount of viruses, they can't rapidly mutate through viral genome recombination. So there already is their single nucleotide changes are going to happen, and your body actually has a thing called somatic hypermutation. So your immune system developed into a world where viruses existed and mutated. But the thing is that they, this global transfer of genomes, viral recombination events, is new. Like, we are able to have flight and all these kind of things where, now these genomes can switch with other genomes that were on the other side of the world. They aren't locally there. And that's what a pandemic is, right? A pandemic is global, pan-global. There's always epidemics, which is like local
Right.
virus hotspots that are happening. But what happens is that that pool of viruses is relatively similar, and but the actual viral genome recombinations that are happening in the entire world is new, and your the one nucleotide change, your body through somatic hypermutation, where it actually makes antibodies to deal with those, so it takes them out, no problem. But the genome recombinations where everything is changing and you have these whole new viruses and stuff that we saw in with SARS-CoV-2, that's the dangerous and the real scary part, and that's what we're talking about, and we're trying to keep it down.
Yeah, I see that. Interesting. So what do you think is going to happen with this or where do you think this will go legally? Like with Florida talking about, like, they don't have to have their children vaccinated to go to school. Where do we as a community come together, or as a nation, I suppose, where we can not tread on the line of these people's rights, but also be able to have these kids vaccinated in school?
Yeah, I mean, it's a good question. I think that's the question that we should be having, right? The conversation we should have is vaccines are safe and effective, and we need to get shots in arms in as many people as possible without like holding them down and shooting them, right? Because that's like that's crazy. And I think that the idea is so you can either find them, Germany and France will charge them money if a monetary fine. But the United States does it by school. So you have to, in order to go to public school, you have to go through, and that has some problems where, one, you have to wait until you're 5 years old in order to really have the impetus in order to get vaccinated, which is a little bit too late. And then
Really?
two, vaccines start it's like 6 months. So the question then is, like, you can basically have an increased fine, like Germany, but if you pay that fine, then you could be going to public schools unvaccinated. So that's I don't like that. But I do think like there could be and there should be like a yearly stipend given to people that are vaccinated. Like, we know that healthcare costs skyrocket in the face of these diseases going rampant. It's a healthcare cost and a life cost thing, right? So, like, for example, like measles, it costs $100 for a measles vaccine MMR versus $47,000 per patient for a measles outbreak. So, there's the societal, like in the economic, all the math on the side of paying people to stay vaccinated. And this is what Australia does, by the way. So Australia does $8,000 a year if you are vaccinated your child. I think that's that's what we should do.
Okay, financially.
Yeah, you pay people. You pay people.
So, right.
Basically, what it does. The only problem is that basically people that are they do see the poorer you are, obviously they're going to get vaccinated immediately. But the richer you are, you actually have some fallout there. But the rich people are not a lot of higher percentage of the population, so that doesn't really matter that much. So you pay people, and they're going to get that money.
Right. So it sounds like education is really the best route here then. Just trying to get people educated on, why they need to get this. And it's just really what you're doing here, coming out here. And I think it's great that you're coming out here. There's so many people that come in here, and it's actually, quite amazing to hear that it's almost the first time some people have spoken to a scientist as well.
It's a lot of people's first time. Yeah.
Yeah, it's really cool what you're doing.
Thanks,
But
man.
what was that you were saying? What was the vaccine that you couldn't get till you're 5 years old?
Well, so the impetus, the roadblock doesn't start until you're 5, like in California, for example.
Okay.
Um, you could go to preschool or TK or whatever, but going to public school starts at a lot of, it actually starts at like 4 for here for transitional TK. You actually start at 4. So, but yeah, that public school requirement starts, at a certain age. So I guess I wonder if we did the start, the first start programs, if they started at 3. I know my 4-year-old goes to anyway, we'll see.
Yeah, no, I
But
hear
my
you.
point
Yeah,
is,
that's very interesting.
that like at 5 years old is the first major roadblock to go into kindergarten. And so like, how do we, between 6 months and 5, especially if you have measles outbreaks happening, and you need to have the kids play, you need to have them go to the parks, you need to have them go to these areas, to the zoo, all that kind of stuff. Oh, okay. Thank you for saying that. Okay. So that's good. So 3. So then that would be 3 years old would be the start. But I mean, basically, in Australia, they start at infancy. The infants get vaccinated. And that's what we want. That is the real thing.
Right.
Yeah, there shouldn't be exemptions. There are no exemptions. It's nonsense. Like if you have an exemption, you don't need to be socially. We shouldn't even think that there's an exemption. Why would you need to be exempted from being healthy? That doesn't make any sense.
Right. I think what also impedes the what we're trying to do here is that this nation can't move as a singularity with many things. It has to be up to the states, really.
Well, that's why this program at the federal level to pay people to get vaccinated. Boom. That is exactly, and we really need it to be a nationwide thing. We can't. You're exactly right. We can't have Florida being an incubator for measles while we're all like trying to live as a society. I mean, we have to be united on this stuff, and it's honestly like I don't understand. I think that being unvaccinated is unpatriotic. It's anti-American. You're anti science, and which is the technology. We are really the technology leader of the world on this stuff. So you don't even understand. If you're anti-vax, you really don't even understand why the United States is where it is and why we are such a huge economic player in the world, which is insane. Obviously, it's extremely selfish. Yeah, but yeah, I don't think that you can ever be any of that stuff. But
that's terrible. They're even messing around with the measles one. I mean, that's just common sense.
They're all common sense. That's the problem, is that like we've kind of like this is like something that is such a no-brainer. And to be honest with you, dude, like I've thought that I would like the stuff that I do, like the science that I do as a molecular biologist, and the genetics and CRISPR genome editing and all that kind of stuff. That's what I thought that I would be talking about as a science communicator, my entire life, man. And like the idea that I'm advocating for vaccines, that I have a vaccine ticker above my head right now, not the amount of people that we have saved from like a genetically modified, thing where we've cured people of a disease with gene therapy, or that's what I thought I would be talking about, like genuinely. And now,
so it seems like it's actually uncommon sense to most people then, in this case.
Ruben, well, why should someone's fear dictate my life? Bro, you're the one that lives in fear. You need to understand this. You are the one that lives in fear because you live in fear the things that you don't understand. That's the thing. Unvaccinated people live with the most fear because everything that they don't understand, they're fearful of. And that's all of science. That's everything that they can't understand. All the types of vaccinations, all the types of diseases, they literally would rather put their heads in the sand and bury their heads and be like, there's no viruses. There's no viruses. Viruses aren't real. Viruses aren't real. Rather than understanding that viruses are real, that we actually have, so anyway, I guess Amma wants to talk. So
Yeah, no, that's fine.
Thanks, Glacier. Thanks for coming on, man. One day we're going to talk about algae, bro. I can't wait to
We
talk.
will. Yep, no problem. Yeah. No, thank you for having me up, and thank you for having the discussion.
Thanks, bro. Thank you, man. Appreciate it. Hi, LT. How's it going? Emma, what's up?
What's up? What's up? Can I ask first and foremost, what's your background with respect to vaccines, and why are you so confident, other than, you know, how you've been taught in medical school as to their efficacy and
I haven't been to medical school. I'm a scientist doctor.
Okay. Okay. So where does your confidence in vaccine products?
What's your background? What's your background?
Well, I'm asking you first.
Well, we're getting to know each other, bro. I mean, what's your background?
Well, I'm just a human being.
Oh, okay. What's your education background?
Well, I have a chemistry degree. I'm doing a master's in computer science and AI.
Okay.
But I
Cool.
don't like to rely on my educational background. I like to rely on the rhetoric and challenge that.
Okay. I just wanted to know. I mean, we're just getting to know each other, so it's okay.
So you said you're a scientist doctor. So, like, how does that pertain to vaccines?
I have a microbiology PhD.
Okay. So can I ask you, right? So do you perform the process of virus isolation?
You don't think viruses are real?
No, I'm asking you, do you perform that process?
I have, yeah. People have. I mean, I haven't personally, but yeah. I mean, I know people that have worked with adenoviruses and stuff. Yeah.
So you know how that process works?
Yeah, it's called Koch's postulates. Yeah.
Yeah, I know about that. So,
all right, can you explain them to me?
Koch's postulates. Off the top of my head, I can't remember each part, but essentially, it's what you would use to establish that something has been isolated.
How would you do it? Let's talk through it.
Well, I actually had a line of questioning that I wanted to go down.
I know, and that's what we're talking about this now. So, what are Koch's postulates?
You're kind of deviating away from my challenge. My challenge is
listen. I will talk to you for hours right now, but we're gonna go step by step, and we're gonna talk about things, and we're gonna see. You said you knew, and you said how I knew what they are, and we're gonna talk about that. So we're gonna go step by step, and we can be here for 2 hours, bro, 3 hours, whatever it is.
Perfect. So, I mean, would you be willing to answer my question? Then I can answer your question.
You talked about Koch's postulates. Can you explain to me what Koch's postulates are?
You actually brought up Koch's postulates. I said I'm familiar with them, but I can't remember.
Well, you said, have you ever like isolated a virus? And I said, yeah.
No, that's what I want to get into with you about the process of isolation.
Yeah. Okay.
So in this process.
So you don't know what Koch's postulates are?
No, you tell us what Koch's postulates are.
You said no. You said you were talking about them.
I clearly said to you that I'm not familiar with all of them. Like,
well, I know, but all of them will explain to me what you know. So let's talk about it. What you know.
It's Koch's postulates. Is it Robert Koch, I think? And it comes from it's certain things that you use to determine that something has been isolated. So you would say, like, I can't remember exactly what they are, but if it satisfies those criteria, then you would say that this thing has been isolated. This thing has been shown to be an independent agent.
Okay, that's the first thing. There's 4 steps. There's 4 main steps.
Yeah, I'm not going to sit here and say that I know something that I don't know. I'll say that.
Okay. All right. Well, let's just think through it. Let's just think through how you would actually ascertain to make sure that the virus is actually connected to a disease, and what you would do in order to prove that. So let's just think about it.
My issue is that with the terminology. So you are denoting something virus. That's why I think we should go all the way back to isolation.
That's what we're doing, bro. That if you just listen to me and you just follow me, I'm literally talking to you about it, and we're talking through it.
Hear me out. Prior to even establishing whether what you have satisfies Koch's postulates, we need to challenge what process you're doing to even come up with that thing that you're calling a virus, right? Because really, you're actually referring to a viral isolate when you call something a virus, right?
Okay. What is your definition of a viral isolate?
Viral isolate is the product of the virus isolation process, right? But isolation is really a misnomer because it's actually a manufacturing of a viral isolate through the process, right?
No, you're culturing it.
Exactly. So in this culturing process, you add numerous agents that are third-party agents, correct?
No. I mean, you're creating a fertile ground for it to be cultured, and it just grows.
By adding third-party agents, right? Like HEK, like monkey kidney cells, other chemical agents that allow, like you say, the culture to grow, right?
They add the virus to. It gets isolated. Yeah, this is the first step. So yeah, you find a disease, and you look and you see someone that has the disease, and then you try to culture the first yeah.
Really, you actually get a sample from an individual, right? Then you
Yeah.
add numerous third-party substances to this culture, and then the product of that process, after you centrifuge it and then you do the base sequencing and everything, the product of that is called a virus, and then it's said to have been sequenced when you get this viral isolate, and then you get a base sequence from this product of this isolation process, right?
Okay. Why do you think that that's an own for you? Like, you understand that, like, the thing that you're adding, you already know what the sequence is there. So you already know, you can take the sequence of whatever the cell is, and then you can take the sequence plus the virus, and then you can just compare the two, and the difference is like, and you do realize that there's like RNA viruses, so the RNA virus isn't going to come up in the sequencing of DNA. Do you realize that? Like,
I know, but I'm
oh,
asking.
you already know. Okay, that's nice. Sorry.
Because when you do the scientific process, you're supposed to control for variables. You're not supposed to be adding in third-party variables.
Damn, why didn't I think of that? Damn.
Yeah,
Shit.
yeah.
You're
I
right.
thought of that.
Damn,
Yeah.
we didn't think about that. I just need to tell people.
I'm not reading ChatGPT. If I was reading ChatGPT, I would have read off Cox posted this off the top of my head.
Dude, just talk to me. Talk to me. Don't read chat. Just
You're not answering anything I'm saying.
I'm engaged exactly what you're talking about, bro. You're not talking about anything. That's the problem. I'm listening to you.
To call something an isolation when you're adding in numerous third-party substances into it, and then taking the product of all of the different things you added. The substances you add include mammalian cells, other chemicals.
Okay.
How is that a scientific process when you're adding in third-party substances? How is that an isolation?
Because you're so ill-equipped for this conversation. I literally talked to you about the control that you would compare with the sequencing, and then you said you need controls, and you didn't even understand that I actually presented you with a control. So I literally did, brother. The idea of like the sequence being the cells, right? The cells, all the things that you're talking about that contaminate, right? Versus all of these things plus the viral samples, right? The control is the negative one. This is the negative control. And then this is the negative plus sample control. So that is your experimental. That's how it works. And then you compare those two, and you can check the sequences, and then you can confirm that there's a viral sample in there.
Okay, so where do you obtain the control from? By what process is the control obtained?
I mean, all these different viruses are going to be that there's what it matters what kind of virus it is, whether or not it's a sample with SARS-CoV-2. It's like you can get it from the lungs.
So you're saying you take some sample from a person's lungs,
Yeah.
then you do the isolation process. You compare the RNA from the sample you get from the lungs to the product of the isolation process.
You can, if you want to do molecular Koch's postulates, you can do that. Classically, when microbiology was first like confirmed, I mean, this is like 150 years ago. So people did it before that, obviously, but we can do that with molecular Koch's postulates as well.
You didn't say anything just there.
What?
Well, you didn't say anything of substance just there. You see, what you're doing is
Let me know.
reaching to individuals that can't see the challenge that's being put to you, and you're not actually responding to the challenge. The challenge is, this is the basic question: is the process of viral isolation a scientific process if it is adding in third-party substances? That's the question you're avoiding.
No, dude, I literally talked to you about the control that you would add. You would add the cells, and then you would add and you compare. Okay.
See, this is why doctors are charlatans, because what they do is they rely on the fact that they're called doctor and that they've been to the medical school, but they actually can't handle challenge. That even when you ask them, you can see that they're not good with rhetoric. You can see they're not good with deductive reasoning. They just repeat things that they were told, and then they say, well, I do it in a lab, I do it in a lab. You do what in a lab? Let's break down what you're doing. Is what you're doing actually scientific? Is it independent if you're adding in third-party things? If I take a sample, imagine I take a sample of
Bro, who are you talking to right now? Are you okay? Are you okay?
If I take a sample, no,
are you
not
okay,
a
bro? Are you all right? Are you okay, dude? Are you gonna talk to me, or are you just gonna like talk to yourself? Are you okay, man?
Yeah.
I think that
so,
you're, dude. I'm literally talked to you about the experiment that you would run and the control for your exact experiment, and then you said that I'm talking about unscientific. Like I'm never gonna kick this guy. He is going to cry and crash his app before he stops. He's gonna throw you're gonna throw your phone into the pond.
Really, am I?
I guarantee you will, brother. Let's see.
Okay. So
okay.
Let me ask you
here we
this,
go.
right?
Okay. So again, so you take your things and you put in your cells, and then the cells. That's the negative. The cells by itself, and then the cells plus the virus is the experimental, and then you sequence them. What do you think you're gonna get back? What's the expected result?
When you do a viral isolation.
What is the expected result if you do those two? What do you do? What do you do those two? Yeah, we're gonna go step by step, bro. Because you definitely need it. You definitely need me to walk you hand by step. Yeah, because you obviously have no idea what you're talking about. I don't even think that you're in a master's program. There's no way. There's no way. I don't think so, dude. So step by step. What are you gonna do? The cells versus the cells in the virus. What's your expected result?
Get a sample and add. If I take a sample, I'm doing a drug test on someone, and I add a third-party substance to it,
because that's
and
not.
I isolate something from that. Can that really be said to be an independent sample?
So you don't think viruses are real? That's what you're saying.
I think that viruses are the product of an isolation process in a lab.
Okay, so you don't think that viruses are real? Okay, we got to go down. Here we go. We got to go through the thing. All right, God, every time. Okay, so flat Earth. Do you think the flat Earth is real?
No, I believe the Earth is a sphere.
Okay, well, that's unique. 6,000-year-old Earth. Do you think that young Earth creationism?
I don't believe that we can establish truly how long the Earth.
There it is. There it is, guys. See, there it is. All right, so it's a young Earth creation. All right, so evolution. Do you think that evolution is real?
No, now you're trying to use straw man.
What kind of do you think that evolution is real?
Let me speak.
Do you think that evolution is real? Yes or no?
See, if you don't let me speak,
do you think that evolution is real? Yes or no?
Yes, I believe that evolution is real.
You think that microevolution is real, but you don't believe in macroevolution, do you?
I believe that evolution is real.
Exactly. So there you go. So God, dude, I just read you guys so well. I'm like in your head, and you guys, it frustrates you so much. So okay, so you believe in young Earth creation, that you believe in microevolution, but you don't believe in macroevolution. Do you think that dinosaurs are real? Do you think that evolution is? Do you think that dinosaurs are fake?
I think that we can't know for certain what.
Okay, so dinosaurs are fake. Dinosaurs are fake. Dinosaurs are fake. Evolution isn't real. 6,000-year-old Earth. All right, so what climate change? Do you think that climate change is real?
The climate does change, yes.
Okay, so the climate change is real, but humans aren't contributing to it, right?
Humans are not contributing to it.
Exactly, it's a natural cycle. Okay, so you don't believe in climate change. You think that dinosaurs are fake. You don't believe in evolution. You think that there's a 6,000-year-old Earth. Okay, and then are we in a simulation? Are we in a simulation? Or is there?
People have different perspectives on.
Okay, so you think that we're in a simulation? Do you think that gravity is real?
Can we address some of these points?
Do you think that gravity is real?
You're behaving like a child, right?
Do you think that gravity is real?
You don't. Actually
do you think that gravity is real?
Okay, so
do you think that gravity is real?
Are you going to allow me to speak and respond?
Do you think that gravity is real?
Narrative. Are you going to allow me to speak?
Do you think that gravity is real?
I raise a really.
Do you think that gravity is real?
You don't want to allow me to speak. That's the problem.
Do you think that gravity is real?
You don't want to allow me to speak.
I'm going to keep asking this until you quit.
Gravity is an observed phenomenon. Yes, it's a phenomenon that we observe. We denote things that we can observe with terms. That's how humans deal with anything.
Okay. All right. Wow. Okay. So you think so? Of all the scientific evidence and all the scientific consensus questions, the only ones that you actually agree with are the round Earth and gravity. So I'll give you that, dude. Wait.
You've just not listened to anything I said and not allowed.
I would literally. Okay, which one was I wrong about?
Okay, as I was saying, so when you were speaking about the the age of the Earth, the reason why I said you don't truly know how long it is because it presumes a consistent rate of radioactive decay. We don't know if the rate of radioactive decay for certain elements has changed in history. We can't know that. If we assume that the rate of radioactive decay is consistent, then we can say, yes, this is this old.
You're
this is
so
that
smart,
old.
dude. You're so smart. I'm so happy that we
can't
got.
know- we
I'm
can't
so
know
happy we got
things
the
like
guy
that.
that knows, understand what's going on here. I'm so glad that you're here.
See, this is the shaming, the gaslighting. But
Oh, you're cry bullying. You're cry bullying now.
You've run away from my
Oh, I'm
argument,
so
Howard.
sorry. I'm so sorry.
Mr.
You've been
Doctor.
coddled your entire life, bro. You've been coddled, and you've just been you're just spouting nonsense, dude, and you're hurting people.
Scared.
Yeah.
He got scared when
I'm
I gave him a
scared. What are you
challenge.
talking about, bro? You're crying. You're cry bullying immediately.
Look, he believes in young Earth creationism. I
Yeah,
didn't say
he
that.
does. You do. You do believe in young Earth creationism. You do. You said that we can't understand, ever know that the age of the Earth, bro.
I made a very valid critique of
No,
the
you have
idea
no idea what you're
of
talking
life.
about. You have no idea what you're talking about on any of this stuff, and you're actually acting like you know anything on, and you have any type of expertise.
Yeah, you don't want to let me speak. We can all see through.
Dude, I am letting you speak enough for you to hang yourself live on air, bro, and everyone can see you. And you are speaking just enough. Trust me, brother.
Okay, name one thing I've said that's wrong. Go on. You haven't been listening. You're an arrogant fool.
What are you talking about? You think that? I mean, you don't think the germ theory is real? You don't? Is the immune system real?
I didn't say that. The germ theory is composed of different things. I believe that bacteria and bacterial toxins can cause people sickness. I'm talking about viral isolation. That's
Okay,
the topic you don't really
that's what germs are. Viruses are parts of germs. Exactly. You don't exactly.
Viruses are parts of germ.
Yeah, they are. Yes. Viruses are parts of germs. Yes. Oh my God. Yes.
Viral isolates are pathogens in the way that they're said to be. I believe that bacteria.
Thank you for letting me know. Thank you for letting me know. Really, wow. The entire field of microbiology has been turned on its head. I'm so happy I know you.
Individuals like you, charlatans. It's like any religion. Any religious belief is populated by people who've studied it for years.
Yeah, I'm a religious guy. Yeah, I've heard this all before, dude. I've heard this all before.
The only difference is that they believe that everything they do is scientific.
Yeah, it's so unique.
All humans can be subject to fallacious beliefs, doctrinal beliefs, like yourself. Not everything in the medical field is immune to people being brainwashed or subject to doctrines. In fact, the whole idea of viruses comes from the concept of miasmas. Miasmas is not.
Please let me know.
Yeah.
Wow.
Yeah. So let me finish. Yeah.
Thank you. Please, I can't wait to know more. Please, I really need you to. Yeah.
Miasmas are not scientific. So people believed in this concept of viruses and how virology works prior to them actually having proof of it, because it comes from it comes from the idea of miasmas. Miasmas was not a scientific belief. So we know that the field of science can be influenced by people who believe in religious beliefs, people who believe in doctrines. We're all human. The field of microbiology is not infallible. There's things that they believe that, in future people may not believe them. So your attitude towards it is the problem. You don't want to accept that people challenge things and you have valid criticism. You believe that because you've been indoctrinated to believe something, that you must be correct. That kind of arrogance is not conducive to proper scientific inquiry. I've raised a very valid critique. How can something be a scientific process? You're adding in third-party substances. You're taking a product of a viral isolation and denoting it with characteristics that we don't know for certain it actually has.
Nonsense. I literally talked to you exactly through the experiment that would do this and the controls and everything. You just didn't listen. You didn't understand. You didn't understand what's going on.
That was not a proper response. What you said
shit. Okay, I gotta go tell the entire field of genetics, dude. Damn, I'm so happy that you're here, that you let us know.
Genetics is different from virology.
Whoa, what? You don't think that we can sequence the genomes of viruses?
We can sequence it. I didn't say we can't. But you're sequencing the product of a viral isolation process. It's the isolation process that's unscientific. The sequencing is a separate thing that comes afterward. Right?
What are you talking about, dude? What are you talking about?
Genomes can be sequenced, right? But I'm saying it depends what you're sequencing. You are sequencing the product of a process that is unscientific.
Dude,
and then
you realize that we don't no. Stop. You realize that we can actually grab the viral sequence from the patient itself. We don't actually have to go through that third party culturing step anymore. Molecular Koch's postulates can be completely in vivo now.
Yeah, you can get an RNA sequence direct from the patient, but again, that doesn't necessarily mean that what you're getting is the same as the viral isolate. It's not the same.
Wait. That shows that there is something third party on the patient.
It shows that there's RNA sequences in a patient that you can
No,
extract.
a viral RNA sequence that isn't there when versus the other cells or the other part. Yes.
The problem is the terminology. When
Where
you
is the
say
RNA
viral,
sequencing coming from?
listen. The problem is the terminology. When you say viral, you're presuming that this thing independently can cause disease, correct?
Yeah, it can. Yeah, that's
Okay.
well,
So
not
if
inherently. That's what molecular
yeah.
Koch's postulates are. That we can actually prove and
Yeah.
show that the same disease, when given to another person or another not you're not going to test it on another person because that would be immoral. But you would take it and put it onto a rat or a mouse or whatever model you would use. I think there are a lot of like possums and pigs and stuff like for human analogs. And then you test, and then you would sequence the same genome and see if they're matched.
Okay, so if you introduce this isolate to an individual and they don't become sick, would that mean that it's not a causal disease? It doesn't cause the disease?
I mean, correct. Yeah, if it didn't cause the same
Okay.
disease with the same symptoms, then yeah, it would not. It wouldn't be.
Perfect. So when you get the RNA from a patient, can you get RNA from a patient who's not sick and it be considered to be viral RNA?
If it's not sick, then why would you get it? Then why would you get it? No, why would
Exactly.
you do that?
That's my exact point. If you take a sample of viral RNA from a patient who's not sick, yeah, doesn't that mean that that RNA did not cause a sickness?
That's not going to be there. That's not how. That's not. No, that's not how it works.
What you just said about how you can get it in vivo, you can get it from you can get from an individual an RNA sequence. They can have the viral RNA, but not be sick. So how can you say that
there would be no viral RNA sequence there because they don't have the disease?
You've just failed, mate. You can be be asymptomatic apparently and have a virus. So that necessarily means that the viral RNA can be present, but you not have symptoms. So you can have the viral RNA. You can have the viral RNA.
Well, you were saying no. You said that there was an unexposed another person, a random person. But yeah, if they were exposed to a virus, then yeah, their viral load could be low enough that they did it. Yeah.
Listen to the question. How do you know that the viral RNA causes the sickness if a person can be asymptomatic and have that viral RNA? But then when you isolate it and inject it into a possum, you say, oh, that caused the possum sickness. But the viral RNA, when it was present in the individual, did not make them sick.
Because you can have different levels of viral load that causes a disease that then causes the sickness and the symptoms.
Yes, but if it's causative, are you saying that the only determining factor is the viral load?
One of them,
Okay. So how come if you introduce a smaller amount of this virus that doesn't, they don't get a certain viral load within them, right? How come that person isn't sick if the viral RNA causes sickness?
Because it hasn't gone through exponential growth yet, and it hasn't caused the symptoms.
Okay, so are you saying that viral RNA only makes a person sick after a certain point?
That's one of them, yeah.
After a certain viral load. Okay, so are there individuals that have the necessary threshold of viral load that are not sick with symptoms?
I don't think so.
So you're saying only people you're saying as soon as a person gets a certain viral load, they definitely have symptoms. Is that your argument?
Yeah.
Not correct.
Okay.
You can have individuals with significant viral load that are not sick with symptoms. You understand? So that shows that when you inject this isolate into a possum or whatever, and it becomes sick, that's not the viral isolate is not necessarily the cause of the sickness. There can be other things in the sample, toxins. It could be the introduction. It could be the way that the thing interacts with the possum or whatever that causes sickness. In fact, we saw this with the polio test that they did, like how they would take out a person's spine. They take an isolate from the spinal fluid. This is how they confirmed that polio existed. They took an isolate, they injected that isolate into another creature, and the creature became paralyzed. And they then said, this means that the polio virus causes the paralysis, right? But again, you can do this. They also have done the same experiment where they've taken the spinal fluid from an individual that didn't have symptoms of polio, and that also made the individual sick. So there was no presence of the so-called polio virus, but it also still made the individual sick. So we know that when you introduce viral RNA, it doesn't always make a person sick. So how can you say for certain that the viral RNA is the cause of sickness if it can be present but not induce sickness?
Dude, I don't like what is your point? I don't understand what you're trying to argue. Like
You
genuinely,
don't
you're
understand
so
because doctors, people like you, are
no,
not critical thinkers. That's the problem.
dude, bro. You're
You
trying
take
to like, you're
doxing, you
no,
don't understand how to critically think.
bro.
If you understood critical
You're
thinking, everything I said would
okay.
make perfect sense.
No, you don't like nothing you've. Okay, okay. What would be the hypothesis that you would test with a like? Explain to me the experiment that you would want to run in order to prove your theory.
Okay, so what you would have to do is introduce viral RNA without doing the isolation process. So you'd somehow have to get the viral RNA without doing the so-called isolation process and adding third-party things. And like you said you can do it in vivo and you can extract this RNA. You would have to introduce it to an individual the same way that it would normally be introduced, let's say an airborne pathway, and it would have to induce the same symptoms. Like you said, it would have to abide with Koch's postulates, right? That would be a way of proving that this thing caused the sickness, right?
It's not Koch's postulates. You're not understanding how to use that term. Don't use that term.
No, I am understanding. I'm
no, you
saying
don't.
that
You don't even understand what Koch's postulates are, bro. Okay. What are Koch's postulates? You know them so well. Then we're going to use them specifically. So what are they? We're back to this again.
Let's say I don't know it. Let's follow the same line of reasoning. The question you asked is, what test would you do? You would introduce this viral RNA, and it would necessarily make the subject sick, right? If it doesn't make the subject sick, surely you would then be forced to conclude that it's possible that the viral RNA is not the cause of sickness, right?
There's things that the immune system could attack it. There's like other different ways that you could have it that wouldn't necessarily make it so that the viral load is completely tied to it. Yeah, it depends on how the immune system responds. Exactly. Yeah.
Right.
Like
but
I don't
in
understand.
That particular experiment, you would be forced to retain the null hypothesis. You would not have proven for definite that the viral RNA causes sickness because
so then what do you think like was causing people to die from the pandemic?
The hospital protocols.
Okay, you're loony. You have no idea what you're talking about.
I'm a loony.
Yeah, you are. Yeah.
So you don't believe
no
the
idea.
hospital protocols can cause people's deaths?
Oh my gosh, dude.
You don't believe in ventilator-induced lung injuries? You don't think that's a thing?
Dude, I've looked into it and there's nothing that spiked.
Really?
No, it wasn't. It actually
ventilator-induced lung injuries are not real.
No. The pneumonia and the sepsis and all that kind of stuff. The rates weren't especially high during COVID. You're just wrong.
So you're saying that there wasn't a study in New York done that showed that they had an extremely high percentage. I think it was almost 90% of the people that they put on a certain ventilator protocol died, and they changed the ventilator protocol.
Okay, what is it? What's the source? Let's look it up right now.
Okay, let me get my laptop. So if I pull this up, then what are you going to say after that?
Let's look it up. Let's see what it is.
Hold on. Let's get it. I'm going to walk you through this, Mr. Doctor, because you're saying that all of a sudden ventilator-induced lung injuries aren't real, guys. That's a new one.
They're obviously real, but it's at the heart of the pandemic, and they're not necessarily realize
so ventilator-induced lung injuries are real all of a sudden. That's interesting. Let's get up the study. Okay. Oh, I've got to connect my Wi-Fi. Hold on. Do you mind if I just... I'm still going to be here. I'm just going to pull it up here on my phone. 1 second.
What was the thing? What was it? It was like respiratory associated. What was it? I know, seriously. Respiratory. What was it? Respiratory deaths for COVID. Ventilator associated pneumonia. That's it. Thank you.
So I couldn't find the original one, but I've got another study. So let me read out this.
What is it? Link it. Okay, so ventilator associated pneumonia.
It says among a certain number. I think it's around
I can't.
2,000.
What is the title and what is you can't when you're you can't when you're tabbed. I can't hear it. You have to.
Okay. 1 sec. I can actually go on my. Can you hear me?
Yeah.
Okay, let me pull it up on my laptop now. Oh, I found it. Okay, Washington Post. Here it is. This is the original one that I saw. So, in New York's largest hospital system, many coronavirus patients.
What is the title? I'm gonna pull it up too.
Yeah. So it's Washington Post. It's in New York's largest hospital system. Many coronavirus patients on ventilators didn't make it.
Okay, so you're not even bringing up a study, dude. Of course, we knew that a lot of people that are on respirators aren't going to make it because they're already on death's door, bro. That's why they're on a respirator. Yeah, that's how it works.
You can also die from ventilation-induced lung injuries as well. You can have collapsed alveoli. Yeah. That is a recognized thing, and it's reasonably high mortality as well. So one of the most risky things you can do actually is intubate a patient.
Yeah, but you know what? It's also they're gonna die. So they were going to die, and they were pushed in a little bit farther from death's door because of that. Yeah. Well, what was your so real quick, I mean, what's your solution to this scenario? People are going to die. They're grasping for breath. They're going to die. What was your idea?
For some, no. I'm not saying ventilators are all bad. I'm not saying that. Some people definitely need ventilators. But during COVID, they were putting more people on ventilators that didn't need to be put on the ventilators. So a large percentage of people. Right.
No,
I said 90%.
We looked into this with the study. No, we looked into the study, and they were actually less money was being charged than needed onto this. By the way.
No, I'm saying
we didn't have enough ventilators, dude. We didn't have enough ventilators in the United States.
Cool. But during COVID, the protocols were changed. A lot of people were put on ventilators that didn't need to be put on it. They were intubated that didn't need to be put on. That didn't need to be intubated. I know that it can be ventilators are used to treat acute respiratory distress syndrome, but some people were put on ventilators based on just having low oxygen saturation and being COVID positive. So I'm not saying all of them. I'm not saying everybody died due to ventilator-induced lung injuries, but a significant proportion of COVID patients were put on ventilators that didn't need to be. That's why you've got this study from New York. They even changed the protocol after they did this. Look,
that's not a study. You just have a Washington Post article.
Based on the study that I linked. Look, I'm reading it out.
What's the title of it?
I've read it out 3 times, mate. It's called "In New York's Largest Hospital System, Many Coronavirus Patients on Ventilators."
That's a Washington Post article. That's not a study.
I linked the study in the look. I linked the study. Let me get you the study right from the article. But I've linked it in the chat. You can literally go on it.
I'm trying to find it.
Let's see if they've put a source here. But you do concede that there must have been some people that died from ventilator-induced lung injuries, right? All we're arguing is the degree to which, the proportion of patients that died. But you agree that some of them died from ventilator injuries, right?
A small percentage, and that had that problem, sure. But it's the middle of the pandemic, and things are really bad for them, and things are already going poorly.
Do you think that in some hospitals they may have put people on ventilators that didn't necessarily need to be?
I mean, sure, in theory.
Okay, so we're actually agreeing on that. You're saying it's possible. We're just disputing the degree to which that happened. You're saying it didn't happen that much. I'm saying it happened quite a lot, right?
I don't think it happened a lot. I mean, I thought you're saying that it probably. I don't know. I looked at this, and it isn't more than what it was before. That was the whole point. NCBI, NLM, Gov. I don't understand what you're even arguing, dude. This is you're so you basically don't think that people died during the pandemic?
Not from a COVID virus, no.
Okay.
No.
So then what did they die from?
I think people had comorbidities. I think there was a lot of medical negligence. I think some people died because they weren't able to get proper treatment because of how overwhelmed the hospitals were. Yeah. And I think some people died of pneumonia.
Okay,
Yeah.
here we go. Here's a study. It's an actual study, not a Washington Post article. Thank you, Glacier.
I also
So
think it's
mortality
like-
of mechanical ventilated COVID-19 patients in traditional versus expanded intensive care units in New York. This is Nishikimi 2022. Okay, rationale. During the first wave of coronavirus's disease pandemic in New York City, the number of mechanically ventilated COVID-19 patients rapidly surpassed the capacity of traditional intensive care units, resulting in healthcare systems utilizing other areas of expanded ICUs to treat medical care, to provide
Yep.
medical care. Objectives: to evaluate the mortality of patients admitted to expanded ICUs compared with those admitted to traditional ICUs. Multi-center retrospective cohort study of mechanically ventilated patients with COVID-19 admitted to the ICUs of Greater New York City, yada, 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 between March 2020 and April 2020. Primary outcome was in hospital mortality up to 28 days after incubation of the COVID-19 patients. Results: among 1,966 mechanically ventilated patients with COVID-19, 61% died within 28 days after incubation.
Yes.
2% were transferred into other hospitals outside of the system. 37% survived in the hospital until 28 days or were discharged from recovery. The risk of mortality of mechanically ventilated patients admitted to expanded ICUs was not different from those admitted to traditional ICUs. Okay. So already it's like conclusions. Although increased hospital capacity for critically ill patients itself was associated with increased mortality, the risk of the 28-day in-hospital mortality of mechanically ventilated patients with COVID-19 who were admitted to expanded ICUs was not different from those admitted to traditional ICUs.
Right. So as you can see, a significant proportion of those patients put on mechanical ventilation died within 28 days, right?
But there's no criminal negligence, and they looked at all the different ways
Yeah,
that.
there's criminal negligence.
Well, that's what you were alleging. Yes, that's of course you
No,
were.
there's a difference between negligence and criminal negligence, of course.
Oh my God, dude, you're so pedantic.
Yeah.
It's just
No, that's not
insane.
pedantic. That's every lawyer just cringed at you saying that. There's a significant difference between negligence and criminal negligence. Criminal negligence has to meet the threshold of reckless behavior. So,
Oh, dude, he's a lawyer now too. Jesus, man, you got everything. I'm so happy you're here, bro. I'm so happy you're here. You're a lawyer. You're a scientist. You're a medical doctor. It's incredible. Thank you so much for being here for everything.
A total of 1,151 patients required mechanical ventilation. Of
Wait,
the
so you think that this
final outcomes were known? 88% died. So obviously I said 90%. Sorry guys, 88%, not 90%. So we can see that what happened in New York was that they were over ventilating patients. They were putting people on mechanical ventilators more than they needed to be, right? So that means that is a recognized thing that can happen. You understand? So I'm saying it happened a lot during COVID. I'm not saying it was responsible for all the deaths, but I think that it happened a lot during COVID. Anybody who's in this chat that thinks that didn't happen a lot, you're out of your mind. You're out of your mind because even your little hero here, Mr. Sorry, I'll just call you Mr. Greg because you know, doctor is just it means nothing these days because you guys are just charlatans. But even he accepted that people can be put on mechanical ventilators and die from ventilator-induced lung injury. So he agreed with me, guys. You know, is this your king? He agreed with me. And I'm saying it happened to a greater degree. Obviously, it happened to a greater degree because it was COVID, so-called COVID. So everybody was going, oh my gosh, I've got a cold. Let me go to the hospital with COVID. People were taking tests way more than they usually did. So obviously, way more people were being put on ventilators during COVID, which means way more people were dying from ventilator-induced lung injury. That's a mathematical certainty. More people being put on a machine that has a certain rate of people that may die, more likelihood of people dying from ventilator-induced lung injuries. Very simple. So, and then there's, of course, the comorbidities as well.
Yeah, you're just a contrarian, bro. You have no idea. Like, it's just insane.
I'm honestly at this point speechless. You just pulled up an article that literally came from the first 2 months of the pandemic in New York City, which I actually was there for and actually witnessed. And Northwell Health was overwhelmed with patients at that point. The fact that they put them on ventilators meant that they were so far gone. And at that point, you're at 88%. Is irrelevant because they were probably going to die regardless. For you to say that it was causal is absolutely fucking ridiculous, and you're a disgusting human being for even implying that. You really are. You actually
are you
are
God? How do you
disgusting.
know
He should
someone's
drop
going
you
to die
just for that alone.
on the ventilator? How do you know for certain? You don't know.
You're
putting them
the
on
one who made the claim.
You're
You're the
putting
one
them
who
on a
made the claim that
ventilator
88%
to
of people
try to
died on
treat them. It's
ventilators. It was
possible
caused by
that
there's no
one.
causal evidence behind that. You
Listen,
literally just made it
you
up.
don't know that they're going to die.
You
put
don't
them on
know.
the
Oh my
ventilator
God,
and
dude.
save them. When you put them on the ventilator and they die, a lot of those people die from ventilator-induced lung injury. Not all of them. Some people get helped by the ventilator. I'm not an idiot. I'm telling you.
You clearly are. I actually think you're a complete idiot. You're calling Greg a charlatan when you're up here peddling whatever fucking bullshit book that you're trying to push because you have a traumatic event of your daughter passing away and you want to use it to fucking peddle whatever nonsense. You have no idea how viral isolation works. You have no idea what Koch postulates are. You have no idea what basic scientific rigor is. You literally should not be speaking on anything related
Have
to
you actually
science.
made a proper critique?
You do not have a degree in chemistry. It's so obvious by the way you're talking, by the fact that you have no idea how to
If I
even
don't
do
have a
basic
degree, that
experimental
means
design.
that means that nobody's going to listen to me, right? If you don't have a degree, when I get my degree, I'm better than everyone else. That's what you guys think. Like we all starting to see through you guys. That's the problem. You guys are charlatans. We see through you. Everybody who can think critically, we see through. All you guys who say, "I'm Doctor This, I'm Mr. That." Everything I've said.
You're so triggered, bro. You're so triggered. It's so funny.
You agreed with me. You said some people die from ventilator-induced lung injury. All I'm saying,
It's super rare. Yeah, it's super rare. It did happen, and they did analyze it. It's called ventilator-associated pneumonia, and they did look at that, and there wasn't any increased rates, and they didn't.
No, it's not just pneumonia. You can also get ventilator-induced respiratory distress syndrome. You can get pulmonary hypertension from ventilators. Like ventilators can cause a lot of different issues in people. I'm not saying that they kill everyone, but Omar's suggestion that we always know when someone's going to die, and then when they
That was not my suggestion. Your suggestion was that there's a causal link between ventilation and people dying.
There is.
There's not. There's absolutely not. You do not understand how science works. Please, for the love of God, Greg, pull him down. He's literally at this point just like saying bullshit. I think an elementary school child would understand how to design an experiment to explain this better than this moron.
Do you disagree with
Calling
Greg?
you a charlatan when he's up here just saying
Greg
nonsense.
agreed that there's a causal link between people being put on ventilators and dying. He literally said that ventilator-induced lung injuries can happen. He even just said it can cause ventilator-induced pneumonia.
No, I'm talking about your 87% or whatever number you pulled out.
Yeah.
Which is not in the article. I still have no idea where you pulled this from.
I said there was two articles. One is this, the Washington Post. That was the other one that I found, and I even said that there's another source for the Washington Post. I'm not saying
I don't care about the Washington Post article. Where is the scientific research behind it?
Listen, I'm not saying all 88%.
You literally are. You literally are.
No, I'm not. I'm saying.
Oh my God, you are.
Why are you talking over me, sir?
Because that's all you've been doing this entire time.
Let me talk. Right.
Your little minions are in the chat right now, just like cheering you on as you're spewing nonsense.
Really? You haven't actually critiqued anything I've said. I'm not saying all.
I just did. Oh my God. Are you under-medicated? Are you over-medicated? Is something lacking in your life? Like, I'm so confused.
Dude. It's really sad.
Like, who
it's
are
really
you?
sad, dude.
Listen
I think
carefully, sir.
he's had like a traumatic thing that happened in his life,
and I feel
now
bad
he's
for
like,
him.
yeah, it's
I
really
honestly
sad,
feel
dude.
bad for him.
I'm not
It's sad,
saying
dude.
all 88%.
I don't know if that's what caused this, like,
Okay,
like dissociation from reality, but like he's clearly
You've got 2v1.
He's not
like
well,
lost
dude.
it.
He's not well.
Let me finish.
This is how he's dealing with the grief. You know?
88% of people, I'm not saying all 88% of those died from ventilator-induced lung injury, but some of them did. A significant proportion of them did.
Yeah,
If
but like
more
what?
people have
Like,
been-
bro, these are people. These doctors in the time that they have in the pandemic, they're doing whatever they can with the best things that they have. You know, and it's
I'm
like
not saying they're not.
I don't think so. I think that especially with you're blaming the NICU for your kid dying and stuff. Like I don't think that you trust medical professionals and you're spewing
the
this
thing
in order to demean
it's
the
not
entire thing.
negligence. I can make peace with negligence. It's the refusal to critique yourself. That's the problem.
There's
It's
plenty
not
of
that you guys
critique,
are
bro.
negligent.
No, see, this is the thing. You're
My
contrarian.
daughter-
You think this is the thing. Like the skepticism and stuff is like is one thing, but you're just being contrarian.
Listen. You can bring up my daughter. You can bring up names. Listen, my daughter wasn't killed on purpose. I hold no malice towards the people that killed my daughter. I'm concerned with the cover up. I'm concerned with the
there's no
refusal
cover up,
to
bro.
the refusal to critique. There is
There
cover
is
ups.
no. No, there isn't,
There are
dude.
cover ups. There are cover ups.
No, there's
Yes,
not.
there are. You're saying
No,
nobody.
bro.
So if there are no cover ups,
Oh my
why
God.
did the Health Secretary of the UK say that the UK NHS has a cover up culture? Why did he say that
I
to
don't
my
give a
face?
fuck about what some random
What?
person
Who
cares. I want the
cares? My God,
studies,
we're not
dude.
talking about
I want
these.
So there are
studies. I
cover-ups.
want scientific articles and all that kind
There
of stuff.
are
You're
cover-ups.
linking random things, man.
Deaths get covered up in NICUs often. Often.
Oh,
It's a
it's just so.
recognized thing. They get
No,
covered
they're
up.
not,
So
dude. That
don't
is so
assert.
What does
offensive,
that have to
bro.
do with
That's
vaccines? I'm so confused.
exactly
What
because
it
he
has to
doesn't
do with the
because he's so
conversation is that you're
conspiratorial,
trying
man. He
to,
has to undercut
what
everything,
you're
the
trying to
entire
do, what
medical
you're trying to,
system, the entire
yeah.
science.
I'm
Everything
not
has to
challenging
be
everything.
in
I'm
on
challenging
this
certain things.
grand conspiracy now, and it's just
You
like
got
it's
you guys are
sad,
charlatans.
man. Hurt
That's why you
people,
can't be
and he's hurt.
critiqued.
Like
You can't
he's
be
not
critiqued.
well.
You're
I'd call
trying to
him a charlatan, but at this point, he's
emotionally
just an
bait
idiot.
and
Like, I
gaslight.
Yeah,
honestly,
yeah, it's sad, man.
Yeah, I know you're trying to emotionally bait and gaslight, but at the end of the day, it
there's
doesn't
no
contend
emotional
with the
evasion
points
at
that I'm
all. I think you're the one at
the
this point
point
who's
that I made
chalking
is
up your
very
daughter's death
valid.
to some giant cover up, which is like
Oh no, my daughter's
absurd.
death was
Like, you
covered up.
just saying that is absurd.
No, it was covered up. We witnessed the cover
Okay.
up.
Okay.
My daughter
So was
died
it
as part.
malpractice or was it a cover up?
It was malpractice that was then covered up.
Okay.
The issue is
And a
not the
wider
negligence.
conspiracy in the UK healthcare system.
Well, listen. Actually, interesting that you raised that point because my daughter
I
died.
didn't. You raised it. I did not raise that
Let
point.
me respond. So my daughter died as part of the largest maternity scandal in UK history. It's called the Nottingham maternity scandal. You can look that up. So thousands of deaths were covered up in the Nottingham maternity scandal. So there are cover-ups, right? Of course there are. We know that there are hospital scandals. We know that cover-ups happen. Look, guys, at the end of the day, I'm not saying things that are completely insane. I'm saying with regards to COVID, you may disagree with me on vaccines. That's fine.
Bro, you don't believe
All
that
I'm saying-
viruses are real. What are you talking about? Of course, so
say that. I
like,
said
dude,
that.
so of
rant
course,
about,
so
like,
do
viral
you realize,
isolation.
like, think about it. Think about it. During a pandemic, if you don't think that viruses are real, then how are all these 1.2 million people dying? You think that people are killing them? Like that impugns your logical way of
medical
thinking.
negligence. It's
Exactly.
because
You
if
think that 1.2 million people died in the United States because of medical negligence, bro?
some of them died from comorbidities. Not all of them died from medical
Oh,
negligence. Some
so
of them
then how did those people die?
because some of them died from comorbidities, other diseases, and then they had COVID put on their death certificate. You
Okay, so
understand?
those are expected. Those are expected death rates, and we already have that. We had the 1.2 million
but
people died more
when
than
you-
that.
When you talk about COVID death rates, you are talking about a lot of people that died with COVID. We can't know for certain whether COVID was causal in their death. Remember, like you said,
Oh
we
my
don't
God, dude.
right? Think about it. So again, all I'm saying is during COVID, a lot of people died due to medical negligence. Not all of them. Some had comorbidities. I just personally don't believe that they were all killed by a virus. I just don't believe it. I believe that they died from medical negligence, comorbidities. Some of them.
Yeah,
Had,
because it linked into a lot of different things, and a lot of being overweight was linked to a lot of problems
yeah,
like
it's
that. Yeah.
convenient. COVID is linked to everything. As soon as you're able to put it on.
Yeah, it's a
people's death
neurodegenerative disease too, man. There's a lot of things going on with it. Yeah.
Yeah, biggest wealth transfer in history. A lot of things going on. A lot of
Oh
things
my
going
God.
on.
Biggest
So
wealth
that's
transfer?
oh my
Really?
God, bro. Okay, so now some
found-
anti-Semitic shit. Now you're throwing in some
Disgusting.
crazy
What did I
shit.
say?
You're really
You're-
disgusting.
Get out of here, bro. That is so gross. Seriously. Just fucking get out of here. Holy shit. Oh. Okay, Omar. Sorry, bro. I was so fed up with them. So I just wanted to. I know you.
Sorry. I was gonna jump on after just to say hey, but
Yeah.
he riled me up to the extreme. I cannot believe there are
Okay,
people like him
can you
out there.
find him and just ban him? We can't have people posting that shit. That is unbelievable. I'm sorry, guys. You link something to some Zog brain, it's all linked to that, then you're out of here. You're banned for sure.
Why ban? You're so do you understand the level of conspiratorial here
Yeah,
that we've
dude.
dealt with is this you're next level. It's absurd.
Yeah, dude. That's insanity, guys. He's not well, man. He's not
That
well.
was oh my God.
I was looking up ventilator associated deaths, and we have looked at looked at it before, and talking about the ways that people were billed, and that's the greater conspiracy, right? That this was some type of a cash grab that they could grab and just say, hey, we're going to put someone on a ventilator and we're going to get $40,000 from. That's that's the conspiracy. And
Right.
Someone linked the study. It was from the HHS itself, and they were looking at the billable hours and all that kind of stuff. And it was actually crazy. They actually underbilled for I looked up the study, the actual study, and their own executive summary that they build up, and they looked at it, and the problem was there was a mismatch, a $500 million mismatch, which in the span of a of a pandemic. I mean, it's like pennies, but then it was like they didn't charge enough hours on the respirators. So
Of course not. I mean, it was so chaotic at that point. That makes more sense to me.
Yeah,
I can't
exactly.
imagine that they're like, in the back just like scheming as their nurses are working like triple overtime shifts just to get through and like collapsing. And then you have people like your last guest who's just like spewing nonsense and just like pretending like none of this is real and downplaying it and talking about ventilators causing all these deaths and comorbidities, which even the word comorbidity means, of course, there was a link to it, like you were saying, like with obesity. Like, yeah,
exactly, man.
Like it still is a cause. Like, do you understand what the word comorbidity even is? Like,
yeah, exactly. I know, man. It's so crazy, dude.
I'm sorry, I couldn't jump down.
No, dude. I don't know if you've like jumped on voice before. I just wanted to say.
No, I haven't.
What's up?
I just wanted to say hi initially until that crazy came on.
Yeah, yeah, dude. I was trying to read another report. I'm trying. It's just like the idea of like a posthumous like retrospective analysis on the pandemic and seeing like what we could have done better, what we that makes sense, right? Obviously, let's do that. Like, let's try to under the auspices of like trying to have a better response. But the idea that like we're just going to impugn the same people that went through this, that's still a lot of like nurses and doctors still have PTSD, who we like actually threw them in to the front lines without PPE, and they selflessly sacrificed themselves and held their hands while all these people died, by themselves, man. They were like, they were sacrificing their own health and safety in order to be with these patients. And now those are the people that we come after, man. Those are the ones that are on the front line that are actually doing the work and actually trying to help. Like, that is insane to me.
Villainizing them is like the new thing on the right, and it's just like so disgusting to me. And like you say it's you're like that it's not patriotic at all to do that. And like it's so true. Like, how dare you go after the people that are actually out there like on the front line saving like US citizens and saying that there's some conspiracy behind like you think a nurse who's working like that to the point of exhaustion is trying to put everyone on a ventilator when there's already a shortage of them.
Exactly,
But,
man.
like, to what end? Like
Exactly. Well, there is no end if you're and I do think, man, that we have a mental health crisis in the United States, and honestly,
100%.
a lot of in the UK too. By the way, the UK was all down with us. We're like ranked 200th on deaths per capita and in the pandemic, and the UK is right there with us, which is wild. And it's because they have the same conspiracy culture. We have all this money going into our healthcare system, and I do think that these people have basically like AI or social media induced paranoid schizophrenia, where they can't like distinguish facts and reality. Like just some of the symptoms from paranoid schizophrenia, guys: delusions, fixed false beliefs that are not based on reality, such as believing that one is being followed, spied on, or harmed. Like that was exactly what that global elites thing that he was talking about at the end there, right? Hallucinations, sensory experiences that are not present in reality, such as hearing voices, seeing things, or smelling odors. Disorganized thinking and speeches, difficulty communicating clearly, making sense of their thoughts, or following a logical conversation. Emotional withdrawal, reduced emotional expression, apathy, or lack of motivation. Apathy. How many people have we talked to that just have a complete withdrawal of any type of like that guy? Like no sympathy, no
none at all.
The selflessness, the selfishness, the absolute
Kept
state
repeating
of
over and
selfishness.
over. He was the smartest person in the room.
Exactly.
It's like so absurd to like say like
another symptom, guys. Another symptom: suspiciousness suspiciousness and distrust, a general sense of distrust and paranoia towards others. I mean, come on. And the next one, unusual or bizarre behavior, engaging in odd or repetitive actions.
Yep.
I think genuinely, man, I think that we do have a mental health crisis, and this is what is happening. Why so many people are being pushed towards these conspiracies, because it's easy, and that is why I go through all of those grand conspiracies and why they hit so many of them, man. Because once one hits, then it just knocks them down like an absolute like domino, and they are embarrassed. They get embarrassed because they have to answer, and it's embarrassing to say.
Yeah, and there's like the cognitive dissonance that comes along with it, realizing on some level, like, wait, am I wrong? Am I extremely wrong? Am I causing harm through this disinformation I'm spewing? I mean, I would hope that some of them reach that point, but
yeah. Okay. All right, man. Well, I guess like we have some other people that wanted to get in here. So, all right, bro. Thanks for talking. Thanks for coming on, man. I appreciate you.
Thanks for everything. I mean, obviously, I enjoy coming to your live. I've been here a lot, so
awesome, man. Yeah, I appreciate you. Peace, dude. Have a good one.
Yeah.
All right, guys. I'm gonna get through all of you. Thanks. All right, guys. Friend of the stream. Appreciate you. What was it? You were embarrassing. It was you who wouldn't answer and sank into. Okay, that's fine, Deborah. That's fine that you think that. I don't know who was. You guys all kind of joined at the same time, so I don't really know. All right, we'll go with Rachel first. Hi, Rachel.
Hey.
How's it
Can
going?
you hear me?
How's it going? Yeah.
Okay. It's going all right. I'm utterly baffled, to be honest, by people who can spout just absolute utter nonsense, just bullshit like that. I started working as a CNA in the hospital in January of 2020 on a neuro unit where we saw mostly just people who were getting neurosurgeries, back surgeries, spinal surgeries, and we would have people who had strokes and things like that. And then COVID hit, everything got locked down 2 months later, and the entire rest of my education in the medical system was figuring out how to deal with COVID and holding people's hands while they died without their families present. And then to hear people say things like that, and I understand that he had an incredibly traumatic event. I have a son who's 2.5 years old now. He spent the first 8 weeks of his life in the NICU, and then at 4.5 months old had to have an open heart surgery to repair a defect in his heart. And so, a defect which is still residual, by the way, so we have to be especially careful with him, particularly during viral season. And so I don't understand how people don't understand. Like you mentioned the trauma and the PTSD that so many people in the healthcare industry have, and it's absolutely real.
Yeah.
I recently just had to take like 3 months off of work to be able to deal with my PTSD from all of that. And then from, everything that happened with my son as well, you just jam it all down to get through it to the next thing. But like we watched hundreds of people die.
Yeah, it's awful.
If not more than that. And for people to legitimately look us in the eye and say that it was all a hoax, or that it was all just people who were fat, or just people who had diabetes.
Yeah.
No.
That you were the ones that killing them. It's just insane.
Yeah, and that it was medical negligence. Like, can I just tell you that I worked like 5 and 6, 12, 16-hour shifts sometimes because we were so shorthanded and without PPE. And, all of us getting sick. Like, I had COVID. I didn't get it until November of 2021, I managed to stave it off. And actually, my husband brought it home from work. He worked at a gas station at the time. I ended up out of work for 10 weeks because I was so ill with COVID. And the only reason that my doctor thinks that I didn't end up hospitalized myself was because I was vaccinated. I don't understand, and it enrages me. It makes me so absolutely furious to hear people denying that it was real, to hear people denying that viruses are real.
I know, that's the one that blows my mind, dude. That's crazy. It is, well, because then it's like it all fits in, right? Why you have a vaccine, the global conspiracy of the
No, you
lab leak and
dumbass, the flu did not disappear in 2020. Oh my God.
I know. It's
We had people hospitalized with
it's crazy.
influenza at the same time. I would have you know, we had all sorts of people with all sorts of things still coming to the hospital, still ill with everything else. But a lot of people were being forced to stay home and dying at home because there was no way for them to get to the hospital and no rooms or beds in the hospital once they were there.
Yeah. No, you're right. I mean, it's gross, man. I hate it. I hate the science denying, like, and it gets us nowhere. That's what I don't understand with their whole thing. It's just a chopping down of science and anti-intellectualism and like what is the end goal? That's what I don't understand. Like science, like like as if scientists are the ones that are like the billionaires that have all the money and power and politics in your life right now. Like, give me a break, man. It's like it's just wild to me. I don't get it. The entire everything, just I don't know who you are, where you are, but look around. Just look around you. The electronics, all the things that you're listening to, me, like how, like this voice coming to you right now, all that process, the technology that was developed, like you've invested into it through your tax money for the last 70 years, you know, and the United States has, in order to make that a reality. And now we're going to bemoan it and take it down, that entire process for what? Like some like snake oil salesman that, you know, that doesn't think that viruses are real. It thinks that the earth is flat or dinosaurs are fake. Like, come on,
It's
man.
nuts to me.
What?
It's absolutely nuts to me.
What?
And like, you know, just as another example, I see a lot of patients who are in their 70s, 80s, 90s, sometimes clear into their hundreds. I was just talking to a lady the other day who had polio as a child.
Wow.
And now people are saying things like, well, that guy, polio wasn't a real thing. That's just something that everybody made up because possums didn't get it. I don't understand.
Yeah, it's exactly, it's that other guy, the naturopath thing, made the same thing. They go into the methods, and they, just because of one pedantic little argument that they think that they have like the hinge on, and then that means that the entire thing is gone. Like, guys, like, you know, a study from 200 years ago, it doesn't have much bearing on like modern science. We've kind of like proven that point again and again for it to kind of be there, right? Like we prove it like through, that's why I was talking about molecular Koch's postulates. Like Koch's postulates, like it is something that we, you know, used to have to do a lot of times, but now we can actually just do a lot of that molecularly, you know, with molecular biology, synthetic biology. So it's like, you know, the idea that, you know, it's, I don't know. It's just wild to me. It's just really, really sad. But there's a ton of people. Rachel, thank you so much for what you're doing.
Thank you so much for having me up. And I really appreciate the work that you're doing and trying to like speak truth to people. I really, really pray and hope that these people's eyes and ears and minds truly will be opened to this, because it's like, my son doesn't deserve to die because you decided that a virus wasn't a thing. And it's just insane to me that people have forgotten that all of this is dependent on us being a society and being kind to one another and doing things to help other people.
My wife was like, she goes like, I guess you're just going to have to like just talk to the it's literally gonna have to be me talking to each anti-vaxxer individually and having a 1 hour conversation. And then on top of that, it takes some people 3 times in order to actually learn something. So I'm gonna have to talk to each anti-vaxxer in the world 3 times, I think, in order for us to kind of like get through this. Maybe I don't know. Other than that, I
For
don't know.
sure. Well, I'll be doing it right along with you. So
Okay. Well, thank you, Rachel.
thank
Talk
you
to you
so
soon.
much. Have a
Bye.
great night. Bye-bye.
Okay. Okay. Voice in Velvet. Voice in Velvet. How's it going?
Hi, good. How are you?
Good. What's up?
Hey, so I was just listening to you, and seems like you're in San Diego. I
Mhm.
just moved from San Diego to Riverside last year. I worked in the immunizations department for a medical nonprofit.
Okay. Cool.
You might know about it, Champions for Health. I don't know if you've ever heard of them.
Okay. No, but let's check it out. What's up? Cool.
Yeah, so I just want to, talk from my own experience, and I just want to say that during my time there, I actually had the opportunity to speak to many nurses, and one of the things that I kept hearing over and over and over again was these horrible stories of how some of them even had to make choices about who is going to live and who is going to, not make it. And just these horrible, like 16-hour shifts. And I mean, I'm not a nurse myself. I don't have a medical background. I was a community health worker, and I did work in the immunizations department, and I got trained on vaccines and all of that stuff. But just with my very limited knowledge and my own experience in speaking to these people, I can tell you that many people were actually affected by this virus, that that a lot of people died from it. I had my own friends and a couple of people that I knew that passed away from it. And again, like, I just don't understand how people in this point in time can be just, in denial and say that these viruses are not real. Like, coronavirus was a thing before it was COVID-19.
I know, right? That's that's what's so crazy. Like like SARS-CoV-2, guys. Like there was SARS-CoV or SARS-1. SARS-1 exists, and like that where was the conspiracy on that? I guess, and it's just. It's just where have these people come from? Like that's what's so wild, and that's what I mean. That's what I think. It's a lot of it's a lot of it's. I think my thing is it's a Russian psyop that they've basically seeded all these bots with botnets with these people that come in and seed these. I think that legitimately a lot of the people in here might be real, because it's like too specific, and for them to kind of like know. I think that the people in chat are like the victims of this misinformation, and they see in a lot of their Twitter feeds or their maybe there are TikTok accounts. Everything is so much AI on this thing that there probably are viruses or fake bots and troll farms that are pushing this stuff, and people are falling for it because they see these fake stories constantly and that's like their that's like their cool thing that differentiates themselves, and that's why that they're contrarian, and they can fake like they have this. Oh, it's like I'm a really intellectual, and that's why these conspiracies are so easily shared on these things, right? Because this conspiracy is a way to understand a complex thing really easily, and so it's really nice. It's like, I don't have to worry about how viruses work or virology. Viruses are fake. Like, that's so nice. How convenient.
Yeah, it's what I was saying. Like, coronavirus was a thing. It was a real virus before it was COVID-19. Before it was a global pandemic. And one of the big things that I kept hearing, or like one of the most common misconceptions, I guess, about the virus or the vaccine, is that if you got the vaccine, then you wouldn't get the virus, right? But that's because people didn't fully understand that the vaccine was not going to prevent you from getting the virus. The vaccine was actually going to make it so that you wouldn't pass away from it, so that you
Yeah.
wouldn't get really sick, so
mean-
that your body recognized the enemy when it entered your system.
Exactly.
You know, a lot of people don't necessarily understand the like the way that these vaccines work, right?
Yeah,
And
exactly.
so
Like vaccine isn't a bubble, like the viral particle lands on you. It's going to go through the physical and then the trained, immune system, and it's going to decrease your viral load. So it does decrease the amount of viral load in your body. So that means it decreases the amount that you can spread. So it does help the spread of decreasing the spread. It's not going to, if you have such a small viral load that you were given, then yeah, it could completely take it away and you would not spread it anymore. But the idea that because it's not 100% for this exact thing, then it's completely bunk. Then it's just it's just they're trying to create these little chinks in the armor that they can kind of like undermine the entire system and invalidate everything, because that's how their brain works, right? They found one little thing in the conspiracy, so now everything is absolved. And that's why notice why that guy 2 times ago, when I was like, okay, explain Koch's postulates, and he was like, whoa, no. I have like you're interrupted. What did he say? First thing, you're interrupting my questions that I'm going to ask, my line of questioning. He has like this thing that he walks through that he tries to like catch someone in, and he thought he caught me in like some stupid thing, and now I'm a charlatan and I'm a fool, and all of science is completely bunked, and
oh my gosh.
and that's his thing, so that's how their brain works. And they don't, guys, not everyone's going to be an expert on everything. You got to just kind of like not trust the process necessarily, but you have to like ask questions and try to read and learn. But every expert in the world would have to be on this kind of stuff, and that's just not going to happen. So thank you, Voice in Velvet. Thank you for, I put that
Champions for Health.
organization, yeah, Champions for Health, in the show notes. So
Yeah. We're, just so you know, we were like one of the medical organizations that gave out the most COVID vaccines during the
Nice.
pandemic. So it was
Love
a
it.
big effort. And just one thing, I know that I run out of time. I'm not going to take like too long. I just want to say
Okay.
that I followed you. I hope you follow me back, because I'll tell you why. I am actually putting together a live. I have an audience kind of like yours, and I often bring on Trump supporters that are vaccine deniers, that don't believe in science. And so right now
Exciting.
we're currently planning a live that is just about the COVID vaccine, so I can let them know exactly, how the mRNA technology works, what were all of the studies done before the vaccines, because one of the things that they keep saying is like, oh, they kind of got the vaccine ready like in 5 days. Total misconception. So maybe, just maybe, you can join us for,
Okay. Yeah. I just followed you. So yeah,
Welcome.
let me know when it is, and I'll see what I can do for sure.
Sure. Okay, well, thank you, and excellent live, and
Thank you.
thanks to your audience, and awesome. Thanks.
Awesome. Thank you so much. Have a good one. Thanks for jumping on.
Well, of course. Thanks. Bye.
All right, guys. Sorry, guys. I don't know who's Marsha. Mello, how's it going?
Hello, how are you?
Good.
Well, can you hear me okay?
Yeah. What's up?
Okay, I just wanted to give you some good news.
Yes.
I reached out to that doctor. And just kind of good news for you after tonight. I think you need some good news to sleep on tonight.
Okay.
And tell the chat. It's self-pay. I'll figure out the money. But he knows a lot of people at the hospital I was at in Dallas. He has the contacts. And we've kind of chatted back and forth on private message. Told him you sent me.
Nice.
And as soon as I have the money in like a week or two, because it's like $300 upfront pay, he can get into my chart and go through everything, and he knows some of the doctors. The
Nice.
chief of, I went through a lot of the chiefs at the hospital, and he's like, I know those people. So he's like, if I can't help you, I can find other people that can.
Nice. Good.
So I just wanted to give you some really good news. And
Nice.
it's
Good.
just that networking, like who do you know that you know that you know? And he said the same thing. He's like, if I can't figure it out, which he's like, I'm excited about your case because this is a lot. But he's like, I can get you somewhere.
Nice. Exactly.
And so, anyways, it's just super exciting. And also, I wanted to tell you, since I lived in Dallas, I lived in Zone 2 during Ebola.
Oh, wow.
And so that was my really first awareness of, diseases and things like that. And I lived through that. And what was really weird in Dallas is when, the yellow tape, the people in suits, the tents, the whole thing going on, we couldn't leave the house. We have a certain time of the day where you could just walk your dog. They delivered meals. There was people protesting, saying it wasn't real, on the news. And I'm literally watching the news every night going, and then I look outside my door and going, there's people in hazmat suits.
Jeez.
And, huge tape and all this stuff is going on. And people were like, it's not real. So it was a very strange time. I think I had PTSD from that, not then add COVID, but it was one of the most surrealist times I ever lived through because people were saying it wasn't real.
Yeah.
And I'm like, I can't leave my house.
Yeah. I know,
So
it's so offensive.
Yeah, so I just want to let you know, I experienced that. But
Good. Well, thanks for
yeah, and once it'll be probably a couple months, but I will keep you updated, and I'll just probably just send you a message. But thank you. I just knew there was going to be someone out there can get me to someone that knows someone. So I just want to tell you thank you so much.
Oh, thank you, Marcia. Thank you for coming on, and I appreciate you, and it's so cool. I mean, this TikTok, this community is amazing. A bunch of scientists and physicians and a bunch of nurses, public health workers everywhere. They find us. The algorithm, they all gravitate because we're such public health advocates here. So, and I think it's so cool. I'm so proud. I wasn't genuinely, guys. It wasn't my goal of this whole TikTok thing, the vaccine stuff and public health wasn't that's where public health is, where science meets meets politics, right? Where we are actually better informing our lives and in better helping people, and that people gravitate here because of that, which is amazing, and I'm so proud of that. And I think because of that, we have people like physicians that we're able to refer Marcia to, and I think that's so cool.
Oh yeah, and just being no one helping me, no one no one, and I'm like, okay, I'm just gonna do social media, and I'm gonna try to, and I'm gonna put myself out there, which is kind of a weird thing, but you kind of have to, and just go. There's got to be somebody that knows somebody, and I just want to tell you thank you.
Oh,
and I'll keep you posted, okay?
Yeah, please, okay?
Okay, great. Have a good night. Thank you. Bye-bye.
Guys, front of the stream, Marcia Moore. Seriously, so thank you, Marcia. Thanks for coming on. Thanks for keeping us updated. So cool. She had a trial for her rare condition that was going, that she was gonna, there's cross country, she was gonna do whatever she needed to do in order to get treatment, and it was shut down because of Trump. It's can you imagine that, guys? Can you imagine that frustration, that level of just actually having hope taken away from you because of this idiot? And it's just so sad, man. It's just so sad. All right. Okay. I got M. Yay, Marsha, I'm happy for you. I'm so happy for you. M, how's it going?
Hi, good. How are you?
Good. What's up?
Okay, so first off, I want to say I'm new here. This is the second time you've come across my For You page.
Cool.
And thank you for being an advocate for public health and science and reason.
Thank you.
I was an ICU nurse for 4 years prior to COVID, and then I worked COVID ICU.
Wow.
And so hearing what that guy several minutes ago was saying about, you know, medical professionals during COVID, the way that patients died during COVID, is so incredibly difficult to hear because, you know, first of all, I think that there's a really big misconception about the way that the human body responds to large viral loads, and that COVID was a unique, isolated, you know, situation where that's actually not really the case. We see, so the way that people die of COVID ultimately is essentially multi-organ failure through a sepsis ARDS modality. And they oftentimes will just like shower blood clots all over. So they like
Wow.
simultaneously, you know, it's like there's the respiratory aspect, but there's also neurological aspect. And, you know, you just eventually go into multi-organ failure. And it's terrible, but it's not necessarily unique to COVID. That can happen from the flu, that can happen from bacterial overload, it can happen from a lot of different pathogens. But to hear that there are people that think that, first of all, viruses don't exist or that they don't cause illness, like that's crazy.
It's very crazy.
But second of all, like to imply that the ventilator is what killed people is so, like, I can't even wrap my head around that because we waited until the absolute last minute to intubate people purposely because we were conserving resources the best we could. And we also knew that, like, that was kind of the point of no return. Like, if they're getting sick enough to the point that they're gonna go on a ventilator,
Yeah.
they, you know, they're probably gonna die anyways. And so we want to let them be awake and not sedated on a ventilator for as long as they possibly can be so that they can have that last phone call with their family, you know, whatever. And so to imply that the ventilator is what killed them is just like, it makes absolutely no sense. That's
It's like
not how physiology works. That's not how physics works. That's not
it's like
that's not
going
what
to
caused the death.
it's like going to a fire and being like, wow, all these firefighters are showing up at these fires, guys. I think that the firefighters are causing the fires. And
Exactly.
you're like, no, it's like I'm pretty sure that's what's like. There would be more fires if there wasn't the firefighters. There'd be more deaths if there wasn't the respirators. Like it's like it's insanity.
Right. So, I mean, basically, you know, I'll leave it at that. Just thank you. You know, keep up the good fight because I empathize with people who have mistrust in the medical system. I really do, and I hope that that's something that can be on the mend. I want people to trust their physicians. I want people to trust their nurses and trust that we truly do have your best interests at heart, and we are always going to be advocating for your health and your safety because, like, that could be my mom in the bed. That could be myself in the bed one day. And so, of course, we like, we're public servants for a reason. And so to have gone through that and to have all of the mental and physical scars that I have from being on the front lines,
Yeah.
I will live with that forever. And to be like now crucified by what feels like 50% of the public is just like so disheartening. So thank you for what you do.
I hope, I mean, I really hope that, yeah, it was crazy. Like I remember, a family member was a nurse, and she is in, and it was like people were talking at the nurses stations and stuff. They're like, we're like going through some stuff. Like, wonder if we could get um, our nursing school paid for, like it absolved, like, you know what I mean? Like, this is like, we're like in wartime, you know what I mean? We were deployed right now. And it's, I feel so bad. And I'm sorry that what you had to deal with. And I'm happy that you're here. That's cool. That's awesome that we were showing up on for your for you page. It is really cool. And, yeah, thank you for what you do. I see you, and I appreciate you.
Thanks. Have a good night.
All right, you too. Bye.
Bye.
All right, guys. Fitness Nikki. And some of these anti-vax people were on the request. I just couldn't get to them, guys. What's up? How's it going, Tough Peach?
Hi.
Fitness Nikki.
Hi there. Thank you for the request. I just wanted to, I've been listening to your live feed for a few days now. I've been in wellness 38 years.
Oh, wow. Cool.
I'm not a doctor. I'm just somebody that's been invested in the health system for a long time. I've worked in hospitals. I've worked on mental health units. And I've worked in various industries. I just wondered what your thoughts were on Ozempic.
I mean, right now, I feel like it's morbid or obesity is so bad. People are so overweight. That I think that it's probably a huge quality of life increase for them. To go on it. Ideally, we wouldn't have to use it, but I think that for what it is right now, I feel like we kind of have to, and kind of like treat the problem and use it.
Okay. I've written 52 wellness journals that are being piloted by doctors at the moment to try and go down a natural way for people.
Okay.
I understand the complexities that people have with obesity, and I wrote an article back in 1997 about it. And obviously I've watched the wave come, and now I'm seeing a wave for the Ozempic, which I know people are desperate to get back to health. I just wondered what your thoughts were about people doing things naturally.
I mean, I'm not opposed to it, right? I mean, if it works, it works. But I mean, they've probably tried something already in order to, people don't just wake up morbidly obese, right? They've tried other things, and it's kind of like it's where they are. So I think that's the problem, that we have them. They are more morbidly obese, and how do we reverse that? I think that there could be, like when I'm cutting weight, like for jiu-jitsu competitions and stuff, like I drink green teas, I drink coffees, I drink, ways to try to help my to stave my hunger a little bit, drink a lot of water. But like, so that's what I do,
Yeah, I think a lot of it is that people haven't got the knowledge. There's a lot of mixed knowledge out there. And I think what my aim is to bring a knowledge map to them so that they can see through actual factual things of how they help the body. And obviously going back to the COVID vaccines and things like that, there's so many herbs out there that can help the body in a natural way. Do you not think that that's the best?
Yeah,
Can you still hear me?
Yeah, I can. I mean, the herb isn't going to be a vaccine.
No, but you can help, because obviously 80% of your immune system is in the gut. So you can help it with oregano oil. You can help it with glutathione.
Okay.
You know, there's lots of ways that people can do things more safely that's been given by the planet.
Okay, but more safe than it, but okay, safe, okay, but effective is what we're talking about too. Nothing's going to be more effective than a vaccine in order to eradicate a specific virus, right?
Well, things are specific, and I get that. I mean, I had a brain tumor for 36 years, and I got rid of it naturally. It's documented in the NHS. I've had 8 lumps in my body. I've got rid of 7 of them. One had to be removed. It was the size of a grapefruit in my stomach. But I have kept well, and I've implemented things that I've learned through obviously 30 years of research of so many things on the planet that naturally can help people. I understand that every case is individual, so I can't judge on that, and I can't say whether it's good or bad. But I just feel like I just wish people would turn to a little bit more holistic way so that they can heal themselves better. And
Do you
then
think that
obviously,
viruses are real?
I'm mixed, because obviously
Okay,
the
so
body
that's a
does
no.
so many different things.
All right, we got to run through. Sorry, we got to run through. Okay, do you believe that the Earth is flat?
Well, that's just a matter of opinion, innit? I don't want to mix people.
Okay, so viruses aren't real. Flat Earth exists. Do you think that the 6,000-year-old Earth is real?
But we're not talking about that.
Okay,
We're
so
talking about
6,000-year-old Earth, like if Earth is flat. Do you think that evolution is real? Do you accept evolution?
Well, like I said,
All right,
that's
so
not my
evolution isn't
conversation.
real. All right, dinosaurs fake?
No.
You think the dinosaurs are real?
They were real, yeah.
Okay,
I do,
all
yeah.
right, all right, dinosaurs are real. All right, climate change.
Yeah.
Are humans causing climate change?
Definitely.
Oh, okay. The vaccines are safe and
But-
effective.
I can't say, because I'll be honest, I've never had the vaccine. I
Okay,
never had
all
the
right,
vaccine.
Okay, do you believe in gravity?
It was just yes.
Okay, cool. All right, so we're just flat Earth, 6,000 years old Earth. Flat Earth, 6,000-year-old flat Earth. No viruses. Evolution isn't real, but dinosaurs are real.
Evolution's real.
Well, I mean, you think that microevolution is real, but you don't think that macroevolution and speciation happens.
Well, it's the conversation isn't really about that.
I
The
know.
conversation
No, it is. No, it
like
is, because we're
public
talking about scientific literacy, and we're talking about how, like, what can be accepted and not, and that's why it's probably one of the reasons why you think Ozempic is so dangerous, because you don't trust the science behind it.
Well, I was working on a project with it, and I came off it because I know I've worked
Moon
in
landing. That's a
manufacturing.
good one. We got to add that to the
No,
list.
it's
Yeah.
not.
You think the moon landing was real?
No, I don't think it was real.
I know. What evidence would make you trust science again?
Well, actually, my daughter's a science teacher, so I believe in science a lot.
I don't think you do. You can't. No. You can't have all those beliefs and then also say that science is real. You know what I mean? You can't. Words mean something. Words mean something. You can't. You're trying to steal science from scientists. You're even trying to. You don't think that viruses are real, and you're trying to steal the gut microbiome from microbiology. You know how offensive that is? I'm a microbiology PhD. The fact that you're going to try to use our research that we helped establish as and all that kind of stuff. You do realize that the gut brain connection, that the evidence for that is so much more tenuous than viruses being real, right?
I 100% am on the same page with you with gut and brain health. 100%.
No. I'm saying it's tenuous. We barely even we're just researching how that's connected. We don't know like how it is and what the mechanism is, versus we know that viruses are real.
Well, my family bloodline are full of pioneers. So I understand a lot about the body. I understand that memory is held in water. I understand a lot. I was around these pioneers.
No, doesn't. Water doesn't hold memory.
Yes, it does.
No, it doesn't.
It does. You will find out later on. It does.
Water memory. That's another one we got to add.
But anyway, it's about more natural herb. I mean, I don't want to.
No, it's not. No, it's about you not trusting science. That's really what it is. Like, why are you so against the entire scientific method and with the entire scientific community on this stuff?
I'm not against it. I never said I was against it.
You are, though. You are.
You're putting them words in my mouth. That's not what I'm saying.
No,
and I
you
want
can't.
to
You
be a
can't
nice
believe all that stuff and then also say like, "Oh yeah, I support you." It's like, you know, I hate soccer. I hate soccer. I'd never play soccer. I hate any type of game where you're kicking a ball in between two goals. I hate 11 people on each side, and I hate the idea of playing a game in front of all these people. And then you're like, oh wow, so you hate soccer? And I'm like, whoa, I love soccer. Actually, I'm the biggest soccer fan in the world. You know what I mean? It like what? What are you talking about? And you're like, oh no, I love soccer. It's just I hate that type of soccer. And you're like, well, that's what soccer is though. How can you love soccer but you love the game? Do you know what I mean?
Well, I think you've just taken it in a different direction.
That's
but
called
I'm
an
gonna keep
analogy.
open
Yeah,
to
that's the whole that is what it is though. That's what I'm saying. And you say that you love science, but then you hate the scientific method, and you cherry pick whatever ones and whatever beliefs you believe in, and then that's what you love about science, and that's not how the scientific method works.
That's not what I said. They're your words.
We went through all of these things, these conspiracies, and you believe over half of them. So I mean,
No, I'm not saying it. I think everybody should be open to believe what they think.
I know, and that's the
I don't
problem.
think
Is that that's not scientific? That's not scientific. You know, that's the problem. Is that it's not opened up to interpretation on whether or not viruses are real. It's what people can show and prove through the scientific method.
Well, look at Margaret Stopolopsky in Australia. She found the gene to help prevent cancer.
Okay.
So there's lots of things that we could talk about, but I came on here to talk about some natural things that
I know
would help people.
we did, and you did, and thank you for highlighting. It's just are you from the UK? I'm sorry, I'm trying to pin your accent, but I'm not sure.
Yeah, I'm from the UK, and I mean
do
I'm very.
Do you understand how badly our countries did? Like I'm in the US. I'm in San Diego, and like we did like rank 200th on like deaths per capita. We did so bad. Like there's so like, don't you have some like patriotism about like your fellow countrymen like dying at such a bad way?
I'm devastated for every loss of life.
I know it makes me sad too, but it's not because of like your ways of thinking weren't going to help anyone during the pandemic. It's because all this disinformation and all this anti-science rhetoric that people bought into made them not vaccinate, and it made them not take it seriously. They didn't mask it the way that they wanted to, that they needed to, or socially isolate or quarantine. And people were selfish, very, very selfish.
Well, the way that I look at it is a personal choice, isn't it?
It's not personal choice. This is the thing: is that you don't believe viruses are real, so you don't think that like you can spread it. But it's not just about you. It's not just about you. We live in a society where things you have a big impact on people. The way you live and what you do has a big impact on what it is. And the fact is that people not listening to science can kill people. It can kill people that are immune compromised. It can kill people during pandemics. It increases the cost of healthcare for everyone, because now we have to pay for measles treatments for $47,000 versus like a vaccine that's $100. it hurts our economy because these people died. It decreases our family dynamics because people are dying from preventable diseases. There is a cost. It's not just like, oh, everyone's gonna do what they want. It's not that way.
I appreciate that. And I'm listening to every word you said, and I've been listening for the last few days. And like I say, I'm not biased or unbiased. I mean, obviously, it's like the Ozempic. The Ozempic now is on the jab form. It's going to come out in tablet form. They're going to raise the price of it. It's causing people mental health issues. And that devastates me. I worked on the suicidal units in the NHS for 3.5 years. And I've written strategies now called Shields 2.0 that is to protect public health. So I'm not against what you're saying, and I don't want this to look like that. I want to stay open-minded to everything, and I think everybody should stay open-minded to things.
Okay.
But what I'm saying is,
I'm happy you're here, and we're not gonna. There's everyone's welcome to be in chat that believes different than me, and I appreciate you being here. And genuinely, I think that this is why I don't ban people in chat that disagree with me. And oh, thank you, Voice of Velvet. I hope that you continue watching. Like genuinely, I really do, and I hope that you can come in again in the future and we can talk. But
yeah, definitely.
Okay.
Can I just, because obviously when I came on, it was just to ask you about, because I'm so worried about people's health with the Ozempic.
Mm-hmm.
It's causing so many issues, obviously bleeding in the gut, paralysis, kidney injuries, gallbladder disease, everything, thyroid cancers. I'm worried about public health. I'm so worried about these people that are obese, that are just looking for a way out. And, they're going to these choices. I mean, there's going to be so many deaths ahead. It devastates me to think about the numbers that are going to be there.
Yeah, I don't know. I mean, I think that a lot of people are dying because of 400,000 a year die from obesity related illnesses in the United States. So it's like, I mean, that whatever side effects that Ozempic has, it's going to pale in comparison versus the actual comorbidities. And obesity is the number one killer. So it's I think that's going to be what it is. But thank you so much for getting here, Nikki. I appreciate you. And so thank you. I'm happy. I'm happy that you're open-minded to science genuinely, and I'm happy that you see yourself as scientific. And I hope that you find this place somewhere that you can go to with science questions, and that you get your science questions answered.
Yeah, I'm taking some stats from you. I'm very stats driven, and I am very much into science. It's not that I'm not. It's just that I just feel that there is some natural ways to try first. I appreciate if they're not working for somebody, then obviously they've got to look at other things. But it's just public health. I just care about public health so much, and I care about people, and I care about how they feel, how they think, and how ill they're getting. That is the main goal. I guess our goal is the same: is to help people with their health.
Okay, cool, awesome. All right. Well, thank you for coming on. I appreciate you. All right, take care.
I appreciate it.
Okay, guys. Habiba Ali. Thanks for coming on, Nikki. I appreciate you. I appreciate you being here, and I'd like to thank you for watching, and I hope you watch in the future. Hi, Habiba Ali. Five seconds. Okay. You can re-queue if you want. Heather. Hi, Heather. How's it going?
Good. How are you?
Good.
Good. So I joined when the guy was going off about the ventilators. And
thank you for waiting.
Yes. So as a NICU nurse,
Oh,
and
nice.
I'm at work, and I have access to resources. So I started searching to see if I could find what the percentage of ventilator associated injuries were. I guess it's kind of hard to estimate. They said it could be anywhere from like 5% to 24% because when you have someone with ARDS, how do you know it's not from the ARDS?
So the study that I looked at was basically studying the pandemic, that period versus the right before time. So it was like 2017 to 2019, and they looked at the rate and they found it was like completely the same. Like basically the pneumonia, PEP,
VAP, yeah, ventilator associated pneumonia. Yeah. So anyways, I looked because I wanted to see, obviously I'm a NICU nurse. We use ventilators a lot. We use like special ventilators, like high frequency jet ventilators, high frequency oscillating vents. And like those vents are actually the difference between a baby like surviving or not, or surviving without, and they can get lung damage, but it's also because they're premature.
Yeah.
So I was like, I can't imagine that it's that high. And how would you even estimate that anyways? So I work in a decently sized hospital, probably like 300 beds. And during the Delta wave, half of our census was COVID patients.
Wow.
Half, like 160 in the hospital in like a 300 bed hospital. Not everyone was in ICU, but we had 20-year-olds die. We had a 20-year-old, a 24-year-old, a 19-year-old. Like these are not people who have comorbidities. These are like basically kids that were in our ICU dying, So, but I have noticed as well the like virus denial. It used to be that it wasn't that bad, and then it was, oh, now viruses don't exist. We have babies in our NICU right now who have herpes simplex virus in their spinal fluid, and let me tell you, they're some of the sickest babies I've ever seen. So it's just I don't know if it's a lack of empathy, a lack of exposure, like it's too scary. And that's why there's denial there. Like, it's too scary to think that it's real and it could kill you.
Yeah, I think it's living in fear of things that you don't know. I think that's the biggest thing, And just want to this is the VAP, the study. So this is ventilator-associated pneumonia in COVID-19 patients admitted to intensive care units, relapse therapeutic failure, and attributed mortality. So this is an observational study in a network. So this is 2023 Henry Wiki et al. So this is the conclusion. The incidence of VAP, so this is ventilator-associated pneumonia. So this would be someone that is ventilated, right? They're on a respirator and they have basically that's causing they have pneumonia somehow, and it's associated with that, right? So the incidence of VAP, mainly late onset episodes, is high in COVID-19 patients and associated with an increased risk of death, similar to that observed in other mechanically ventilated patients, right? So they have an increased risk of death because they're on a ventilator. The high rate of VAP due to difficult to treat microorganisms, pharmacokinetic alterations induced by renal replacement therapy, shock, and ECMO likely explains the high cumulative risk of relapse, superinfection, and treatment failure. And if you think about it, those are all things like difficult to treat microorganisms. Like that's going to be something that you have a lot of problems during a pandemic, where you have things that aren't maybe like people are trying their best, obviously, to keep things as aseptically aseptic as possible. But obviously, during a pandemic, things happen. So it's like,
well, yeah, they were rationing PPE. They were doing it here too. We needed it. We had some COVID moms who delivered babies, and we had to act like the baby had COVID until proven otherwise, because we didn't know. We didn't know. And I think people need to realize that when these people first started coming into the hospital, we didn't know. So the doctor said, treat it like ARDS. It looks like ARDS, treat it like ARDS. So they would. Like, we didn't know. We don't have the hindsight. Did some people die from medical negligence and understaffing? I'm sure they did, but we didn't know. It's just like the kids who are in the hospital with measles right now. Do you think those nurses have ever taken care of kids with measles before?
Yeah, exactly.
No.
Exactly.
Like, we
It's a great
don't know.
example.
We come from a privileged place where we haven't seen it inpatient. Thank goodness, but now we're like, what do? We do our best. We're not trying to hurt people. I mean, they were talking about trying to like run 4 circuits from a vent so they could put more people on ventilators because we were running out of them. And especially like I worked briefly in adult ICU, but most of my experience is NICU. We don't just put babies on ventilators. Like, we're looking at arterial blood gases. I kept asking in the chat when he was on, I'm like, do you know how to interpret blood gases? Do you know how to interpret arterial blood gases? What levels are like, okay, what levels would you think, oh, it's time to ventilate this patient? He wouldn't know.
Yeah.
He wouldn't know what that looks like. So yeah,
it's
I was very frustrated. And then yeah, I know. Then he said, I think something anti-Semitic, and then it went, or it went that way or something. And then I was like, yeah. And then he was gone.
The global cabal all working together, trying. That's just like that's insanity. You know, I mean, I don't know. I don't know how to reach these people, because I do feel like they are so gone. Especially someone that's he literally is. It's a global conspiracy. Like, literally, it's a global conspiracy of all the healthcare workers now, all the scientists like are all in on this thing now, and it's like I don't know what has to happen in this person's life, because what you're asking him, like, legitimately, what you're asking him is to completely reconfigure how he sees the entire world. It's probably easier as an atheist. I went from Christian to atheist, and there was this moment that I did have to reconfigure my brain, right? Where everything was like, oh, I can explain it away with religion. And then now I have to like have those answers answered through science and reason. And now it's like, it was like a mind shift, right? Now think of this. Every single thing that it's ever existed in the world for him was by this conspiratorial mindset. And then now we're asking him to fundamentally start over, and then now understand how virology works, how microbiology works, how the earth was formed, how like evolution works, how like dinosaurs were, how fossils are real. You know, it's like, it probably is more of a mindset change than leaving religion. It genuinely probably is.
Yeah. Also, I know time's up, but just to know, I was in phase 3 clinical trials for Moderna.
Oh, wow.
So so we were double blinded when we started.
Wow.
And then, obviously they got emergency authorization, and then we found out. I had a feeling that I got the vaccine because like I felt it like that night. I got it, and then I worked that night. And I was like, I feel like I got it. And then I went back, and, there was 2 doses. And then when they unblinded us, meanwhile, we had already all got either the placebo or the vaccine. Then I found out that I, in fact, had gotten the vaccine, and I came in close contact with somebody and never got it. And I was like, I had to have gotten the vaccine.
Yeah, that's so cool.
They still followed us for 25 months. They still followed all of us. And then they gave us the boosters when that came out. And so, yeah, everyone keeps, the COVID vaccine deniers keep telling me I'm going to drop dead.
Any
But
day, any day, this could be it.
Here I am, still working, paying my bills. So
watch out. It's the infamous 5-year anniversary death. That guy.
Well, it was
Yeah.
this month. It was, yeah, it
That's
was
it.
September. It was September or August. Oh, we're past.
That's
We're past. It was August, I think,
it's
of
the it's the
2020.
it's the 5 year 1 month. It's the classic 5 year 1 month. Everyone knows.
Yeah. So here I am,
Dude, that's
thriving
so
despite.
cool. Well, thank you for being a part of science on that. That's so cool. That is really
Yep.
awesome.
Thanks for letting me join, and shout out to M. I know she was on there, the ICU nurse. She said it so beautifully. She
Nice.
talked, and I know she went through it in the ICU during COVID.
Mm-hmm.
So
Yeah. Dude, it's so cool. I love the well, Mrs. Dr. G is a NICU nurse as well. So she's getting her
okay.
DNP. So we're all I think it's so cool. I think the NICU is a really cool place. So thank you for what you do. I
All right.
appreciate you.
All right, thanks. Have a good night.
All right, have a good one. All right. Jen Cat. All the nurses all filed in after that after that gag. I love it. I think it's so cool. I know. It's so
Hey,
cool.
Dr. Greg.
Exactly, Omar. It's so cool. Like we just have this community of people that love public health, and you guys commit your lives to it. So you guys are all excited to contribute and be here, and I love it. I appreciate you guys.
How are you?
Good. How are you?
I'm good. So, I just wanted to say that if there, with the VAP, the
Mhm.
ventilator associated pneumonia,
Yeah.
that's for anybody, right?
Mhm.
Anybody that goes on the ventilator is at risk for VAP. And one of the things that people don't understand is that patients with ARDS that were in COVID related ARDS were pronated. They were face down. And I don't know how anybody, if anybody works in the ICU, they know how hard it is to do mouth care in a patient that is pronated up, down, or in a rotoprone bed.
Okay.
Because the number one way to prevent VAP is by doing Q4 hour mouth care with chlorhexidine.
Okay.
And so the other thing is that a lot of these patients were on BiPAP till they couldn't do that anymore. And you can aspirate bacteria so that they already had seeded the bacteria into their lungs before they were ventilated, causing the VAP, right?
Mhm.
And then once they were on the ventilator, that's when those, cultures were taken, and when they first were intubated. So you have somebody who had been aspirating all this saliva, and then you have them pronated down. You can't do mouth care. Of course, their lungs are fragile. You have high PEEPs that can cause barotrauma. I
Mhm.
mean, there are a lot of patients that didn't do well just because the odds all stacked against them, but it's not necessarily the ventilator that was doing it. You know what I mean? There's just
Yeah.
so many factors.
Yeah.
It just sounds really cool when you don't know enough that you think, oh, it's the ventilator. Well, no, it wasn't. I mean, I don't know. It just makes me so upset because it scares people into going to the hospital and not trusting the people that work their whole lives to save people.
Exactly.
It's like, we don't want to hurt people. We're not in the business to hurt people. We're in the business to care for people.
Exactly. And that's where these the conspiracy of the billing hours, and you guys got paid, the $40,000 per patient comes from it. Always it's like this skepticism for people doing things selflessly because they can't imagine themselves doing anything selflessly, right? It's always like this, they must be in it for the money, they must be getting paid, because it's just how selfish people are constantly thinking. So
I actually held an educational course for the people in my community with 2 ICU doctors yesterday. And people were really like, how are we not knowing this information? And that actually came up with the billing. And what people don't understand is the people that do the billing never see the death certificates. The death certificates are filled out by the physicians. And then it has to go to the medical examiner. And then it has to go to all these other places before it's given to the family. And so for them to say, the cause of death was COVID, no, there are some people that came in with COVID and then they developed COVID in the hospital, that might be a contributing factor. But as far as the death certificate knows, the people in administration and billing and stuff, they never see the death certificate ever.
Yeah.
So how would that work exactly?
There was like an Office of Monetary and Budget thing that I read it because we've gone down this conspiracy a couple of times, and yeah, they were billed not enough for the hours. Like they were actually underbilled. So that whole idea that people were making bank off of like charging these billing hours for the ventilator stuff, it's just nonsense. It's wild to me. I don't understand. I don't understand where people get it, but it's just like something that's pushed and people hear it a lot said, so they just assume that it's real, and they don't understand the mechanics of how it actually happens, I think. Obviously.
Yeah, and then the one thing that I heard that really scared me yesterday was that the Trump administration is pushing to make the ivermectin over the counter.
I saw that. I know. When all those people that were actually, because of the toxicity, they would show up and they overdosed on ivermectin.
Yeah, and then we would have to throw them on CRRT or hemodialysis because they went into complete renal failure.
Jeez.
Oh, but because they went to the feed store to get, and not they got the freaking cow dose of it instead of the human. I can't.
I know, it's so frustrating.
And it just makes me I'm going to say one more thing, and I know you have other people, but what makes me upset is that these conspiracy theorists, they end up getting sick, and then they want us to save them with everything and every medication, everything possible to save them. But had they just taken the vaccine, it would have prevented this from happening.
Exactly. I mean, think about all the people, the stories of the people right before they go on the ventilator. Their last breath is like, "Can I still get the vaccine?" It kept happening. It's like, it's wild. And they did. A lot of those nurses actually did give them the vaccine because they knew it was just like, well, you're so far gone, it's not going to really do anything, but it helps them. I think think that they've done everything, it gives them some ease. Yeah, exactly. Mane and Tail, guys. Mane and Tail is a perfectly good shampoo and conditioner. It has a really good, cheap, it's really good. Check it out. Anyway, thank you, Jen.
All right.
Thank you so much.
Thanks, Dr. Greg. All right.
Have a
Talk
good
to you
one.
guys later.
This is Dr. G was joking because I got like a gallon thing. It was like, guys, it was like $15 for like this huge gallon. Lasted me for like my entire grad school years. It was like 5 years. It's just like 1 gallon of the biggest shampoo and conditioner thing you've ever. It was horse sized, and then it didn't have a pump or anything, so I got these big ketchup pumps. It was just like the big ketchup pump. And it was incredible. It was incredible. It was. Oh no, it's not a 6-in-1. Idiot sandwich. Oh, hey, there you are. How's it going, idiot sandwich? Maybe fell asleep. Might have fell asleep. Okay. I think idiot sandwich went away. Well, guys. Well, a lot of those anti-vaxxers they all popped in. There was like a queue of 10 people, and I saw they were on there, and I just went through the ones that I could find, but I knew we were running out of time, so I was trying to keep it on. Yeah, they all ran. So before we go, any vaccines, guys? Can we do one last? I would love to have Peter Daszak on. I think the Eco Health Alliance is awesome. So I have nothing against them. So yeah, they do good work. So yeah, I try to, Jamie. I try to because of I try to a little bit. My puppy got their vaccines. Mego, that's crazy. Since now, with now rabies on the rise because everyone's vaccinated. Everyone's not getting vaccinated. Oh, Jamie, we count it. Yes. Yes, if families that get vaccinated together stay together. So we count that. We count that, guys. That's another one. 66. Ready? 3, 2, 1. Yes. Yes, 66. Jamie's husband, guys. Good job. This is it. MAVA. Make America Vaccinated Again, ladies and gentlemen. This is what we do. This is what we do here. Hello between the lines. Welcome, welcome, welcome. V for vaccines. Get your V's in chat. Boom. Love it. We love it, guys. That's up to her. That's up to her. I'm down. She can if she wants. We actually, when my first iteration of the show, back in like 2021, the idea was that she was going to be off camera and like asking me questions because like we always talk science and stuff between one another, and I wanted to capture that kind of thing where I'm just like talking to her. And but yeah, so that was an interesting. Yeah, it was a cool thing. Yeah, it was like exactly. It was like a 2021 science communication podcast. Man, if I only had those videos. So crazy. Deborah, we have time. We have time. Got it. Get on. Get on. Request up. How's it going? We got time. I'll stay on just for you. Wait, I'm waiting. I want to request up. I'll find you, Deborah. Do you want me to find you? Here we go. There you are. I requested Deborah. All right. I sent her an invite. Let's see. No, shit. No. Yeah. That's how all you guys are. How all you guys are. Oh, Gaynor. Gaynor's invite sent. Let's see. Dude, Gaynor's been here the entire time. 4 hours at least. He's been here the whole 5 hour stream. Nothing. They always run. All right, guys. I think that might be it. See, I took 2 naps today. I was all excited. I'm all amped up. Cool. Thanks, John. Thanks for listening, dude. Well, that's very selfish of you, Kim. I'm glad that I don't know why you're bragging, but okay. Oh, thanks, Zora. I appreciate that. Okay. Yeah, I'm just saying too that you're selfish. It's okay. Oh, nice. Lindsay. Hey, Lindsay, if you want on the Discord, if you want to get on there, or if he wants to talk with the scientist and see what it's like or anything, if he's interested in becoming a scientist, we can connect and yeah. I ask questions. I've like been toward high school kids and undergrads. Anyone, you guys have kiddos that are interested in science or something? You want them to ask and talk to a scientist, so it doesn't have to be on here. It's on the link tree. It's in my profile. Yeah, it's in my profile. Yeah, of course, man. Real quick, I guess we can do this and get you guys the link tree. Boom. The link tree. This is where the Discord is. Boom. Oh, thank you, T Smalls. Thank you. Appreciate that. Yeah, Mrs. Dr. G getting the shout outs now too. That's true. Jay Shellerman. Thank you, Renee. The latest subscriber. Thank you guys so much. Really appreciate you. Jay Shellerman, so kind tonight. Thank you so much. Melanie, Sarah, and Melanie's also a new subscriber tonight. Thank you guys so much. Sarah and NB, Maiden, Omar, Stars, Renee, T Smalls. Thank you to all the likers. I appreciate you guys pushing the stream for other people. Thank you so much. Omar, NB Kami, Lefty Left, Jen, Rachel, Brandy, Happy One. Oh my God. I'm somehow hit for inactivity. Alina, Carrie, thank you guys so much. Guys, the link tree has my YouTube. So my YouTube has been revamped. My YouTube has been completely revamped to have all my stuff for like highlights. So it's all the highlights. So the biggest, the best conversations that we have, or I'll go there. And those are the good ones. The creme de la creme. Not everything gets there. Not everything. You have to be, it has to be a really good conversation. So I don't know if anything today will get made. I usually like is like a really thought provoking one or something that I'm like really memorable at. I usually don't just post any of them. So yeah. So that's it, guys. I think we did it. That's it. It's done with another one in the bag. I think we went up like a ton today. Up to 66. I love it. Our vaccines. It's not me. It's our vaccine. Okay. Fun fact of the day. Fun fact, a vaccine fact. Vaccine facts. Vaccines save 3 to 5 million lives every year globally. 3 to 5 million. Isn't that incredible? Because there's that many vaccines that would normally kill us, guys. And vaccines, Vax facts. That's awesome. That is so good. Vax facts. That's a good one. I like that. Vax facts. We're changing that. Ready? Vax facts. Ready? 3, 2, 1. Magic. Vax facts. That's good. Nice. That's a good one. Why would I get rid of VAERS? It's a scientific thing. I love how people. This is so funny to me that people like the CDC pushes out VAERS. They know like scientists use VAERS. It's so funny that people think that that's like unowned. Just kind of like highlights their knowledge level of lack of knowledge. Vax fact. I love Vax fact. A good one. Dude, the amount of bots that we get now. We're getting. Oh dang. Do you think C19 will be like the flu where there is a new C19 every single? Yeah, for sure. Yeah, it's gonna happen. It's going to mutate. It's going to spread to other things. It's going to recombine with other coronaviruses that we have. So yeah, it's going to constantly happen. Mm-hmm. No, he didn't. Deborah. They didn't die from the jab. No. Gaynor, being here all day. Thank you. All 5 hours. 5 hours streams, Gaynor. I appreciate you. That's crazy. I know. It's crazy. Wasn't like this when we were at 5 to 10. I'll tell you that, guys. It wasn't like that when we were 5 to 10. It's incredible. It's incredible. The amount of people. Thank you, Jamie. Thank you. The amount of people that love and support the stream is so cool. Yeah, for sure, Maiden. Definitely it. Yeah, right? We're trying. Well, guys, I think we did it. I think we're finally reached herd immunity. Everyone's been perfectly educated in science, and I don't think we need to do another one, right? I think this is it. This is the last show. So unless there's another person that needs to have that needs to be educated, or if there's one other person out there that needs to learn about science tomorrow, I guess. Right? Oh, thank you, Deborah. Thank you for that. I love it. I love it. Deborah, you should. That's right. Well, I guess so. Unless, I think that's it. I think that's all she wrote. I think we're done, guys. I think we did it. We did it. We did it. Everything's done. The final episode. Everything's all, we did it. Fixed it all. Unless someone else wants to show up tomorrow and you guys want to do it again. I don't know. Unless there's one other person. Unless there's one other person in the world that wants to come here tomorrow and we can do it again. I don't know. Do you want more science? Jenna wants more science. All right. If Jenna's going to be here, I'm going to be here then. Okay. All right. Fine. If Mrs. Dr. G wants some, we'll do it again. Fine. All right. I guess all right. Helen's going to be there. Oh, Renee's going to be there too. All right. Okay. Oh, Annette's going to be there. T Smalls, you too? Oh my gosh. And stars. All right. Well, I guess that's another show then. I'll see you tomorrow. See you. I'll see you tomorrow. See you. Vaccines are safe and effective. They work. They do. RFK's an idiot. He was really, it was really bad, guys. That was really bad. I can't believe he did. It was wild. I can't. Well, anyway. Sorry. Stop. Okay. All right. We're done. Shut it off. Okay. See ya. Bye. V's in chat. See ya.